Yes, yes. First of all, we start with isoenzyme. Isoenzyme, different forms of enzyme which catalyze the same reaction, which catalyze the same reaction. So they are classified in the same class. Any other property may be different. To understand isoenzyme, I will remember hexokinase, hexokinase, glucokinase. A question was asked long time back. They ask that which graph is for hexokinase, which graph is for glucokinase. So hexokinase as helicopter. How helicopter flies? I have told you helicopter like this, and jet flies zoom. So this is jet, G for jet or J for jet, H for helicopter. So you can solve that question by helicopter and jet. And by this, you can remember other property, just like if you want to travel a short distance, you will use helicopter. If you want to travel a long distance, if you want to drop love to another country, बम तो हम फेंकते नहीं, प्यार करते हैं हम तो, यदि पाकिस्तान में प्यार फेंकने जाना है तो क्या लेके जाओगे? या हेलीकॉप्टर या जेट? क्या लेके जाओगे? जेट लेके जाएंगे. सो हाई केएम, हाई केएम, that is glucokinase jet, low km, low km. Affinity, km is inversely proportional to affinity. So if low km, high affinity, high affinity. If high km, glucokinase has low affinity. That's why, sorry dear, पाकिस्तान से हो तभी मैंने कहा प्यार बांटने जाएंगे हम. यस, बम तो हम फेंकते ही नहीं. ठीक है डियर. यस, तो गुस्सा मत हो. यस. Organ distribution, hexokinase present in most of the tissue, most of tissue. Glucokinase, yes, it is run by pilot, Pilot. तो जो जेट होता है वो यूजुअली पायलट. P for pancreas, pancreas, L for liver. So I can say hexokinase and glucokinase, these are isoenzyme. Both of these catalyze a reaction glucose to glucose 6 phosphate. Glucose to glucose 6 phosphate. This is catalyzed by hexokinase or glucokinase. Okay. So they catalyze the same reaction. So they are classified in the same class. Both are transferase. So I told you that isoenzyme, different form of enzyme which catalyze the same reaction. So same class of enzyme, other properties may be different. Other properties may be different. Molecular weight may be different. Yes, physical property may be different. Electrophoretic mobility may be different. Kinetics may be different. Organ distribution may be different. Any property may be different, but they catalyze the same reaction. So this is isoenzyme. So now you can solve this question, true of isoenzyme. Yes, true of isoenzyme. Same rate of work is different, catalyze same reaction. Yes, they catalyze same reaction. True. False. Have similar kinetics. No, km values are different. False. Quaternary structure. No, different. They are classified in the same class. This is true. Answer is C. Answer is C. Distribution of organ is different. So isoenzyme, you will remember, they have similar property. Yes, only two property you can say, they catalyze the same reaction, though, so they are classified in the same class. Any other property may be different. One more example of isoenzyme is LDH1, LDH2, 3, 4, 5. Lactate dehydrogenase, 5 isoenzymes are there. Questions are asked. LDH1 is present in heart. Yes, heart में होता है. LDH2 is present in, yes, RBC, RBC, RBC. तो देखो यार, हमने निमोनिक बनाया था अपनी मेन क्लास में. एक ही तो दिल है मेरा, किस किस को दूं? तो एक ही तो दिल है, यानी हार्ट में. आरबीसी, रब ने बना दी जोड़ी, मतलब दो. यस, टू, LDH2. सो LDH2 is present more in RBC, LDH1 is present more in heart, and 2 is too much. यस, नाम अपने आप बताया निमोनिक। 2 is too much means in normal person LDH2 is more than LDH1. But if myocardial infarction occur, heart cell will lyse and this LDH1 will release. So in myocardial infarction, LDH1 will increase. LDH1 will be more than LDH2. And this is called flipped pattern. This is called flipped pattern of LDH. This question is asked 2-3 times in different. So just like a coin, if you take, you flip, yes, head, tail, like that. Yes, so these are questions on isoenzyme. This topic I followed with our mission classes. After some time, you will find that most of the topics are same in rapid revision and quick revision and mission classes. So no need to worry. Yes, tryptophan I always discuss in the beginning because potential question every time they ask question on this, every point is question. Tryptophan is aromatic amino acid. Aromatic amino acid. It is having aromatic ring. Yes, aromatic ring. This aromatic ring is called indole ring. Indole as baby doll. यस, यू आर वेरी वेल अवेयर कितने सारे फैन हैं बेबी डॉल के। बहुत सारे फैन हैं और सारे फैन तृप्त हैं। ट्रिप ट्रिप्टोफैन तृप्त हैं फैन किसके? बेबी डॉल के। यस, सो ट्रिप्टोफैन is having baby doll ring or indole ring. We found that normally in our body, yes, we found that tryptophan is converted to serotonin by simple decarboxylation. We will discuss later. For the time being, question is asked, precursor for serotonin is tryptophan. Serotonin is further converted to melatonin. We found that in our body, this serotonin is converted to 5-HIAA, 5-hydroxy indole acetic acid. Indole, baby doll. Yes, indole. So you will remember that HIAA. So normally question is asked, tryptophan is a precursor for serotonin, melatonin. This is normally synthesized in our body. Normally serotonin is further metabolized to form HIAA, hydroxyindole. Yes, acetic acid. One One metabolism like this. Second, we found that tryptophan, 60 milligram of tryptophan, 60 milligram of tryptophan give rise to 1 milligram of niacin. 1 milligram of niacin. This question is asked. Simple question. 60 milligram of tryptophan give rise to 1 milligram of niacin. Niacin has Nia Sharma. Okay, so you are very well aware about Nia Sharma also. Yes, in this multiple steps are there, but we will remember only one step, that is 3-hydroxyquinurinin is further converted to niacin by multiple steps. And in these steps, one enzyme is kinureninase. And if you don't remember this enzyme, it's okay, but you will remember this kinureninase require vitamin B6. B6 means pyridoxal phosphate. Question is asked, active form of vitamin B6 is pyridoxal phosphate. We found that normally niacin is synthesized in our body from tryptophan, and for this conversion we require vitamin B6. If B6 is deficient, if this enzyme is deficient, then this step would not occur. This 3-hydroxyquinurinin will accumulate and this will be converted to xanthurenic acid. Xanthurenic acid. So normally what happens, tryptophan is converted to niacin, but this pathway require vitamin B6. If B6 is not there, then this pathway will be diverted. This pathway will be diverted towards xanthurenic acid. So B6 deficiency lead to xanthurenic aciduria. So this question was directly asked in our INICT. Xanthurenic aciduria is seen in which of the following vitamin deficiency? Yes, yes. This is B6. B6. Clear? So Till now, I have told you that two metabolic fate means tryptophan be converted to serotonin, tryptophan be converted to niacin. Now we all are aware niacin is vitamin B3, vitamin B3, niacin, and if niacin is deficient, this lead to pellagra, pellagra 3D, diarrhea, dementia, dermatitis. So if a patient is having diarrhea, dementia, dermatitis, that is pellagra, and we found that fourth D is death. Sometimes fourth D is death. Okay, so a patient is having niacin deficiency, diagnosis is pellagra. Yes, this niacin deficiency may be due to B6 deficiency also. If a person is having B6 deficiency, then niacin will not be synthesized. So that patient will also have pellagra-like symptoms. So point out, first question, a person, a person presented with diarrhea, dementia, dermatitis, typical Castle-like appearance, this patient may have. Answer is yes, they have given nothing. They have given typical picture of niacin deficiency, pellagra. Answer is B3 deficiency. But now they mention the same question, a patient presented with diarrhea, dementia, dermatitis, typical Castle-like appearance, xanthuric acid urea. So in this patient, B3 is deficient. But this B3 is deficient due to B6 deficiency. The consequence of B6 deficiency, if B6 is not there, then xanthuric acid will increase, niacin will not be synthesized. So pellagra is due to B6 deficiency. So better in this both B3 and B6 would be correct. But they ask one to choose. So I will prefer to mark B6 because they have given xanthuric aciduria means this niacin is deficient due to consequence of B6 deficiency. One to choose, I will mark this. We found that carcinoid syndrome, if I write here carcinoid syndrome, you all are aware, you have read that in carcinoid syndrome, Argentinophenoma. In this, more and more tryptophan is converted to serotonin, and patient present with endocardial fibrosis. Endocardial fibrosis. Yes, there would be wheezing, flushing, sweating, diarrhea. You have read these points about carcinoid syndrome, and question has been asked that carcinoid syndrome we check 24-hour urine 5-HIAA level. Is 24-hour urine 5-HIA level. Means in carcinoid syndrome, tryptophan is converted to serotonin. When more and more tryptophan is converted to serotonin, so tryptophan would be less in body. Tryptophan will not be converted to niacin. Suppose you have 10 molecules of tryptophan and all tryptophan are converted to serotonin. Then no molecule of tryptophan will be converted to niacin. So this patient will present with niacin deficiency, pellagra-like symptom. So in carcinoid syndrome, again pellagra-like symptoms. So yes, in carcinoid syndrome, HI level will be increased. So I can say a person presented with diarrhea, yes, diarrhea, dementia, dermatitis, typical Castle-like appearance, yes, 24-hour urine HI increased. In this, I will prefer to mark the answer carcinoid syndrome. Carcinoid syndrome. Now, we found that देखो बात क्या हो रही है हमारी पेलाग्रा निया शर्मा बेबी डोल है ना कार सीन डू यू रिमेम्बर द कार सीन ऑफ पीके मूवी द डांसिंग कार तो उसमें एक जोक भी बनाया था हमने कि एक बार बेबी डोल कहने लगी आमिर खान से आई एंजॉयड मूवी योर मूवी पीके उसमें मैंने रोल करके बड़ा अच्छा लगा तो उसने कहा तुम कहाँ थी शी सेड दैट आई वाज इन डांसिंग कार। तो वहां पे थी, डांसिंग कार में वो थी। तो ऐसी ऐसी मूवी बनाते हैं, शर्म भी नहीं आती, हया भी नहीं आती। टू सॉरी टू बी इन हिंदी, HIAA, हया। तो कार सीन, हया, याद कर लिया हमने। नाउ heart nap disease. When you are thinking about baby doll, Nia Sharma, your heart would say nup, nup, nup. Heart, nup. So name itself tells you, yes, yes, AR, autosomal recessive. Autosomal recessive. Yes, T for tryptophan, and U for neutral amino acid. Absorption of tryptophan and neutral amino acid defective, defective at intestine and renal tubule. So when in intestine or renal tubule, amino acid will not be reabsorbed, there would be amino acid urea. Amino acid urea. This is the catching point. Questions are asked in which they will give you amino acid urea. And in this patient, tryptophan will not be absorbed. Tryptophan will not be reabsorbed. So tryptophan would be low. So P for pellagra-like symptom. P for pellagra symptom. So now, yes, yes, pellagra-like symptom. Now I summarize. So in this, before going to summarize, before summarizing this, a person presented with diarrhea, dementia, dermatitis, typical castle-neck appearance with autosomal recessive inheritance, causing defect in tryptophan absorption, means the better answer would be Hartnup disease. Hartnup disease. So if pellagra diagnosis is there, symptoms are suggesting of pellagra, and you find that maize as staple diet, maize as staple डाइट, कई बार क्वेश्चन में तुम्हें मिलेगा, कई बार क्वेश्चन में तुम्हें मिलेगा, यस, कि मेज स्टेपल डाइट है। यस, इतनी सारी बात सुन के तुम्हें मजे आ गए, तुम क्या कहोगे? मजे आ गए। मजा नहीं लेना, मेज नहीं लेना सारा, ठीक है? सारा मजा ले लोगे तो पेलाग्रा हो जाएगा, ठीक है? और ये मजा मैं हिंदुस्तान के हर युवा को देना चाहता हूं। याद आ गया? तो मजे ज्यादा नहीं लेने, अदरवाइज पेलाग्रा हो जाएगा, नियासिन डिफिशियंसी हो जाएगी, नियासिन deficiency. Okay, if they don't mention anything, they simply say that dietary insufficiency is there, niacin deficiency we marked. If they mention increase HIAA, I will prefer to mark carcinoid syndrome. Carcinoid syndrome. Although diagnosis is pellagra, but this pellagra is due to this carcinoid syndrome. If janthurenic acid urea is there, then you will say B6 deficiency. 6 X4 X4 janthurenic acid urea. If they mention amino acid urea, amino acid urea or autosomal recessive disorder, then answer would be Hartnup disease. Okay, Hartnup disease. So these question has been recently asked. So whenever these questions are asked, they give you a catching point, and according to you will find the correct answer. Okay. Yes, we found that wherever you find aromatic compound absorb a particular light. So we found that amino acid, aromatic amino acid absorb light. And which aromatic amino acid absorb maximum light? If I ask you, a function is going on, party is going on, और उसमें बेबी डोल आई, तो लाइमलाइट में कौन होगी? सबसे ज्यादा लाइट किसमें पड़ेगी? यस, यस, indole, baby doll. So this indole ring absorb light. Yes, indole ring absorb light. So maximum light absorption by baby doll. Yes, replacing alanine by which amino acid will increase UV absorption of protein at 280 nanometer. Yes, yes, tryptophan. Answer is tryptophan. Okay. Now we come to conceptual part. अब क्विक रिवीजन से भी तुम कर सकते हो, यस, और अपने जो मिशन वाले हैं वो भी, we will do in a little bit faster way and in a very crisp way. So don't worry, we will do it in the limited time with concepts. Okay, dear. Now we come to conceptual part. Yes, we are in fat state, we are taking our diet regularly at regular time interval, we took lunch, we will take dinner. Okay, suppose I took food. In my food, 60-70% of our diet is normally made of carbohydrate. So whatever diet I usually take, in this 60-70% is carbohydrate. As I took food, that carbohydrate goes to intestine, it is digested, it is absorbed, and blood glucose increases. Blood glucose increases. So when blood glucose increases, this extra glucose goes to pancreas and stimulate to release insulin. Insulin injection. Insulin injection. Yes, insulin as insulin injection. आज 11:30 तक क्लास करेंगे, हम 11:30 तक क्लास करेंगे। यदि हो सकता है 10-15 मिनट एक्स्ट्रा हो सकती है, ठीक है। ओके, कोशिश करेंगे आज हम मेजोरिटी मतलब एक लिमिटेड पार्ट हम कवर कर लेंगे, डिसेंट पार्ट, सो नो नीड टू वरी। नाउ what is the function of this glucose? This glucose has multiple function. One function that this glucose is stored in a liver and muscle. This glucose is stored in muscle and liver as glycogen. So one function of glucose is as a storage glycogen. We found that 10% of 10 sorry 2% of muscle is glycogen and 10% of liver is glycogen. So percentage wise, glycogen is more in liver. This question has been asked. But muscle mass, total muscle mass is much more than liver mass. So total glycogen is more in muscle. This is also question. So we stored glucose as glycogen, one function. Second function of glucose is to enter HMP shunt. HMP shunt, we will discuss shortly, or pentose phosphate pathway. Name itself tells you pentose phosphate pathway, PPP, means it produces pentose sugar. Pentose sugar. So one function of carbohydrate was to store as glycogen. Second function is to produce pentose sugar, that is done by HMP shunt. HMP shunt also produce NADPH. NADPH. NADPH in complete biochemistry at many places you will find that we want reduction. Wherever you want reduction, most of the places you require NADPH. You require NADPH. So NADPH is not concerned with energy. NADPH is concerned with reduction. So HMP shunt produce no ATP. NADPH produce no ATP. So HMP shunt, no ATP produced. This question is asked. So HMP shunt said that I am not going to produce ATP. My purpose is to produce pentose sugar or to produce NADPH. If you want to produce energy, go to glycolysis. Means this glucose will enter glycolysis. This glucose will be converted to two molecules of pyruvate. This is aerobic glycolysis. In this net gain is 7 ATP. 7 ATP. This is glycolysis. Glycolysis. Now this pyruvate will enter the mitochondria. Means now I can summarize that carbohydrate, one function is stored as glycogen in liver and muscle. Second function, it produce NADPH and pentose sugar. Third function, it produce energy by glycolysis. Further, this pyruvate will enter the mitochondria. In mitochondria, pyruvate will be further converted to acetyl coenzyme by pyruvate dehydrogenase, and again ATP will be produced. This acetyl coenzyme may enter Krebs cycle, TCA cycle, and will produce 10 ATP. Question is asked T4 TCA, T4 10. One acetyl coenzyme may produce 10 ATP. One acetyl coenzyme may produce 10 ATP. So in this way, one glucose molecule will enter glycolysis, then PDH, pyruvate dehydrogenase, then TCA cycle, and net gain would be 32 ATP. So complete oxidation of glucose, net gain 32 ATP. Clear? Now, so Glucose has done so much of work. Was stored as glycogen. It produced pentose sugar. It produced NADPH. It produced energy. Even then, glucose is remaining. Now, glucose said, okay, don't worry. This acetyl coenzyme will not enter Krebs cycle. These acetyl coenzyme will be thrown out of mitochondria. So this is mitochondria. Whatever outside this circle, yes, outside this circle, कैलकुलेशन बाद में करेंगे. ओके, आउटसाइड दिस सर्कल is cytosol. So we found that acetyl coenzyme will come out of this mitochondria. Acetyl coenzyme, acetyl coenzyme ultimately will be converted to fatty acid. Acetyl coenzyme will be converted to cholesterol. Means extra carbohydrate will be converted to fat. Means whatever extra carbohydrate you are taking, that extra carbohydrate is converted to fat or fatty acid, cholesterol, and this fatty acid will bind with glycerol to form triacyl glycerol. Triacyl glycerol, which is stored. Yes, माँ का प्यार adipose tissue में. Adipose tissue. Adipose tissue. So let me summarize why I have taken this flow chart in this way. Multiple questions will be solved. First thing, carbohydrate will be stored as glycogen. It will produce pentose sugar. It will produce NADPH. It will produce energy. And whatever extra carbohydrate will be left, that extra carbohydrate is converted to fat. And that is, yes, stored. And all these pathway are activated by insulin. Insulin is hormone of this fat state. Yes, yes, TCA cycle is occurring in mitochondria. Yes, insulin activate all these pathway except TCA cycle. I have written all the pathway on this page are activated by insulin except TCA cycle. TCA cycle, no hormonal control, no hormonal regulation. All other pathway, glycolysis is activated by insulin. Insulin activate glycolysis. Rate limiting enzyme phosphokinase we will discuss shortly. Link reaction pyruvate dehydrogenase. This pyruvate dehydrogenase, this is called link reaction. I will discuss it shortly in detail. Okay, I will discuss it in detail. For the time being, just remember glycogen synthesis. Glycogen synthesis is activated by insulin. HMP shunt is activated by insulin. Fatty acid synthesis activated by insulin. Cholesterol synthesis activated by insulin. So all these pathways and rate limiting enzyme of all these pathway are activated by insulin. Question. Okay. Now, all these pathway are occurring in cytosol except this pyruvate dehydrogenase. You can easily tell me what is inside the mitochondria. Pyruvate dehydrogenase and TCA cycle. Other than these two, yes, all are occurring in cytosol. Fat acid synthase occur in cytosol. Cholesterol synthase occur in cytosol. HMP shunt occur in cytosol. Glycogen synthase occur in cytosol. Glycolysis occur in cytosol. Got the point? So all these pathway are activated by insulin, and we have discussed the site also. Clear? Hope you are understanding. Speed is okay. Okay, good. Now, now we come to fasting state or starvation. Suppose I lock you in a room. Suppose face to face class is going on. मैं हमेशा क्या करता था पहले जब मैं I was quite young. तो जब पढ़ाना शुरू किया मैंने तो बड़ा ही ऐसे किया करता था मैं. Yes. तो I locked you in a room and I said, I will complete my biochemistry, then I will let you go. This is the adverse condition. You are not getting food. Now what will happen? Your liver glycogen. Yes, you stored glycogen in liver. Liver said, liver is the main organ of metabolism. Liver said, don't worry, I will maintain blood glucose. Dr. Ankur is not allowing you to go outside. Don't worry. Yes, liver started breaking down its glycogen. Glycogenolysis. Glycogenolysis, early fasting up to 16 to 18 hours. Up to 16 to 18 hours, liver liver glycogen would be broken down, and liver glycogen is sufficient up to 16 to 18 hours to maintain blood glucose. You ask muscle, you also do glycogenolysis? Muscle say, no, 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 I will not do. Muscle is selfish. Muscle says myself. मैं अपना ग्लाइकोजन किसी को नहीं दूंगी, मैं अपने आप खाऊंगी. Yes, muscle glycogen can't contribute blood glucose. Yes, muscle glycogen can't contribute blood glucose. Yes, ऐसा क्यों हुआ? Nature is very wise. Suppose why nature said that muscle glycogen will not be used for blood glucose. Suppose I locked you in a room and somebody else, hero, आया and saved you. To save you, he opened the door and you will run. When you will run, you require energy for muscle, and from where you will get energy? This muscle glycogen will help. तो नेचर ने कहा मसल का पास रहने दो, एडवर्स कंडीशन आएगी, भागना पड़ेगा, तो एट दैट टाइम इट विल हेल्प. इट विल हेल्प. Okay, so that's why muscle don't contribute blood glucose. Liver maintain blood glucose. Liver is the main organ of metabolism. Now I did not open. No hero came. पिक्चरों में आता है, रियल लाइफ में तो नहीं आता. Now this you were locked for, yes, up to 48 hour. Up to 48 hours. अब मैं कहूंगा fasting. Lever said, don't worry, I have plan B. I have plan B. I will synthesize, glycogen is depleted. I will synthesize new glucose, नया ग्लूकोज बनाऊंगा, सड़क से उठा के स्टार बनाऊंगा, सड़क से उठा के स्टार बनाऊंगा. वेलकम मूवी याद आ गई. So Lever said, don't worry, I have plan B. I will make new glucose. Non-carbohydrate compound will convert into glucose. Gluconeogenesis. And at the same time, when you are in fasting state, you are in starvation or fasting state, yes, we found insulin decreases, glucagon increases. This increased glucagon activate hormone sensitive lipase. Hormone sensitive lipase. So lipase will cut lipid and will release fatty acid. This fatty acid will go in mitochondria and there would be beta oxidation of fatty acid. So up to 48 hours, main source of glucose, gluconeogenesis, some energy is produced by beta oxidation of fatty acid. Clear? So question, fasting state, insulin decreases, glucagon increases. Second question, glucagon activate hormone sensitive lipase. This fatty acid go to mitochondria and energy is produced. So you are maintaining blood glucose and you are also doing beta oxidation up to 48 hours. But after 48 hours, 2 दिन हो गए, मैंने भी तुम्हें छोड़ा नहीं. You are locked. Now liver would be exhausted. No substrate for gluconeogenesis. Liver said, okay, don't worry, I have plan C. Liver will synthesize ketone bodies. Yes, beta oxidation would be increased, gluconeogenesis will be decreased. Yes, and at the same time, ketone body synthesis occur, and ketone body will be utilized by most vital structure, brain, heart, and skeletal muscle. Brain, heart, and skeletal muscle. Okay, clear? तो ये अब देखो, Plan A, Plan B, Plan C. If you are in a short fasting state, liver glycogen will be broken down, maintain blood glucose. If fasting is prolonged, liver will say, don't worry, I will do gluconeogenesis. At the same time, beta fatty acid will be oxidized and will produce energy. If after 48 hours, all the substrates are exhausted, liver will say, don't worry, I have Plan C, ketone body synthesis. I will synthesize ketone body, and these ketone bodies are important substrate for most vital structure. Most vital structure is brain, heart, and skeletal muscle. So all these are occurring in starvation. All these pathways are activated by glucagon. All these pathways which I have mentioned are inhibited by insulin. Okay, and now you can tell me easily, yes, glycogenolysis, yes, occur आउटसाइड द माइटोकॉन्ड्रिया, दिस इज माइटोकॉन्ड्रिया, फिर मैं हाईलाइट कर रहा हूं ये माइटोकॉन्ड्रिया है, इसके बाहर सब कुछ साइटोसोल है। तो ग्लाइकोजन सिंथेसिस एंड ग्लाइकोजिनोलाइसिस अकर इन साइटोसोल, बीटा ऑक्सीडेशन अकर इन माइटोकॉन्ड्रिया, ketone body synthesis occur in mitochondria, ketone body utilization occur in mitochondria, gluconeogenesis we will discuss shortly occur both in mitochondria and yes, yes, ketone body, I told you that this is the main source of energy. Although when you are in starvation, yes, at the same time, all these synthesis starts. I will discuss all these with beta oxidation, or you can say lipid. So all these pathways are occurring simultaneously, but I am telling you the predominant up to 16 to 18 hour predominant would be glycogenolysis. Up to 48 hours predominant would be gluconeogenesis. Yes, after 48 hour then this will predominant. याद रहेगा, थोड़ा कंफ्यूजन होना वाजिब है, क्योंकि लाइफ इज नॉट सिंपल, और ब्यूटीफुल है बट सिंपल नहीं है, और रिएक्शंस तो बहुत कॉम्प्लिकेटेड है। So I have tried to simplify with concepts, real concept. Okay, little bit fast, definitely. Yeah. Now, which pathway occur in which compartment? Yes, of cell. So glycol. Now you can easily find this table. Link reaction occur in mitochondria. So I write here mitochondria. TCA cycle, mitochondria. Beta oxidation, mitochondria. Ketone body synthesis, mitochondria. Ketone body utilization, mitochondria. Glycolysis, cytosol, glycogen synthesis, glycogenolysis, cytosol, HMP shunt, fatty acid synthesis, cholesterol synthesis. Yes, yes. Okay, ये सब साइटोसोल, साइटोसोल। अब तुम्हें ये रटना नहीं है, अगेन आई एम सेइंग यू हैव टू रिवाइज दीज थिंग्स, यू हैव टू रिवाइज दीज थिंग्स so that you can solve little bit complicated questions. And pathway which occur both in mitochondria and cytosol, mnemonic is hug प्यारी, हग प्यारी। हग करते हैं, दो बंदे हग करते हैं, ठीक है, तो दो कंपार्टमेंट, H4 हीम सिंथेसिस, हग नहीं, ठीक है, यस, यूरिया साइकिल, ग्लूकोनियोजेनेसिस, pyrimidine synthesis. Okay, mature RBC don't have mitochondria, so pathway involving mitochondria can't occur in, yes, RBC. So if I ask you, yes, I say like this, all these pathway don't occur in RBC. Yes, link reaction don't occur in RBC. TCA cycle don't occur in RBC, mature RBC, because mitochondria is, yes, yes, mature RBC mitochondria is absent. Clear? अब हम बात करते हैं निमोनिक की। इंसुलिन, इंसुलिन, यस, निमोनिक इंसुलिन इंजेक्शन डू incision means remove phosphate. Insulin do incision means insulin will remove phosphate. It decrease cyclic AMP. Suppose I say this is cyclic AMP, and this insulin will come and it will cut it. So cyclic AMP will decrease. Now, enzyme activated by insulin are active in which state? In phosphorylated state or dephosphorylated state? Please do remember. Yes, dephosphorylated state. Dephosphorylated state means insulin जब भी activate करेगा, it will cut phosphate and will activate the enzyme. So you will remember like this, and you will remember this animation. Yes, whenever we take food, blood, yes, blood glucose increases, that glucose goes to pancreas. This glucose goes to pancreas and release insulin. Now insulin cut phosphate and activate glycogen synthase. So when glycogen synthase will be activated, it will convert glucose into glycogen, and this glycogen will be stored in liver and muscle. Glycogen will be stored in liver and muscle. This glucose will be diverted toward HMP shunt, will produce NADPH and pentose sugar. Pentose sugar. This glucose insulin will activate phosphokinase rate limiting enzyme of glycolysis, and glucose will enter glycolysis, will produce pyruvate, two molecules of pyruvate. This pyruvate will enter the mitochondria. In mitochondria, pyruvate dehydrogenase phosphate will be removed. Now it is active. Yes, pyruvate dehydrogenase is active in dephosphorylated state. Coming to acetyl coenzyme enter Krebs cycle to produce 10 ATP. Extra acetyl coenzyme are thrown outside the mitochondria. Now in cytosol, yes, this acetyl coenzyme is converted to fatty acid and cholesterol. Fatty acid and cholesterol, acetyl coenzyme to malonyl coenzyme. We will discuss that step. And so cholesterol and fatty acid is produced. Ultimately, fatty acid comes into triacylglycerol and it is stored as belly fat. माँ का प्यार. Okay? हो गया? Now, so this is so all these enzymes. What was the purpose to show you this? All these enzymes are active in yes, all these enzymes are active in dephosphorylated state. So whatever enzyme I have discussed here, most of these enzymes are active in which state? Dephosphorylated state. And the opposite, glucagon attach phosphate with the help of glue. This is bottle of glue. So attach phosphate with the help of glue. So enzyme activated by glucagon are active in phosphorylated state. Phosphorylated, yes, phosphorylated state. So you will remember this. This question recently asked, insulin loves lipoprotein lipase. L4 lipoprotein lipase. So insulin activate lipoprotein lipase. Yes. Insulin hates hormone sensitive lipase. H4 hates H4 hormone sensitive lipase. So inhibit. This recently asked question in our NEET PG. Now we come to carbohydrate. Speed is okay. अब तक हमारा काम सही चल रहा है. कोई कोई दिक्कत तो नहीं? Please do comment. Speed सही है? Yes. Good. Now we come to carbohydrate. We found that carbohydrate prototype is glucose C6H12O6, C6H12O6. Okay. Fructose is again C6H12O6, but in glucose there is aldehyde group, and in fructose there is keto group. So fructose is having keto group and glucose is having aldehyde group. Glucose is called aldose sugar. Fructose is called keto sugar. Yes, keto sugar. So their functional groups are different. So they are functional isomer. If molecular weight is same, functional groups are different. They are functional isomer. So ribose is aldose sugar. Ribulose is keto sugar. Ulo, जहां पे उलो आएगा ना वहां पे कीटो. एक गाना आया था मेरे याद, उलाला उलाला चुटकी जो तूने काटी है. काटी मतलब कीटो, है ना. तो उलाला, जहां पे होगा उलाला, यस, कीटो. ओके. ऐसी कुछ भी निमोनिक है भाई. द ओनली थिंग इज दैट यस, these mnemonics are not for remembering purpose. First thing, to create fun in our learning. Second thing, these small hints in exam help us to recall. Okay, and the mnemonic which is funny, that is definitely easier to recall. Ultimately तो जो हम recall करेंगे वो मैटर करेगा. ठीक है बच्चों. एक message, being a psychiatrist and biochemist also, yes, I have done PG both in biochemistry and psychiatry. I am teaching biochemistry for last 15 years, but at the age of 35, I left everything. Few are new, so that's why I'm telling you my story. At the age of 35, I left everything. I left teaching. I left my UPSC medical officer. I was not IAS. Okay, medical officer job, and then I prepared again and got my MD psychiatry. Then I did my MD psychiatry, start teaching psychiatry again. But yes, again came back with my first love, biochemistry. तो आजकल हम biochemistry पढ़ा रहे हैं. Okay. Yes. The only thing I want to tell you that I am having less IQ than you. The reason is that Flynn effect. You must have read that after each decade, IQ increases by 3 points. So definitely you must be having better IQ than me. In spite of that, I again appeared in exam and cleared exam. The only thing, your firm determination and the last moment, emotional regulation. EQ is more important than IQ. If you are emotionally stable, you will perform better in your exam. So this last period will decide your success. So many times we think that only 1 month or 1.5 months is left. Ab kaise hoga? I would say if you could manage with cool and calm mind, having trust, whatever hard work you have done, that is more than sufficient. You will clear this exam with very good rank. Trust me. ये मेरा 15 साल का एक्सपीरियंस है. कुछ टॉपर्स हैं जो मेरे साथ डायरेक्ट कम्युनिकेशन में रहे हैं. आई एम टेलिंग यू, दे वर कूल एंड काम. दैट्स व्हाई दे वर टॉपर्स. और जो लास्ट में फ्लक्चुएट कर जाता है, वो रैंक कहीं ना कहीं रह जाती है. तो नहीं, लास्ट तक हम देखो, सेरिबेलम का पर्पस क्या है कि लास्ट तक तुम्हें एंगेज रखना. यदि लास्ट तक तुम एंगेज रहे तो डेफिनेटली यू विल गेट ए वेरी डिसेंट रैंक. यस. ओके. Now we come to disaccharide. Two monosaccharide units are there. Two monosaccharide units are there. One, yes, most of time you will find in disaccharide, one unit is glucose, glucose, glucose. You have to find the second unit, although these are very simple question, they should not ask, but they have asked recently. Sucrose is made up of glucose and fructose. एक तो glucose है ही, sucrose शुक्रवार फ्राइडे, दूसरी ढूंढनी है तुमने फ्राइडे. ट्री हेलोज, ग्लूकोज एंड ग्लूकोज दोनों ग्लूकोज होते हैं. लैक्टोज, जस्ट एड जी ए, तो गैलेक्टोज, ग्लूकोज प्लस गैलेक्टोज. माल्टोज, बोथ यूनिट्स आर ग्लूकोज. भाई ग्लूकोज, each and every cell utilize glucose to produce energy. Suppose a maltose molecule comes to a cell, cell क्या कहेगी? माल आ गया. क्या आ गया? माल आ गया. तो माल ही माल, मतलब ग्लूकोज ही ग्लूकोज. यस, है ना? तो both units are glucose. हाँ? Lactulose, lactulose, ooh la la, ooh la la. If I ask you lactulose, one is galactose, second ulo, six carbon compound having ulo. Yeah, that is fructose. Yes, yes, fructose plus, यही क्वेश्चन आया था. यस. अब homopolysaccharide, polymer of same monosaccharide unit, is just like glycogen, inulin, cellulose, starch. We are concerned with glycogen. Glycogen is made up of glucose and it is highly branched. Highly branched make it compact. Highly branched make it compact. Yes. Yes, trehalose and maltose. Let me tell you here. Yes, sucrose and trehalose are known reducing sugar. Known reducing sugar because trehalose C1 of glucose bind with C1 of glucose. Maltose C1 of glucose. Yes, C1 of glucose bind with C4 of other glucose. Let me write here. In trehalose, C1 bind with C1. In maltose, C1 bind with C4. So this is the difference. Okay. तो इसमें हम इतना डिटेल में नहीं जाएंगे, क्वेश्चन आगे हम रखे हैं तो समझ लेंगे. ठीक है, डोंट वरी. In glycogen, if you see the structure of glycogen, in the middle, you will find a protein that is called glycogenin. This is primer for glycogen synthesis. For the time being, just learn it. I will discuss with glycogen metabolism. So for the time being, two questions, I can say glycogen is highly branched. That's why it is compact. Second is it is having glycogenin, which is primer for glycogen synthesis. Now, हेट्रोपोलीसेक्राइड. हेट्रोपोलीसेक्राइड और म्यूकोपोलीसेक्राइड और ग्लाइकोजा अमीनोग्लाइकन. ग्लाइकोजा अमीनोग्लाइकन, we found there are 6 compounds. Name I tell you: hyaluronic acid, keratin sulfate, heparin, chondroitin sulfate, heparin sulfate, dermatan sulfate. These are named as glycosa aminoglycan depending on their structure. क्यों कहा गया इनको? क्योंकि इनकी स्ट्रक्चर सेम थी. They were heteropolysaccharide and they were having similar property. Means heparin sulfate, keratin sulfate, dermatan sulfate, they absorb large amount of water. When they absorb large amount of water, they form mucoid structure. शी गद्दे वाली mucoid structure, है ना? And that's why they are called mucopolysaccharide. All they absorb large amount of water. This question was asked. This question was asked in our exam. They absorb large amount of water to make mucoid structure. Yes, so known as mucopolysaccharides. They have negative charge. They have negative charge. Provide compressibility and prevent joint. So they have negative charge whenever, suppose in between the joint, this glycosaminoglycan is present having negative charge. When you will jump, two bone will try to strike each other, but in between these two, negatively charged glycosaminoglycans are there. These negatively charged will repel each other, and when the distance of these negative charge will decrease, the force will increase very much exponentially. So that's why whenever we jump, they don't strike. These bones are not going to strike. That's why no osteoarthritis. But in old days, these glycosaminoglycan synovial fluid is decreased. That's why they strike and osteoarthritis. So negative charge repel each other. So you will remember negative charge. And this is the reason glucosamine is used in arthritis. Yes, glucosamine. This question has been asked in our exam. Arthritis. Okay. कैसे ये काम करता है, दैट इज नॉट आवर गोल फॉर द टाइम बी. क्वेश्चन हमें पता होना चाहिए. हाइलोनिक एसिड, डिफरेंट टाइप क्वेश्चंस आर आस्क्ड. डायरेक्ट क्वेश्चन हैज बीन आस्क्ड, सिंगल लाइनर एंड स्ट्रक्चर बेस्ड. हाइलोनिक एसिड, देयर इज नो सल्फेट. फर्स्ट क्वेश्चन, नो सल्फेट. In hyaluronic acid there is no sulfate. Point it out. If question is asked and they gave structure, look at the screen. I don't know their structure, but if they gave structure and I found that sulfate is there, this is not hyaluronic acid. Sulfate is there, this is not hyaluronic acid. Sulfate is there, hyaluronic, this is not hyaluronic acid. In this, sulfate is not there, this is hyaluronic acid. So a question was asked. In this question, they gave the structure. Identify the heteropolysaccharide from the disaccharide repeat unit given in the picture. Yes. So in this question, this was the simplest question ever. They had given this structure, no sulfate, no sulfate. Answer is hyaluronic acid. Very good. Hyaluronic acid. Now, hyaluronic acid is present in synovial fluid and vitreous humor. Question. H4 hyaluronic acid, H4 healing. Yes, H4 healing. No sulfate. Okay. So hyaluronic acid helps in wound healing. Second question, which can be asked on the structure, that creatine sulfate has no uronic acid or simply no acid. No acid in creatine sulfate, no acid. So if you see the structure, there is no acid, no acid here. Other structure, just to compare other structure, this is acid, this is acid, this is acid. In all other structure other than creatine sulfate, you will find COOH in structure. Next time they can give this question, and they can give you like this. In the same question, if I put here sulfate, okay, and this, then yes, although the structure would be changed, yes, answer would be creatine sulfate. Answer would be creatine सल्फेट. यस, निमोनिक हमने बनाया था. यस, वेरी गुड. तुम्हें याद है, जहां कीर्तन करते हैं वहां यूरिनल नहीं बनाते. जहां कीर्तन करोगे वहां यूरिनल नहीं बनाओगे. नो यूरोनिक एसिड और नो एसिड. एंड क्रिएटो वर्ड इज यूज्ड फॉर कॉर्निया. सो transparency of cornea, it is responsible for transparency of cornea. Okay. Now, yes, heparin, name itself tells you, in intracellular, intracellular, all glycosaminoglycan are extracellular except heparin. Except heparin, name itself tells you, in means intracellular. Now, heparin sulfate question has been asked, that this is present at glomerular basement membrane, glomeruli basement membrane, negative charge is there due to this heparin sulfate, and this provide charge selectiveness. Means negatively charged albumin will not be filtered by glomeruli. One reason is size. Another reason is that albumin is having negative charge. This glomerular basement membrane is also having negative charge. They will repel, so it will not be filtered. This is called charge selectiveness. Okay, is due to contributed by heparin sulfate. Question: डरमेटन सल्फेट प्रीडिस्पोज एथेरोस्क्लेरोसिस. नाम कह रहा है डर मत, लेकिन डरना तो पड़ेगा, डरना तो पड़ेगा धीरेन भाई, एथेरोस्क्लेरोसिस करती है ये, ठीक है, तो नाम से कंफ्यूज मत होना. यस. नाउ म्यूकोपोलीसैकेराइडोसिस, MPS, म्यूकोपोलीसैकेराइडोसिस. These are lysosomal storage disease. Normally lysosome in this is lysosome. Lysosome is having acidic pH. Yes, I usually tell that the villain you have seen many Hindi movies, villain is having a pool of acid, और जो भी गड़बड़ करता है उसे उस पूल में डाल देता है, everything is digested. So in the same way lysosome is having acidic pH, जो भी डालोगे हाइड्रोलाइज हो जाएगा. So हाइड्रोलेज एंजाइम होते हैं, हाइड्रोलेज एंजाइम lysosome, and they degrade these mucopolysaccharides. So normally this mucopolysaccharide is degraded in lysosome, but if lysosomal enzyme is not working, these mucopolysaccharide will accumulate. Mucopolysaccharidosis. Mucopolysaccharidosis have common features. Yes, yes. बड़ा अजीब जानवर है ना, ऐसे करता था वो. वाह, ठीक है. देखो, ह्यूमर तो होना चाहिए. लास्ट तक तुम एग्जाम में जाओगे तब तक भी मुस्कुराते रहना और घबराना नहीं है, क्योंकि तुम पढ़ रहे हो, उससे ज्यादा तुम कुछ कर भी नहीं सकते. ठीक है. यस. Coarse facial features in mucopolysaccharidosis, you will find frontal bossing, depressed nasal bridge, large tongue, okay, corneal clouding, dysostosis multiplex, bullet-shaped finger, better to say middle phalanx, hepatomegaly, splenomegaly. When hepatosplenomegaly would be there, there would be protuberant abdomen, copious nasal discharge, mucoid discharge. So these are common symptoms. Yes. Coarse facial features, corneal clouding, intellectual disability, mental retardation, copious nasal discharge, hepatosplenomegaly, protuberant abdomen, umbilical inguinal hernia, dysostosis multiplex. Yes, these are common symptoms. Actually, when questions are asked on mucopolysaccharidosis, they ask question on enzymes, okay, and the exclusive feature of a particular disorder. Otherwise, clinically, it is very difficult to differentiate these mucopolysaccharidosis, but few suggestive points are there by which you can easily find the answer. Just like MPS 1H is called Hurler disease, MPS 1S She disease, mucopolysaccharidosis type 1, maybe H or S. H for Hurler disease, in this iduronidase is deficient. H for Hurler, H for whole. Complete deficiency of iduronidase, that is Hurler disease. She disease, slight partial deficiency, complete deficiency. Okay, and when partial deficiency, no mental retardation. When complete deficiency, mental retardation. So how questions are asked? There is a patient who is having corneal clouding, who is having mental retardation. Yes, and iduronidase is deficient. Diagnosis is Hurler disease. Diagnosis is Hurler disease. Yes, if they say that patient is having protuberant abdomen, frontal bossing is there, last tongue protuberant, that last tongue is there, okay, depressed nasal bridge is there, and there is no mental retardation, iduronidase is deficient. They don't mention it is partial, but they mention no mental retardation. So I will go with She disease. I'll go with She disease. Yes. Yes. In this, you can easily find L is not so important. In Hurler disease, only MPS 1, only one name, iduronidase. Hunter disease, MPS type 2, so two name, iduronate sulfatase. Two words, better to say. In type 1, one word, iduronidase. In MPS 2, two words, Iduronate sulfatase. Two words. Okay. Now, hunter disease. Hunter disease. If you have seen many movies in this hunter used to have loin and two guns like this in their haveli, है ना? तो hunter disease, तो ये दो guns X की तरह लग रही हैं, X-linked recessive. X-linked recessive. Hunters are usually male. Yes. एक्सलिंग रिसेसिव है तो मोर कॉमन इन मेल, तो हंटर्स वैसे भी मेल होते हैं, एक दो होती हैं डाकू हसीना, नहीं तो क्वेश्चन मतलब जो मूवीज होती है, नॉट क्वेश्चन, मूवीज में तो मेनली मेल ही होते हैं, ठीक है। नो कॉर्नियल क्लाउडिंग, इफ यू आर हंटर योर विजन शुड बी क्लियर, अदरवाइज यू विल बी हंटेड। तो भगवान ने कहा कि भाई ये भाई नाम इसका हंटर रख रहे हो है, तो इसकी विजन तो क्लियर रखो यार। तो नो कॉर्नियल क्लाउडिंग। और तुमने गाना भी सुना है, मैं हूं शिकारी कुड़िए खाली मेरा वार ना जाए, तो शिकारी कौन है? यस, मेल। यस। ओके। यस, तुम भी मेरे हंटर हो। एक वो थी ना, बैड बॉय, कौन सी मूवी थी उसमें एक हंटर था, देसी बॉयज है, तो तुम मेरे हंटर हो। यस। यस। गुड। अभी उन्होंने एफएमजी में क्वेश्चन पूछा है, नेटो विज सिंड्रोम, NATO साफ लिख देता हूं, नेटो विज सिंड्रोम in this hyaluronidase डिफिशिएंट है, तो एक्यूमुलेट क्या होगा? हाइलुरोनिक एसिड। हाइलुरोनिक एसिड। इसमें जॉइंट पेन होते हैं, जॉइंट पेन एंड शॉर्ट स्टेचर, शॉर्ट स्टेचर। ओके। तो ये टाइप 9 है, टाइप 9 MPS। क्वेश्चन आ गया, रैंडमली आ गया, एटलीस्ट जो आया है वो तो याद कर लो, अदरवाइज मोस्टली इन पे क्वेश्चन आया वो करता था। तो एक बार आया है, रिसेंटली आया है, तो याद रख लेंगे, निमोनिक बना लेंगे इसका। N4 9, N4 9। नाटा छोटा, नाटा छोटा, छोटे को कहते हैं, मतलब शॉर्ट स्टेचर। यस, हाइल्यूरोनिडेज। हाई मतलब हाई, हाई नहीं हो पाया है वो, हाइट नहीं बढ़ पाई, नो हाइट, तो शॉर्ट स्टेचर नाटा रह गया, ऐसे याद रख लो। यस। ठीक है। अब हम आगे चलते हैं ग्लाइकोलाइसिस पे। टाइम को कंजर्व करके चलेंगे हम, जो इंपॉर्टेंट पॉइंट्स हैं उनको ध्यान रख के चलेंगे यार, है ना, अदरवाइज क्लास वुड बी एक्सटेंडेड, बहुत दिक्कत हो जाएगी हमें। चलो, ग्लाइकोलाइसिस आए, सभी स्पीड ठीक चल रही है, कोई दिक्कत नहीं है? यस। ग्लाइकोलाइसिस, glycolysis, in this you have to remember, although glycolide complete is important, but at least few important steps you must know, that glucose is converted to pyruvate in aerobic condition and it is converted to lactate in anaerobic condition. So anaerobic condition, the end product is lactate in anaerobic condition, anaerobic condition. Okay, we found that in glycolysis there are three irreversible steps catalyzed by hexokinase, phosphatidylkinase and pyruvate kinase. So I, for the time being, I highlight only important point. These hexokinase, phosphatidylkinase and pyruvate kinase, these are three irreversible steps, or three enzymes catalyzing irreversible steps. So these are regulatory enzymes. These are, yes, these are regulatory enzyme. Regulatory enzyme. First point you will remember, the enzyme which catalyze irreversible step in glycolysis, they are called regulatory enzyme. This is different from rate limiting enzyme. Regulatory enzyme are hexokinase, phosphofructokinase and pyruvate kinase. But rate limiting enzyme is phosphofructokinase. This is important. First question. We found that In glycolysis, one very important enzyme is glyceraldehyde 3-phosphate dehydrogenase. Glyceraldehyde 3-phosphate dehydrogenase. And you know, wherever dehydrogenase is there, removal of hydrogen. Hydrogen is taken up by NAD to form NADH. Yes. So we found that NAD are converted to NADH. So in glycolysis, NADH produced, and NADH enter electron transport chain to produce 2.5 ATP by oxidative phosphorylation. Yes, got the point. One more step in glycolysis is catalyzed by enolase. You will remember this. Mnemonic is EFG. Enolase is inhibited by sodium fluoride, F. G means gray vial. For blood glucose estimation, we take gray vial, and in this we take sodium fluoride plus oxalate. Yes, sodium fluoride plus oxalate. Again, I repeat, blood glucose estimation, we take gray vial. In this we take sodium fluoride, and this inhibit, yes, this inhibit enolase. Clear? Now, last enzyme is pyruvate kinase. Pyruvate kinase. We found that pyruvate kinase deficiency lead to hemolytic anemia. Hemolytic anemia. Yes. मैंने थोड़ा सा ध्यान रखा है कि क्विक रिवीजन के साथ भी वो मैच कर जाए. ओके. क्योंकि we have around 10-12 hours for our complete discussion, and I have completed the complete quick revision in 9 hour around. तो कोशिश करेंगे हम उस इस तरह से कवर हो जाए कि तुम्हारा फास्ट फास्ट सारा रिवाइज हो जाए और मोस्ट ऑफ द क्वेश्चन वुड बी कवर्ड. ओके. सो मोस्ट कॉमन एंजाइम most common enzyme deficiency leading to hemolytic anemia is G6PD. Yes. Okay, again I repeat. Pyruvate kinase deficiency lead to hemolytic anemia, and this is second most common enzyme deficiency leading to hemolytic anemia is pyruvate kinase deficiency. Pyruvate kinase deficiency. In G6P deficiency, you will find that lactate level is increased. Lactate level is increased. But in pyruvate kinase deficiency, lactate level is decreased. Lactate is decreased. How you will remember? Very simple concept. Yes, we have discussed this glycolysis, and in this glycolysis, you can easily see that this pyruvate is further converted to lactate. Pyruvate is further converted to lactate. If this step is not occurring, definitely lactate will not be produced. So in pyruvate kinase deficiency, lactate will not be produced, so lactate would be decreased. But in G6P deficiency, lactate would be increased. G6P deficiency, although we will discuss later, for the time being, whenever question is asked on G6P deficiency, you will find that history of primaquine, fevabine. In question, you will find hinge body, bite cells. पैथो में पढ़ा होगा तुमने ये. So I will not. Yes. Yes. So most common enzyme deficiency leading to hemolytic anemia, G6P deficiency. Second most common enzyme deficiency leading to hemolytic anemia, pyruvate kinase deficiency. Yes, phosphofructokinase deficiency. यहाँ पे लिख देता हूं मैं. Phosphofructokinase deficiency also lead to hemolytic anemia. Hemolytic anemia. Yes, we found that this phosphatidylkinase deficiency is seen in type 7 glycogen storage disease, that is Taruy's disease. Taruy's disease. In this phosphatidylkinase is deficient in RBC and muscle. So RBC lead to hemolytic anemia, muscle, yes, phosphatidylkinase deficiency lead to exercise intolerance. Exercise intolerance. Okay, exercise intolerance. So type 7 glycogen storage disease, that is clear. Now, so this is about enzyme deficiency. Now we come to aerobic glycolysis. I am not going to calculate. Net gain 7 ATP. Anaerobic glycolysis, net gain 2 ATP. But if anaerobic glycolysis starting point is glycogen, the net gain of ATP would be 3 ATP. किसी ने अब तक कैलकुलेशन नहीं बनाई ना करवाई, तो हम भी टाइम इन्वेस्ट नहीं करेंगे. लास्ट टाइम है, इनिशियली होता तो हम पूरा डिटेल में पढ़ते, लेकिन रिवीजन है. एरोबिक में 7 लेटर्स होते हैं, 7. एनारोबिक में 2 एक्स्ट्रा लेटर आ गए तो 2 एटीपी. ओके, एनारोबिक ग्लाइकोलाइज स्टार्टिंग फ्रॉम ग्लाइकोजन, दिट इज डिफरेंट है, तो यहाँ पे नेट गेन इज 3 एटीपी. Warburg effect, one question has been asked. Cancer cell, we found that cancer cell divide rapidly, and these cancer cell depend on glucose. These cancer cell depend on glucose, and we found that cancer cell utilize glucose very rapidly. And we found that cancer cell utilize glucose by aerobic glycolysis. And we have read aerobic glycolysis. Aerobic glycolysis, the end product is pyruvate. But in cancer cell, in an aerobic glycolysis, end product is lactate. And this is due to metabolic reprogramming. This is तूफान आ रहा है भाई. तो हमारे अंदर भी तूफान है. हम्म उसको चैनलाइज करते हैं हम. ओके, so we were discussing about this Warburg effect. We found that cancer cell, normally what happens? Aerobic glycolysis net gain 7 ATP. Anaerobic glycolysis net gain 2 ATP. But the starting point of glycogen, the net gain is 3 ATP. तो हमने देखा कैंसर सेल. यस, कैंसर सेल में क्या होता है कि वो ग्लूकोज यूटिलाइज करते हैं, यूटिलाइज ग्लूकोज, लार्ज अमाउंट ऑफ ग्लूकोज. Previously, we used to think that it is anaerobic glycolysis, but we found no, it is aerobic because oxygen is there. Aerobic glycolysis is there, but the end product was not pyruvate. The end product was lactate, and we found that due to few enzymes, yes, were different, and that the word was given metabolic reprogramming. So, due to metabolic reprogramming, cancer cell utilize glucose by aerobic glycolysis and end product is lactate. So, net gain would be only and only 2 ATP. 2 ATP. 2 ATP. क्लियर? तो हमारा ब्रेक हो गया, जो आना होना था, आगे होने वाला था. ठीक है, अब हम सीधा डिनर ब्रेक लेंगे. यस, नाउ Rappaport lubric cycle in this first question, that some amount of glucose in RBC enter glycolysis, and some amount enter Rappaport Lubrig cycle. Means glucose is converted to 1,3-biphosphoglycerate. This 1,3-biphosphoglycerate is converted to 2,3-biphosphoglycerate or 2,3-DPG. When 2,3-DPG is converted back, that is 3-phosphoglycerate. Ultimately, when step is bypassed, this step is bypassed. So net AT production is zero. So question is asked in Rappaport Lubring cycle, net ATP production or net ATP gain. Better to say gain. Gain is zero. I know it is really difficult to mug up, but at this time, I will avoid the complete cycle. Otherwise, it would take time and note required. If you have learned previously, just find the answer. Okay, just mug up because no time to go in depth. Okay. Yes, one thing you must remember that in RBC, this 2,3-DPG, 2,3-DPG, you all have learned in physiology that hemoglobin, four globin chain, each globin chain bind to one molecule of oxygen, four molecule of oxygen. We found this 2,3-DPG bind to beta globin chain. And now oxygen is already attached. Now this 2,3-DPG will push oxygen. You must have experience during your 10th, 12th tuition classes, a short bench, three students already sitting, and the fourth students would come and teacher would say, बैठ जा, जगह तो पड़ी है. Now you will say to you, anyhow, you will enter the gap and now you will start pushing. And after start pushing, you will produce tot state and one gone. In the same way, when 2,3-DPG is here, this oxygen will dissociate. So O2 dissociation curve shift towards right by binding 2,3-DPG. तो याद रखना हीमोग्लोबिन का सिग्मोइड शेप कर्व होता है, मायोग्लोबिन का हाइपरबोलिक कर्व होता है. यस यस. सो इसमें तुम्हें क्या याद रखना है? फर्स्ट थिंग दैट 2,3-DPG bind with hemoglobin to produce stored state. It dissociate oxygen. So shift curve towards side. Sigmoid curve in hemoglobin, hyperbolic curve in myoglobin. This is Rappaport Lubring cycle. Net gain of ATP, zero ATP. Clear? This is really important. Recently asked question. We found that pyruvate enter the mitochondria with the help of HIN. We found that in mitochondria, pyruvate is converted to acetyl coenzyme A, and the name of enzyme is pyruvate dehydrogenase. Pyruvate dehydrogenase. Name itself tells you dehydrogenase, removal of hydrogen. Hydrogen is taken by NAD to form NADH. Pyruvate is converted to acetyl coenzyme A, and in this conversion, a 3-carbon compound is converted to 2-carbon compound, means CO2 is removed. Removal of CO2 is called decarboxylation. Removal of hydrogen is called oxidation. So you can say this reaction is example of oxidative decarboxylation. So when pyruvate is converted to acetyl coenzyme A, this reaction is called oxidative decarboxylation, and we found that this pyruvate dehydrogenase have 3 enzyme. So this is multi-enzyme complex. Pyruvate dehydrogenase is an enzyme complex having E1, E2, E3. So I know it's difficult to remember, but we will make mnemonic. First is, yes, pyruvate is converted to acetyl coenzyme A. 1 carbon is removed. Removal of carbon dioxide decarboxylation. So I will write 1 here. I will write 1. E1. Acetyl coenzyme is produced. यहाँ पे I will write E2. NADH is produced. I will write E3. Means I will read it clockwise. So E1 removes CO2. E1 removes CO2. E2 remove acetyl coenzyme A. Although it is difficult reaction as shown in this question, NEET 21, but we'll make mnemonic. E3 remove NADH. You can remember like this. Now, E1 is pyruvate dehydrogenase, E2 is dihydrolipoyl transacetylase. Acetyl group is dihydrolipoyl dehydrogenase. So we remembered by this mnemonic and now solve this question. The enzyme that converts pyruvate to acetyl coenzyme are given in the diagram. What are enzymes marked as E1 and E2 respectively? E1. E1 is pyruvate dehydrogenase. E2 is dihydrolipoyl transacetylase. Okay. तो एक बात देख लेना, याद आ जाएगा. Now, if oxidative decarboxylation is there, with yes, oxidative decarboxylation is there. In this, cofactor is vitamin B1. Vitamin B1. Vitamin B1. So, if pyruvate dehydrogenase is deficient, then this reaction will not occur. When this reaction will not occur, pyruvate will be converted to lactate. Yes, pyruvate will not be converted to acetyl coenzyme. This pyruvate will accumulate in cytosol. It will be converted to lactate by lactate dehydrogenase. This question was asked in FMG, although in FMG, but can be asked in our exam also, that lactate dehydrogenase present in cytosol. So in pyruvate dehydrogenase deficiency, there would be increased lactic acidosis. So pyruvate dehydrogenase deficiency can lead to congenital lactic acidosis. INICET का क्वेश्चन है हमारा, congenital lactic acidosis due to defect in, yes, pyruvate dehydrogenase. Pyruvate dehydrogenase. Now question is asked that if B1 is deficient, again this enzyme will not work. So in B1 deficiency, again there would be increased lactic acidosis. So now I can say in B1 deficiency, yes, cofactor for pyruvate dehydrogenase is vitamin B1. So B1 deficiency lead to lactic acidosis, correct? Pyruvate dehydrogenase catalyze oxidative decarboxylation. Oxidative decarboxylation. Pyruvate dehydrogenase deficiency lead to congenital lactic acidosis. Pyruvate enter the mitochondria with the help of HIN symport. Pyruvate enter the mitochondria with the help of HIN symport. Yes, HIN symport. All these are questions. So I told you oxidative decarboxylation, O4 oxidative, O4 vitamin B1. There are three enzymes. There are three dehydrogenase where B1 is cofactor. So I told you pyruvate dehydrogenase, B1 is cofactor. Alpha ketoglutarate dehydrogenase, B1 is cofactor. Branch chain alpha keto acid dehydrogenase, B1 is cofactor. So oxidative decarboxylation, these three enzymes catalyze oxidative decarboxylation and B1 is cofactor. B1 is cofactor. We found that simple decarboxylation, S4 simple, S4 6. S4 simple, S4 6. So we found that simple decarboxylation, glutamate is converted to GABA, histidine is histamine, tryptophan to serotonin. These are common example of simple decarboxylation, and the cofactor is vitamin B6. Vitamin B6. Clear? तो ये एग्जाम्पल तुम्हें याद रखने हैं. सिंपल डिकार्बोक्सिलेशन, अमाइनो एसिड के याद रखना तुम्हें मोस्टली. ओके, यस. Now, citric acid cycle, vitamin B6, vitamin B6. As for simple decarboxylation, as for vitamin B6. Or for carboxylation, cofactor is biotin. So simple mnemonic, carbox, carbox, A, B, C. A for ATP is used, B for biotin, C for CO2 is joined. तो अभी हम डिस्कस करेंगे This is carboxylation, means joining of carbon dioxide. These are decarboxylation, means removal of carbon dioxide. Decarboxylation may be simple, B6, oxidative, B1 cofactor. Clear? Clear? Now, we come to Krebs cycle. Although each and every point is important, but we will focus on the important one which has been asked recently. One question is asked in Krebs cycle that CO2 is removed just before and after alpha ketoglutarate. In Krebs cycle, isocitrate dehydrogenase, alpha ketoglutarate dehydrogenase, both dehydrogenase, CO2 is removed. You can see CO2 is removed just before and after alpha ketoglutarate. One question. Second question, succinyl coenzyme is converted to succinate by enzyme thiokinase. Thiokinase in this GTP is produced. This is called substrate level phosphorylation. So this is the only step in Krebs cycle where substrate level phosphorylation is there. But more frequently asked question is succinate dehydrogenase. Succinate dehydrogenase converts succinate to fumarate, and in this FADH is produced. Or this succinate dehydrogenase is inhibited by malonate. Mala suck, ठीक है? तो malonate inhibits succinate dehydrogenase and produce FADH. तो याद रख लेना, और कोई निमोनिक हो वैसे याद रख लेना, माला सकफक. तो succinate dehydrogenase produce FADH. There are only few points where dehydrogenase produce FADH. Okay, so succinate dehydrogenase produce FADH. Question is asked, and this succinate dehydrogenase is inhibited by malonate. Now, frequently asked question we will discuss in detail that succinyl coenzyme is a part of Krebs cycle which take part in heme synthesis. I will discuss heme synthesis, in which I will tell you succinyl coenzyme bind with glycine to form delta aminolevulinic acid. So succinyl coenzyme take part in heme synthesis. Question. Second question, pyruvate is converted to oxaloacetate. This is called anapyrotic reaction. So those reaction which produce intermediate of Krebs cycle, yes, those are called anapyrotic reaction. ये क्वेश्चन 17 में आया था, 2017 में क्वेश्चन आया हुआ है ये. Yes, that pyruvate is going to oxaloacetate. This is example of anapyrotic reaction. Okay. Yes. Now I will not discuss further about this Krebs cycle. Now I will go to very important point, that is इलेक्ट्रॉन ट्रांसपोर्ट चेन. नीट पीजी में 2 क्वेश्चन नहीं, मतलब टोटल तो 4 क्वेश्चन थे. हर एग्जाम में 2-3 क्वेश्चन आए थे. क्या क्वेश्चन थे? वी डोंट नो व्हाट वाज एग्जैक्ट क्वेश्चन क्या थे, बट हमें पता है कि यस इंपोर्टेंट थे. तो इसको थोड़ा समझेंगे. वी ऑल नो NADH प्रोड्यूस 2.5 ATP. Anapyrotic reaction. Okay. Yes. NADH 2.5 ATP. FADH produce 1.5 ATP. How these are produced? We found that at inner mitochondrial membrane, this is inner mitochondrial membrane, these are enzyme complexes. Yes, these are enzyme complexes. Yes, complex 1, this is coenzyme Q, complex 3rd cytochrome C, complex 4. Question was asked on the name of complexes. Complex 1 is NADH coenzyme Q reductase. You all know removal of hydrogen is called oxidation. Removal of hydrogen is called oxidation. Okay, joining of hydrogen is called reduction. Again, I repeat, if you join hydrogen, that is called reduction. If you remove hydrogen, that is called oxidation. We all know. Now, complex 1, what complex 1 do? Look at the screen. What complex 1 do? This is NADH. Complex 1 take H from NADH and give to coenzyme Q. Coenzyme Q. It take hydrogen from NADH and give to coenzyme Q. So complex 1 is NADH coenzyme Q reductase. Coenzyme Q is reduced. So complex one is NADH coenzyme Q reductase. Another name which was asked in question, that complex 1 remove hydrogen from NADH. So complex 1 is NADH dehydrogenase. NADH dehydrogenase. जैसा ही क्वेश्चंस रिकॉल आए हमारे पास, वो मैं बता रहा हूं. व्हाट वाज द एग्जैक्ट क्वेश्चन आई डोंट नो. तुम्हें भी नहीं पता, मुझे भी नहीं पता, बट कंसेप्ट तुम्हें पता होना चाहिए. Yes, if you remove hydrogen, that is dehydrogenase. Removal of hydrogen is called dehydrogenation. A question was asked that complex 1 is inhibited by phenobarbital, but they did not ask that complex 1 is inhibited by phenobarbital. They asked phenobarbital inhibit transfer of H from NADH to coenzyme Q. Transfer of H from NADH to coenzyme Q is inhibited by inhibitor of complex 1. Inhibitor of complex 1. So this is complex 1 is NADH coenzyme Q reductase और NADH coenzyme Q oxidoreductase. एक ही बात है. और अदर नेम जो अभी क्वेश्चन आया है, दैट वाज NADH dehydrogenase. ओके, ये समझ में आ गया. दूसरा, अब इसके बाद हाइड्रोजन कहां पे आया? Hydrogen was at coenzyme Q. Complex third took hydrogen from coenzyme Q and gave to cytochrome C. So cytochrome C was reduced. So complex third is cytochrome C reductase. Complex 4 took hydrogen from cytochrome C and give to oxygen. So complex 4 remove hydrogen from cytochrome C. So cytochrome C is oxidized. So complex 4 is cytochrome C oxidase. And the hydrogen acceptor is oxygen. So question was asked that in electron transport chain, last acceptor of hydrogen or last acceptor of electron is oxygen. Last acceptor of electron or hydrogen is oxygen. So now you know the name. This was the purpose to show you in the form of animation. Now you know that name of complex 1 and exact what is occurring. This H is moving via this chain and ultimately oxygen give to oxygen. Give to oxygen. And we found when this hydrogen or electron is moving, complex 1 transfer 4 HN, complex third transfer 2 HN, sorry, complex third transfer 4 HN, sorry, complex 4 transfer 2 HN. Yes, 4 4 2. ओके, याद रहेगा. पहले 4 3 3 थे, अब 4 4 2 हो गए. तो ये याद रखना है 4 4 2. Now this is complex 5. Complex 5 have two subunit. Have two subunit. Yes. Okay. F0 HN channel, F1 ATP synthase. F0 और FO, कहीं FO लिखा है, कहीं F0 लिखा है. ठीक है. तो in this we found that this FO, in this 4HN pass through this, and when 4HN pass through this, yes, we found 1 ADP is converted to 1 ATP. Again I repeat, when 4HN pass through complex 5, 1 ADP is converted to 1 ATP. Yes, now look at the screen. Complex 1 transfer 4HN, complex third transfer 4HN, complex 4 transfer 2HN. Okay, अभी स्क्रीन आ रही है? Yes. Now We found when 4HN pass through this complex 5, 1 ADP is converted to 1 ATP. Yes, 1 ADP is converted to 1 ATP. And this 1 ATP is thrown out and 1 ADP come in. Yes, that is ADP ATP translocase. This brown color is ADP ATP translocase. Okay. Now, let if you could not understand the exact animation, it's okay, but at least we have idea. Complex 1 transfer 4 4 2. Yes, 4HN pass through complex 5 and produce 1 ATP. Yes, and we have already mentioned that this ADP ATP translocase transfer ADP in and ATP out. Clear? Got the point? Now, this question: which enzyme use molecular oxygen as hydrogen acceptor to produce water? This complex 4 cytochrome C oxidase use molecular oxygen as hydrogen acceptor. The answer is cytochrome C oxidase. Okay. देखो क्वेश्चन की डिफिकल्टी लेवल देखो. दे आर आस्किंग एट द नो mechanism level. That's why we have to put little bit effort on this topic. Yes, question has been asked that oligomycin inhibit FO. O को ligate किया. Mnemonic name itself tells you the mnemonic. O को ligate किया. O was channel. If you ligate the channel, it will be inhibited. So oligomycin inhibit which component of complex 5? F0. Which component? F0 of complex 5 or FO of complex 5. Atractyloside. Atractyloside inhibit ADP ATP translocase. Name itself tells you A4 ATP, A4 ADP. Tractylo means translocase. Translocase. So ADP ATP translocase is inhibited by atractyloside. ओके, तो थोड़ा सा हिंट हमें मिल जाएगा तो हमें याद आ जाएगा एग्जाम में. एट्रैक्टाइलोसाइड इनहिबिट एडीपी एटीपी ट्रांसलोकेस. ओके. Now questions are asked on these complexes. Complex 1 inhibitor rotinone ONE1, name itself is saying 1. Phenobarbital ONE1. एमोबार्बिटल और एमोबार्बिटोन ऐसे याद रख सकते हो. अल एल्डिहाइड होता है, एल्डिहाइड कार्बन नंबर 1 पे होता है, तो कॉम्प्लेक्स 1. Piercidine, I can say if I take a sharp needle and pierce my ear with the needle. So, okay, needle looks like one. कैसे भी निमोनिक बनाना है, मैंने तो ऐसे ही बनाया था. Yes, so piercidine. Complex 2, malonate. Malonate inhibit complex 2. Yes, MS Dhoni. MS Dhoni. So M for malonate, S for succinate dehydrogenase. We have discussed malonate inhibit succinate dehydrogenase. Malonate inhibit succinate dehydrogenase. It also inhibit complex 2. दो धोनी की जगह दोनी. धोनी दोनी माता सीधा चौका मारता है. कॉम्प्लेक्स 2 नहीं रहेगा, तो मेलोनेट कॉम्प्लेक्स 2 नहीं रहेगा, दो नहीं. ओके. कार कार्बोक्सिन. कार बाइक. बाई. बाई मतलब दो. कैसे भी याद रखना, 2 टाइम्स टी. सो टी टी मीन्स कॉम्प्लेक्स 2. ओके. नाउ कॉम्प्लेक्स थर्ड एन थ्री माइसिन. एन थ्री माइसिन. थ्री कॉम्प्लेक्स 3. ब्रिटिश एंटील्यूसाइड बाल. तो 3 लेटर्स हैं, 1 2 3 ऐसे याद हो जाएगा. कॉम्प्लेक्स 4. MS धोनी समझ में नहीं आया. M for malonate, S for succinate dehydrogenase. Malonate inhibit succinate dehydrogenase. Malonate also inhibit दोनी. दो इन हिंदी 2 को दो कहते हैं, तो दो नहीं रहेगा. यदि मेलोनेट होगा तो दो नहीं रहेगा. दो नहीं, दो नहीं. तो धोनी की जगह ऐसे लग लो, MS धोनी. तो कोई अंग्रेज आया हो कहेगा MS धोनी. धोनी. ओके, ठीक है. अपना इंग्लिश में तो वैसे शुरू से हाथ तंग रहा है, बट थोड़ा थोड़ा मिमिक कर लेते हैं. हाँ. एक क्वेश्चन आया था अभी, नीट का ही क्वेश्चन है, बड़े बदमाश है वो। वी यूज टू मेक निमोनिक दैट कॉम्प्लेक्स फोर वेयर एवर यू फाइंड आइड इट इनहिबिट कॉम्प्लेक्स फोर। कार्बन मोनोऑक्साइड complex 4 inhibitor, cyanide ide, hydrogen sulfide ide, complex 4. They gave one option, nitric oxide. No, nitric oxide नहीं इनहिबिट करता कॉम्प्लेक्स 4 को, एंड नो नाइट्रिक। तो उन्हें हमारा निमोनिक पता चल चुका था कि वेयर एवर आइड इज देयर इट इनहिबिट कॉम्प्लेक्स 4 बट नॉट नाइट्रिक ऑक्साइड, इट इज वैसोडाइलेटर एंड इट इज प्रोड्यूस्ड फ्रॉम आर्जिनिन। तुम्हें पता है आर्जिनिन से NO बनता है बाय NO सिंथेज। It is not inhibitor of complex 4, and you know that NO synthase is inhibited by smoking, and this vasodilation is really required for erection, penile erection. So if you are smoking, then this NO will not produce and you may have erectile dysfunction. So in movies, in advertisement, they are showing कि smoking कर रहा है हीरो macho man है, he is no longer macho man। तो कंफ्यूज मत होना, उससे गड़बड़ हो जाती है। ठीक है, तुम बदला macho man बनने गए, खत्म, दी एंड। यस। तो सिल्डेनाफिल भी ना कर पाएगी कुछ। आफ्टर सम टाइम स्मोकिंग, यस, द बेस्ट पार्ट इज दैट इफ यू स्टॉप स्मोकिंग देन इट इज रिवर्सिबल, बट इफ इट कंटिन्यू देन आफ्टर सम टाइम एथेरोस्क्लेरोसिस वुड बी देयर, और उसके बाद तो तुम्हें कोई ना बचा पाएगा। यस। यस। नेचुरल अनकपलर, व्हाट आर अनकपलर? यस, अनकपलर। मैं टाइम देख लूं अपना। एक्चुअली मैंने अपना एक टाइमलाइन बना रखा है कि कितना टाइम है, मुझे कितना कवर करना है, तो उसमें मैं थोड़ा पीछे चल रहा हूं। कोई बात नहीं। यस, वी फाउंड अनकपलर। Uncoupler, uncoupler produce HN leakage at inner mitochondrial membrane. Uncoupler produce HN leakage at inner mitochondrial membrane, just like 2,4-dinitrophenol. Dinitrophenol निमोनिक बनाया था मैंने, फिनोल प्रोड्यूस होल। फिनोल प्रोड्यूस होल, जो भी इसमें छेद कर देगा, HN लीकेज कर देगा, यस दैट इज अनकपलर, दैट इज अनकपलर। हाई डोज एस्पिरिन, हाई डोज एस्पिरिन। तुम देखो एस्पिरिन भी बुलबुले उठते हैं, वो भी छेद कर देंगे, कैसे निमोनिक बना लो। नेचुरल अनकपलर, थर्मोजेनिन, थायरोक्सिन, लॉन्ग चेन फैटी एसिड, अनकंजुगेटेड बिलिरुबिन। यस, wherever uncouplers are there, uncouplers are there, then H ion will not produce ATP. Those H ion will go in mitochondria, and that energy will be released as heat. That energy will be released as heat. Yes. Yes. So uncoupler produce heat because uncoupling means HN leakage. Normally, HN should go via this to produce one ADP to one ATP. But if you produce leakage at this point, these HN will diffuse and the energy which was going to produce ATP that will be released as heat. So uncoupler produce heat. Okay. Now HMP shunt. Okay. HMP shunt pentose phosphate pathway. In the first enzyme is glucose 6 phosphate 6 phosphogluconate by glucose 6 phosphate dehydrogenase. This is rate limiting enzyme. First step, in this NADPH is produced. Second step, again dehydrogenase NADPH. Removal of hydrogen is called oxidation. So this is oxidative phase. Oxidative phase, and this is irreversible. This question was asked. Irreversible. Further steps are reversible and non-oxidative phase. So HMP shunt has two phases, oxidative, non-oxidative. You can easily remember first enzyme is dehydrogenase, removal of hydrogen, that is oxidation, that is oxidation. And whenever oxidation is there, that is, this is, this step, particularly this step is irreversible. So this phase is irreversible. And NADPH produced. What are the use of NADPH? Questions are asked. Use of NADPH: fatty acid synthesis, cholesterol synthesis, steroid hormone synthesis, sex hormone synthesis, to convert oxidized glutathione to reduced glutathione. These are the common use of NADPH. I know this is really difficult to remember in a single go, but when we will discuss individual topic, that at that time it would be easier. Mnemonic, conceptual mnemonic. Fatty acid synthesis. Whenever fatty acid synthesis occur, it require NADPH. So NADPH come from HMP shunt. So those organ, those tissue which synthesize fatty acid, at that place HMP shunt should be present. So what are the common site of HMP shunt? Adipose tissue, fatty acid synthesis occur. So in adipose tissue, HMP shunt should be there. Lactating mammary gland, fatty acid synthesis occur. So HMP shunt should be present in lactating mammary gland. Fatty acid synthesis also occur in liver. So in liver, HMP shunt should be there. Cholesterol synthesis occur in liver. So HMP shunt should be present in liver. Are you getting this? Okay. Now, steroid hormone synthesis occur in adrenal cortex. So HMP should be present in adrenal cortex. Sex hormone synthesis also require NADPH, and that comes from HMP shunt. So testis, ovary, placenta also require NADPH. So HMP shunt occur over there. To convert oxidized glutathione to reduce glutathione in RBC, this occurring in RBC. So these are common site of HMP shunt. Common site of HMP shunt. Now, HMP shunt is absent in long-lactating mammary gland. HMP shunt is absent in skin, absent in skeletal muscle. These question has been asked previously. Okay, clear? Now, we come to glutathione, reduced glutathione. Yes, glutathione. We found that glutathione is a tripeptide. Name: gluta means glutamate, glutamate. Thio means SH, SH containing amino acid, that is cysteine. ONE1, first amino acid we discussed, that is glycine, glycine. So glutamate, cysteine and glycine, this is glutathione. So we found that NADPH convert oxidized glutathione to reduced glutathione. Clear? So these are question. First question, glutathione reductase cofactor is FAD. Glutathione reductase cofactor is FAD. Glutathione reductase prosthetic group is selenium. We will discuss it again. For the time being, leave it. We will discuss it with vitamins. Okay. Now we come to glycine. Thus, this is glycine. Now glycogen. Glycogen. You all know. Yes, glycogen storage disease, very important topic. Glycogen metabolism, one question you can expect. Yes, तो यहाँ पे 4-5 पेज हैं, इनको हम फटाफट करते हैं. Look at the screen. Glycogen synthesis. This part is glycogen synthesis. ब्रेक लेना है? Yes, no. Most of the yes continue. Yes. डिनर कितने बजे करना है ये बताओ? 8:30 बजे? एक काम करते हैं, एक बार ग्लाइकोजन सिंथेसिस कर लेते हैं, फिर देखते हैं. ओके. क्वेश्चन पूछना गलत होता है वैसे, पता है, ये बड़े सेंसिटिव से क्वेश्चंस होते हैं. लेट, थोड़ा गैप मिल गया तुम्हें भी और मुझे भी. यस. Glycogen synthesis, I have already told you, glycogen is stored in liver and muscle. When we take food, extra glucose is converted to glycogen. So I can say when we took food, glucose is converted to glucose 6 phosphate. Enzyme is glucokinase. This glucose 6 phosphate is converted to glucose 1 phosphate by mutase. The complete name is phosphoglucomutase. Phosphoglucomutase. This is converted to UDP glucose, then 1,4-glucosylunate, then glycogen. I will not discuss in detail. Simply, I will say that in glycogen synthesis, first enzyme which is important or which I would recommend you to remember, phosphoglucomutase, you must remember. First thing. Second enzyme, which is rate limiting enzyme, this is glycogen synthase, rate limiting enzyme. Third enzyme, that is branching enzyme, we have already read that glycogen is a branch molecule. So branching should be done. So branching is done by alpha 1,6. Branching is done by alpha 1,6 bond. So mnemonic is BRANCHING, branching. B looks like 6. So in glycogen, you will find that glucose is joined by alpha 1,4 and branching is by alpha 1,6. Glucose are joined by alpha 1,4 and the branching is by alpha 1,6. So you can easily remember that branching enzyme will make alpha 1,6 bond. If I ask you glycogen synthase will make alpha 1,4 or alpha 1,6. Please do comment. Glycogen synthase will form alpha 1,4. Okay. So mnemonic for these enzyme is branching enzyme and debranching enzyme. Except branching and debranching, all other enzyme make or cut alpha 1,4. Branching and debranching act on alpha 1,6. Means branching will make alpha 1,6, debranching will cut alpha 1,6. All other enzyme, if I ask you, glycogen phosphorylase will cut alpha 1,4 or alpha 1,6. Please do comment. Yes, alpha 1,4. So except branching and debranching enzyme, all enzymes are handling alpha 1,4. Clear? A question was asked. Glucan transferase act on option A alpha 1,4, alpha 1,4, option B alpha 1,4, alpha 1,6, option C alpha 1,6, alpha 1,4. आंसर बता दो फटाफट. यस, आंसर बता दो. मैंने कहा ग्लूकन ट्रांसफरेज सिर्फ डी ब्रांचिंग एंजाइम को छोड़ के सारे के सारे क्या कर रहे हैं, अल्फा पे काम कर रहे हैं. तो मैंने बिना सोचे आंसर क्या लगा दिया था इसका. ये पीजीआई में आया करता था, जब पीजीआई सेपरेट एग्जाम हुआ करता था उस टाइम में क्वेश्चन है. अब आईएनआईसीटी में ये क्वेश्चन पूछ सकते हैं वो. ओके, होल्ड द पॉइंट. यस. सो नाउ वी मेड द निमोनिक, वी मेड द निमोनिक. So this was about glycogen synthesis, rate limiting enzyme glycogen synthase. Now glycogenolysis. In glycogenolysis, the rate limiting enzyme is answer was answer was A. Answer was A. Sorry. Answer was A. Okay. Okay. Yes. Now we come to glycogen phosphorylase. I told you glycogen is present in liver and muscle, and these glycogen have different function. Liver says that I will contribute blood glucose during fasting state. Muscle says no, I will not contribute blood glucose. I will utilize my glycogen myself and I will produce 3 ATP from one glycogen. Yes, glucose from glycogen. यदि glycogen starting point है तो एक glucose से anaerobic glycolysis से 3 ATP बनते हैं. तो मसल ने कहा मैं तो अपने ATP प्रोड्यूस करूंगी. I will not contribute blood glucose. So we found that liver and muscle, they have different mindset. So our nature said, okay, we will keep separate phosphorylase. Means the property of muscle phosphorylase and liver phosphorylase are different. One question. So in muscle phosphorylase is there, muscle phosphorylase, liver phosphorylase is there, liver phosphorylase, and ultimate work is to cut glycogen. Glucan transferase, I will not discuss. Debranching enzyme will cut branch. Ultimately, when glycogen would be broken down, glycogen produce glucose 1 phosphate. When glycogen is broken down, it produces glucose 1 phosphate. This glucose 1 phosphate converted to glucose 6 phosphate by this reversible reaction. This is also reversible reaction. So if you see, you can say that this step and this step of glycogen synthesis and glycogenolysis are same. So this enzyme is same. So enzyme common to glycogen synthesis and glycogenolysis is phosphoglucomutase. Phosphoglucomutase. This question has been asked. This question has been asked. Okay. We found that last step in glycogen breakdown is glucose 6 phosphate to glucose by glucose 6 phosphatase. This glucose 6 phosphatase is normally absent in muscle. So end product of glycogenolysis in muscle is glucose 6 phosphate. Do you agree? The end product of muscle glycogen breakdown is glucose 6 phosphate. End product, yes, of liver glycogen is glucose because this glucose 6 phosphatase is present in liver. Now, what is the difference? We found this is cell. In this cell, if glucose is there, glucose can come out, glucose can go inside the cell. Now, once glucose is converted to glucose 6 phosphate, this glucose 6 phosphate can't come out of the cell. Glucose 6 phosphate phosphate मतलब फंस गया, ये CM फंस गया, ये फंस गया. So if glucose 6 phosphate is there, it can't come out of the cell. In muscle, the end product is glucose 6 phosphate, so it can't come out of the muscle cell to contribute blood glucose. So muscle cell can't contribute blood glucose due to deficiency of which enzyme? Muscle can't contribute blood glucose due to deficiency of which enzyme? Please do comment. Glucose 6 phosphatase. This question has been asked. Yes, this question has been asked. Clear? Now, we found that anaerobic glycolysis in muscle from glycogen produce 3 ATP. Normally, after exercise, anaerobic glycolysis occur, lactate level will increase. Lactate level will increase. ये हमें पहले से पता है. Now, glycogen storage disease, I will summarize in a very simpler way. इसको कैसे याद रखोगे? Questions आएंगे, you will solve very easily. Okay. Clinical question. Liver glycogen storage disease. I told you, liver maintain blood glucose. Liver maintain blood glucose in fasting state. If liver glycogen metabolism is defective, then in fasting state, liver will not be able to maintain blood glucose. So fasting hypoglycemia. You can easily correlate that liver normally maintain blood glucose in fasting state. If liver glycogen storage disease is there, there would be fasting hypoglycemia. Means if liver glycogen is not broken down, if liver glycogen is not broken down, it will accumulate. When it will accumulate, there would be hepatomegaly. There would be hepatomegaly. We found that if a patient comes to me having fasting hypoglycemia, hepatomegaly, I did biopsy, liver biopsy. And when I saw the accumulated glycogen, I found that glycogen was normal in structure or abnormal in structure. Two possibilities were there. Means in liver, we found that glycogen is accumulated, and when we took biopsy, one option that glycogen was abnormal in structure. Then which glycogen storage disease possibility is there? Mnemonic is ABCD. ABCD. How you will remember? Yes. A for Anderson disease, B for branching enzyme, C for Cory's disease, D for debranching enzyme. Debranching enzyme. So A, B, C, D. Anderson disease, branching enzyme is deficient. Cory's disease, debranching enzyme is deficient. First question. You will give me correct answer. Before going to that question, let me tell you. In any question, if they gave abnormal glycogen in liver, the answer would be either Anderson or Cory's. Suppose I give you a question. There is a patient, there is fasting hypoglycemia, hepatomegaly is there, exercise intolerance is also there, there is a burgundy color of urine is there. Multiple symptoms I gave. And I told you that on liver biopsy, abnormal glycogen was found. What I said, abnormal glycogen on liver biopsy. What is the diagnosis? Option A, Anderson disease. Option B, von Gierke's disease. Option C, Hers disease. Option D, Pompey's disease. आंसर बताओ. आंसर. मैंने बिना सोचे एंडरसन लगा दिया because I know that the only disorder in four option, that is Anderson disease, which is having abnormal glycogen accumulated. तो कई बार questions आते हैं, they gave symptoms of comorbid condition. Yes, remember this point. Yes, in medicine also you will find that sometimes you will not be able to explain each and every symptom of a patient. What is the reason? Because many times these patients have comorbidities. That's why then clinical scenario is made. Suppose a patient आया मेरे पास, हार्ट का पेशेंट है, कोई डिजीज है, तो he might be having the disorder of lung also, he might be having disorder of nervous tissue also. So sometimes they patient would not say डॉक्टर साहब मेरे हार्ट में दिक्कत है. That's why the patient will give the mixed picture in clinical practice. That's why we have to select the catching point. Okay. So again, I'm telling you the catching point will give you the answer. And you will find these questions in previous PYQ. Okay. Now, if question they gave abnormal glycogen, it may be Anderson disease, A for Anderson disease, A for amylopectinosis. Another name is amylopectinosis. C for Cory's disease. Another name is limit dextrinosis. Another name is 4-B's disease. 4-B's disease type 3. How you will remember? Cory's disease cures itself. Mnemonic is Cory's disease cures cures itself. Means self-limiting. Self लिमिटिंग. तो जहां पे तुम्हें सेल्फ लिमिटिंग मिल जाए, लिमिट मतलब लिमिट डेक्सिनोसिस, नाम अपने आप बता रहा है. यस. 4 बी, 4 बी, 4 बी, 4. तो मैं कह सकता हूं बिफोर 4. 4 से पहले क्या आता है? 3. वाई इट इज इंपॉर्टेंट? बिकॉज 4 बी डिजीज, फार्बर डिजीज, फेब्रीज डिजीज, 3 अलग अलग नाम है. तो अब हम बात कर रहे हैं सिर्फ 4 बी डिजीज की. फार्बर और फेब्रीज हम थोड़ी देर में डिस्कस करेंगे. फॉर द टाइम बीइंग दिस इज 4 बी, 4 बी, 4 बी, 4 बी बिफोर 4, टाइप 3. So in this sometime clinical scenario, you will find the patient was having symptoms during childhood. When he reaches adolescent, these symptoms resolves. That is Cory's disease. Example question में दे रखा है. Yes, a 6 month old child present with these diseases, hypoglycemia, hepatomegaly, growth retardation. Once child reaches puberty, he no longer has hypoglycemia, muscle weakness, hepatomegaly. He reached normal height also. What is the most probable diagnosis? The answer would be Cory's disease cures itself. Cory's disease cures itself. Anderson disease, amylopectinosis, name itself tells you patient will die up to age 4. Death up to 4 years. Although books has written 5, but I have taken 4 because it is type 4. याद हो जाएगा तुम्हें. Name itself tells you. Yes. एंडरसन, एंड ऑफ सन, बेटा मर जाएगा, एंड हो जाएगा सन का. यस, बेटा मर जाएगा. यस. तो एंडरसन डिजीज. कोरीज डिजीज क्योर हो जाएगा, एंडरसन डिजीज एंड हो जाएगा. तो ब्रांचिंग एंड डी ब्रांचिंग यहीं से याद कर लेना. व्हेन यू विल सॉल्व क्वेश्चन, मोस्ट ऑफ टाइम यू विल बी एबल टू सॉल्व क्वेश्चन बाय दिस. नाउ If normal glycogen, it may be type 1 or type 6. Type 1 von Gierke's disease. In this, glucose 6 phosphatase is deficient. Hers disease, liver phosphorylase deficient. In von Gierke's disease, catching point is renomegaly. Hepatomegaly would be there. Again, other than hepatomegaly, kidney would be enlarged. Hepatomegaly would be there. And renomegaly, kidney would be enlarged. Lactic acidosis, hyperuricemia, triglyceride, cholesterol increases. हर्स डिजीज में ये नहीं होंगे। तो यस, क्वेश्चन आएगा किडनी एनलार्ज देखते ही बिना सोचे आंसर ग्लाइकोजन स्टोरेज डिजीज कौन सी हो जाएगी? यस, यस। फास्टिंग हाइपोग्लाइसीमिया, हिपेटोमेगली, डोल लाइक फेसेस होता है, थिन एक्सट्रीमिटीज होती है। वॉन गिरकिस डिजीज में किडनी आर एनलार्ज्ड, मैंने लगा दिया टाइप 1 वॉन, वॉन गिरकिस डिजीज। यस, 4B, 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 बिफोर 4, बिफोर 4, 4 से पहले क्या आता है? 3। 4Bs 4 से पहले 3 आता है। नाउ मसल ग्लाइकोजन स्टोरेज डिजीज, मसल, if muscle glycogen means you will not be able to do exercise, exercise intolerance, exercise intolerance would be there, catching point. In this myocardial disease, type 5 myocardial disease, muscle phosphorylase is deficient. Muscle, yes, phosphorylase, muscle phosphorylase is deficient, means you will not be able to do exercise. When you will not be able to do exercise means glycogen will not be utilized. When glycogen will not be utilized, lactate will not be produced. Normally after exercise, lactate is produced because this glycogen is broken down to produce lactate. But if in myocardial disease, lactate will not be produced, so lactate level would be low. So in myocardial disease, lactate level would be low, exercise intolerance. Now, muscle glycogen storage disease, Pompey's disease. Before going to Pompey's disease, we found that some amount of glycogen, normally glycogen is broken down like this, but some amount of glycogen is also broken down in lysosome by acid maltase, by acid maltase, alpha 1,4 glucosidase. So this acid maltase is present in lysosome. So if this enzyme is deficient, glycogen will accumulate in lysosome, lysosomal storage disease. So acid maltase deficient in Pompey's disease, enzyme deficient is acid maltase. इसको तुम अवॉइड करना चाहते हो, ये निमोनिक को तो अवॉइड भी कर सकते हो, ठीक है। acid maltase, it is both glycogen storage disease and lysosomal storage disease. Yes. 2% of glycogen is normally metabolized in lysosome by acid maltase. If acid maltase is deficient, that lead to Pompey's disease, that is type 2 glycogen storage disease. In Pompey's disease, there is a hypertrophic cardiomyopathy. Yes, hypertrophic cardiomyopathy. Sometimes you will find image आ चुका है हमारे एग्जाम में. You will find the cardiac shadow is very large. Yes, that is hypertrophic cardiomyopathy. In this muscle glycogen storage disease, so there would be floppy baby, hypotonia. Means sometimes you will find image. A baby is on palm and the baby is so floppy, है ना? तो floppy baby, okay? And that due to cardiac failure. Death occur due to cardiac फेलियर. सो ये इमेज क्वेश्चन आया हुआ है, हमने तो निमोनिक भी याद कर लेना है. यस, कितने हाथों से पंप कर रहा है? ओके, तो पोम्पेज डिजीज 2 हाथों से पंप कर रहा है. 2% ग्लाइकोजन मेटाबोलाइज होता है, एसिड माल्टेज से होता है. एसिड माल्टे, ये बोथ ग्लाइकोजन स्टोरेज डिजीज और लाइसोसोमल. तो निमोनिक ऑफ 2 है, निमोनिक ऑफ 2 है. इसीलिए मैंने लिखा था माल्टोज हैज 2 ग्लूकोज, मतलब एसिड माल्टेज 2 ग्लूकोज. 2 तरह की ग्लाइकोजन स्टोरेज डिजीज, लाइसोसोमल स्टोरेज डिजीज एंड हाइपरट्रोफिक कार्डियोमायोपैथी. हो गया. So you will be able to solve question very easily when questions are asked. Yes, 2 month infant, generalized muscle weakness, sloppy infant, hypertrophic cardiomyopathy, diagnosis is type 2 glycogen storage disease. We can discuss, although we have discussed in our main videos in detail about the each and every mechanism and symptoms of each glycogen storage disease, but here I will summarize in this way so that you can solve most of the question by this information on. Yes, myocardial में muscle phosphorylase is deficient, so muscle will not be able to do produce energy from glycogen, so you will not be able to do exercise, so exercise intolerance would be there. When glycogen will not be used, so lactate will not be produced, lactate level would be low, and there would be exercise intolerance, muscle cell lysis, rhabdomyolysis would be there. This will excrete in urine, burgundy color of urine would be there. Symptoms बहुत सारे हैं, ठीक है. ओके, इसमें एक काम कर सकते हैं, जो भी तुम्हारा लगता है ना, हमने वैसे मिशन में कर रखा है, बट मेन वीडियोस भी मेरे आए हुए हैं. यदि तुम्हें लगता है कोई टॉपिक तुम्हें लगता है कि हाँ हमेशा आता है और थोड़ा वीक है, तो यू कैन गो विद द मेन वीडियोस ऑल्सो. ओके. यस. यस. ब्रेक. चल रहे हैं यार, चलो. अब स्ट्रेच करना है अपने आप को. देखो, लिमिट हमारी बहुत ज्यादा होती है. फर्स्ट ऑफ ऑल लेट मी टेल यू, समटाइम्स it is psychological. Tiredness is totally psychological. Whenever I used to watch Netflix, तो मैं पूरी पूरी रात देख लेता था. वही काम मैं पढ़ाई करता हूँ तो मुझे वीडियो नहीं देख पाता. मैं क्या करूं, मजबूरी है मेरी, है ना. क्योंकि द यस, इफ यू आर साइकोलॉजिकली स्ट्रांग कि भाई हाँ करना है तो करना है, तो इसमें एंटरटेनमेंट ढूंढो यार. हालांकि मुश्किल है, बट थैनोस लाऊंगा मैं अभी, कोशिश करेंगे. ठीक है. यस. यस, ये देखो बड़ा इंपॉर्टेंट टॉपिक है. क्वेश्चन देखो लगातार लिख भी रखे हैं मैंने तुम्हें मोटिवेट करने के लिए. ओके, मोटिवेट करने के लिए लिखे हैं ये. यस, वी फाउंड दैट इन फास्टिंग स्टेट, in fasting state glucagon epinephrine increases. We found that glucagon epinephrine, yes, increase cyclic amp. क्वेश्चन है, डायरेक्ट क्वेश्चन. Glucagon, epinephrine increase cyclic AMP, insulin decrease cyclic AMP. We know this cyclic AMP activate, yes, protein kinase, protein kinase or protein kinase A. Kinase means transfer a phosphate group. Protein kinase transfer a phosphate group to glycogen phosphorylase. Protein kinase transfer a phosphate group to glycogen synthase. Kinase means kinase transfer a phosphate group. And we found that in our body, few enzymes are activated by phosphorylation and few enzymes are inhibited by phosphorylation. Just like glycogen phosphorylase is activated by phosphorylation, and glycogen synthase is inactivated by phosphorylation. You can easily remember, just like Thanos. Thanos was having so many stones and he became more powerful. जो फास्फेट है, हाई एनर्जी कंपाउंड है, हर कोई इसको टॉलरेट नहीं कर सकता. आयरन मैन डाइड, तो ग्लाइकोजन सिंथेज वाज आयरन मैन, ही डाइड. Thanos was, yes, became very powerful. This is glycogen phosphorylase. So why it happened? Why it happened? Yes, we found. तो एक बच्चे ने बताया सुसु भी तो करना पड़ता है. मैं तो सुसु करके बैठा था, पहले ही प्लान बना रखा था कि भाई ब्रेक मिले ना मिले, तो तुम्हें नहीं पता ना. और जो पहली अर्ज आती है, अब तुम्हें बहुत लंबा टाइम हो गया यार, 20 साल हो गए, तो पहली अर्ज आती है वो जो मिक्सचुरेशन की, वो ट्रांजिएंट होती है. उसके बाद कैपेसिटी तो बहुत सारी बची हुई होती है हमारी. जो सेकंड टाइम है, सच बताना, सर्जरी में पढ़ाते हैं और एनाटॉमी में भी, है ना. तो तो उसको यूज करो, है ना, कभी तो काम आएगी वो. यस. ओके, सो व्हाई इट हैपेंड, ये क्यों हुआ ऐसा? यस, ये ऐसा क्यों हुआ? ये ऐसा इसलिए हुआ, when one is activated this should be inhibited. So means, suppose in liver want to maintain blood glucose, this glycogen phosphorylase is activated. At the same time this glycogen synthase must be inhibited. Why? If it is not inhibited, what will happen? Suppose it is not inhibited, then glycogen will be broken down to produce glucose. It will produce glucose. Glucose want to go to blood, but before going to blood, glycogen synthase will say, "Oh, so much of glucose. चलो glycogen बनाते हैं." It will break. It will make. It will break. It will make. So ultimately, blood will get बाबा जी का ठुल्लू. That's why nature said कि यदि हमने इसे ग्लाइकोजन सिंथेज को एक्टिव रखा, यदि हमने ग्लाइकोजन सिंथेज को एक्टिव रखा, तो क्या होगा? ग्लूकोज विल नॉट गो टू blood. It glycogen synthase will convert it back to glycogen. That's why when one enzyme is activated, another enzyme opposite pathway is kept in inhibited state. One mechanism is by phosphorylation of enzyme. ये समझ में आया? कितने स्टोन थे उसके पास, है ना उसके पास 6 स्टोन थे, तो वहीं से याद रख लेंगे ग्लाइकोजन फास्फोराइलेज कोफैक्टर इज विटामिन B6, कोफैक्टर इज विटामिन B6, एक और याद हो गया हमारे, क्वेश्चन आया हुआ है. नाउ एक्टिवेटर ऑफ ग्लाइकोजन फास्फोराइलेज, लीवर ग्लूकागोन एपिनेफ्रिन, आई टोल्ड यू ग्लूकागोन एपिनेफ्रिन. मसल नोट ग्लूकागोन, epinephrine yes, and muscle there is calcium. Muscle, yes, yes. अगेन आई रिपीट ये वाला पोर्शन में, क्योंकि मैं आगे करने वाला हूं डिटेल में. आज 11:30 से 11:45 तक चली हुई क्लास, पहले बता रहा हूं मैं तुम्हें, ठीक है, क्योंकि मैं 15 मिनट लेट चल रहा हूं. ठीक, 11:45 तक उम्मीद है. यस. Two opposite pathways. Multiple question has been asked. I have given one diagram in the last of lipid also. Two opposite pathways are regulated in such a way, when one is activated, other is kept in inhibited state. So glycogen breakdown and glycogen synthesis are two opposite pathway. They are regulated in such a way, when glycogen breakdown is activated, glycogen synthesis is kept in inhibited state. This is by phosphorylation. Few enzymes are activated by phosphorylation, few are inhibited by phosphorylation. So when you attach phosphate to glycogen phosphorylase, it is activated. When you attach phosphate to glycogen synthase, it is inhibited. Yes, clear? Now, we found that activator of glycogen phosphorylase, liver is glucagon epinephrine, we have already discussed. Muscle glucagon, yes, कहीं पे लिखा हो, कंफ्यूज मत होना, मसल में ग्लूकागोन एक्टिवेटर नहीं है, एपिनेफ्रिन है, कैल्शियम है, मसल है सेपरेट मैकेनिज्म. मैंने तुम्हें बताया था, मैंने तुम्हें बंद कर रखा है, हैव क्लोज्ड यू इन ए रूम. व्हेन यू, इफ आई ओपन, यस, यस, if I open the room, you will run. And if you will wait for hormone to come, it may be late. So nature said, whenever you will start contraction, sarcoplasmic reticulum will release calcium, and this calcium will do activation of this glycogen phosphorylase rapidly in muscle. सो तुम्हें भागने के लिए कैल्शियम, सॉरी, एक बार तो कॉन्ट्रैक्शन करना पड़ेगा. वंस यू हैव डन कॉन्ट्रैक्शन, कैल्शियम इज रिलीज, एंड कैल्शियम इज एक्टिवेटर ऑफ मसल फास्फोराइलेज. कैल्शियम इज एक्टिवेटर ऑफ मसल फास्फोराइलेज. ये क्वेश्चन आया हुआ है हमारे यहाँ पे. देखो जितने भी क्वेश्चन आते हैं वो सब कंसेप्चुअल है. ये तुम्हें कंसेप्ट पता है तो you can solve those questions. Inhibitor of glycogen phosphorylase, liver. In liver, when glycogen is broken down, the end product is glucose. In liver, I told you, end product is glycogen is broken down to glucose 6 phosphate and glucose. But in muscle, the end product is glucose 6 phosphate. Means in muscle, glucose is not the end product. Means in muscle, glucose is not produced. So glucose is inhibitor in liver, but not in muscle. Glucose 6 phosphate is inhibitor both in liver and muscle. ATP is inhibitor in both liver and muscle. ये समझ में आया? यदि आया तो थम्स अप कर दो. यस, तो हमने प्रोडक्ट इनहिबिशन कर दिया. ग्लाइकोजन फास्फोराइलेज, यस, ग्लाइकोजन फास्फोराइलेज का प्रोडक्ट है ग्लूकोज 6 फास्फेट. ग्लूकोज मसल में एंड प्रोडक्ट ग्लूकोज 6 फास्फेट है, लीवर में ग्लूकोज है, तो मसल में ग्लूकोज बनता ही नहीं, तो इनहिबिटर नहीं होगा. गोट द पॉइंट? यस, गुड. ग्लाइकोजन सिंथेज, फ्यू पेशेंट वी सो दैट ग्लाइकोजन सिंथेज डिफिशिएंट, उसको हमने दिया टाइप 0 ग्लाइकोजन स्टोरेज डिजीज. उसका नाम क्या दिया हमने? टाइप 0 ग्लाइकोजन स्टोरेज डिजीज. टाइप 0 glycogen storage disease. And if glycogen synthase is not there, glycogen will not be synthesized. If you will take liver biopsy, liver में glycogen नहीं होगा. Yes, liver में glycogen नहीं होगा. So this question was asked. Yes, if 4-year-old child present with easy portability, mother also complained that child increased hunger between meals. Which of the following, which relieved food, liver exam, no glycogen in liver? Yes, yes. So answer is glycogen. Yes, synthase. Answer is glycogen synthase. Clear? Now, adolescent male patient present to exercise intolerance, history of developing cramps on exercise with the flowing enzyme is deficient. Myophosphorylase. Myophosphorylase. देखो याद रखना, मायोफास्फोराइलेज, मसल फास्फोराइलेज और ग्लाइकोजन फास्फोराइलेज इन मसल एक ही बात है. अगेन आई रिपीट, मायोफास्फोराइलेज और मसल फास्फोराइलेज और ग्लाइकोजन फास्फोराइलेज इन मसल एक ही बात है. कई बार ये बच्चों के डाउट आते हैं कि मायोफास्फोराइलेज, मसल फास्फोराइलेज और ग्लाइकोजन फास्फोराइलेज इन मसल सेम एक ही बात है. ठीक है? टाइप 5 मैकार्डल डिजीज. क्लियर? अब आ जाते हैं प्यारा सा टॉपिक, नोटी सा टॉपिक, 3-4 पेज झटके से खत्म हो जाएंगे. हम्म ग्लूकोनियोजेनेसिस. यस, नया ग्लूकोज बनाना है. सॉरी. पिंक कलर लड़कियों वाला. यस, वाइफ ने कहा कि पानी इसी से पीना है. और लेकिन जेनेटिक्स में मेरी मजाक नहीं बनाना. कुछ बच्चों ने मेरी वाइफ को बता दिया कि जेनेटिक्स जब भी आती है सर अपनी वाइफ की मजाक बनाते हैं. बहुत डांट लगी. मुर्गा ही बनाया, पर मैं बना नहीं. नहीं बन सकता, इंसान हूं. ठीक है? फिर बट ये है, एक बार बता देता हूं ये कि in muscle the end product is glucose 6 phosphate. So inhibitor of glycogen phosphorylase in muscle is glucose 6 phosphate, and when glycogen is broken down it produces ATP. The product is ATP. So glucose 6 phosphate and ATP are product in glycogen degradation. So muscle inhibitor is glucose 6 phosphate and ATP. Liver में end product glucose भी है, तो that is why. मायोफास्फोराइलेज का फिर बता रहा हूं मैं, मायोफास्फोराइलेज और मसल फास्फोराइलेज एक ही बात है, या ग्लाइकोजन फास्फोराइलेज इन मसल एक ही बात है ना? यस. देखो आप ग्लूकोनियोजेनेसिस कर रहे हैं, आई नो मैं तुम्हें बहुत स्ट्रेच कर रहा हूं लिमिट को, बट मुझे पता है तुम्हारे अंदर कैपेसिटी है. क्योंकि यदि मैं इस एज में स्ट्रेच कर सकता हूं, अभी भी हम लगातार 10-12 घंटे, 8-8 दिन, 10 दिन पढ़ाते हैं, तो मतलब कैपेसिटी तो है हमारे अंदर. द ओनली थिंग इज दैट वी डोंट रिकॉग्नाइज और वी डोंट चैलेंज. Why I'm saying like this? Because being a psychiatrist, I have found that many times we start thinking that we can't do. अभी 1 महीना बचा है यार, 1 महीने में क्या होगा? यू कैन डू। हमारी जो माइंड की कैपेसिटी है वो बहुत ज्यादा है। ट्रस्ट मी, हैव फेथ, वट एवर हार्ड वर्क यू हैव डन, इवन इफ यू फॉरगॉट, डोंट वरी, दैट इंफॉर्मेशन इज प्रेजेंट एट योर कॉन्शियस लेवल, सबकॉन्शियस और प्रीकॉन्शियस लेवल और अनकॉन्शियस लेवल। तो ऐसा माना गया है कि वट एवर वी हैव रेड, every information is present in our mind. It may be conscious, preconscious, or unconscious. Unconscious information never come at conscious level, it is said. But in few condition, when you are in a stressful situation and you are positive, then unconscious information can come at conscious level. ये थ्योरी प्रपोज की गई है मल्टीपल टाइम, और ये हमेशा पाया गया है कि जब भी एग्जाम में एक पॉजिटिव वाइब से जाते हो, you can get more information from your unconscious level. We have seen, ये लिटरेचर में जा रहा हूँ क्योंकि दिस अ पार्ट ऑफ माय थीसिस ड्यूरिंग माय पीएचडी। ओके, तो मेमोरी पे ही मैंने रिसर्च की थी, तो उसमें ये था कि ड्यूरिंग मेडिटेशन वी वांट टू सर्च आवर अनकॉन्शियस माइंड। एक कंसेप्ट है कि हम अनकॉन्शियस को असेस कर लें तो वी कैन नो एनी ईच एंड एवरीथिंग वट एवर वी हैव सीन in our life, we have learned in our life, we have heard in our life. So the only thing is that we can't assess unconscious mind easily, but it was found that if you are positive during a stressful situation, your unconscious mind will help you. Trust me. You must have seen many students who read very less but do perform very well in exam. The reason is not that कि वो लाइट जला के छुप के पढ़ रहा है. The reason is that he has achieved that positive attitude towards preparation. तो जो भी तुमने अभी तक, मैं कहूंगा, आई कैन प्रोमिस यू, आई कैन प्रूव यू, जो भी तुमने अब तक इतनी मेहनत की है, यू आर सिटिंग सिंस 7 8 hours continuously, all will be used if you will remain positive. थोड़ा सा अपने आप को स्ट्रेच करो। ओके, यस, वो भी शुरू करेंगे हम। थोड़ा सा आध्यात्मिक तरफ जाऊंगा मैं। अभी क्लास कर लेते हैं, उसके बाद तुम्हारे पास बैठ के बातें करेंगे। यस, यस, ग्लूकोनियोजेनेसिस, वी वांट टू मेक न्यू ग्लूकोज। इसके बाद हम ग्लूकोनियोजेनेसिस और कार्बोहाइड्रेट कंप्लीट करके डिनर ब्रेक लेंगे, ठीक है? आफ्टर कंप्लीशन ऑफ कार्बोहाइड्रेट, यस, वी वांट टू सिंथेसाइज न्यू ग्लूकोज। We found that glucose is converted to pyruvate. This is glycolysis. Pyruvate can be joined to form glucose. This is gluconeogenesis. So glucose to pyruvate, this is glycolysis. Pyruvate to glucose, this is gluconeogenesis. So gluconeogenesis is exactly opposite to glycolysis. This is very, very important point. Means if I take two molecules of pyruvate, pyruvate is having 3 carbon, I will find a 6 carbon compound glucose. So 2 into 3 is equal to 6. Mnemonic of 2. So gluconeogenesis occur in two compartment. It occur in mitochondria plus cytosol. Gluconeogenesis occur in two condition: starvation and diabetes. Yes, in starvation, there is no glucose to produce energy. You are not taking food. Liver will try to maintain blood glucose by gluconeogenesis. In diabetes, blood glucose is high but will not enter the cell. Cell will think there is no glucose, will do gluconeogenesis. So again, I repeat, starvation, you are not taking food, no glucose. Liver will try to maintain blood glucose by gluconeogenesis. In diabetes, blood glucose is high but will not enter the cell. Cell will think there is no glucose, will do gluconeogenesis. Two organ, liver and kidney. Mainly liver, boyfriend, थोड़ा बहुत किडनी, गर्लफ्रेंड, है ना? थोड़ा किडनी भी कर लेती है, ठीक। टू कंपार्टमेंट, टू कंडीशन, टू organs. Yes, substrate, mnemonic of three. If I take 3 carbon compound, I can easily join two molecule, can find a 6 carbon. So any 3 carbon compound may be, it's not compulsion. It's not compulsion, but any three carbon compound may be a good substrate for gluconeogenesis. Now, yes, may be a substrate for gluconeogenesis. Pyruvate, three carbon. Lactate, three carbon. Propionic acid, three carbon. Glycerol, CH2OH, CHOH, CH2OH, three carbon. Good substrate for gluconeogenesis. So, three carbon compound may be good substrate for gluconeogenesis. Clear? Now, I am leaving this substrate. I am jumping to node substrate for gluconeogenesis, which are never used for gluconeogenesis. Ketone bodies are never used for gluconeogenesis. There are three compounds which are termed as ketone bodies. There are three compounds: beta hydroxybutyrate, acetoacetate, and acetone. These three compounds are ketone bodies. They are never substrate for gluconeogenesis. What is the reason? We will discuss shortly, और यहीं पे discuss कर लेते हैं before completing the topic. Let me discuss here. Yes, we found that the most vital organ, brain, utilize ketone body in starvation. Gluconeogenesis occur in starvation. Heart utilize ketone body in starvation. Skeletal muscle utilize ketone body in starvation. So most vital structure, brain, heart, and skeletal muscle utilize ketone body in starvation. That's why nature decided that these ketone bodies are food for most vital structure. You will not convert into glucose. भाई नेचर ने क्या कहा कि these are, ये किसका खाना है? ब्रेन का खाना है, इसको टच मत करना. Suppose you converted these ketone body to glucose. Glucose will be utilized by different cells. फिर ketone body बनाई. You convert it to glucose. Glucose will be utilized by different cell. Brain will get बाबा जी का टुल्लू. तो नेचर ने कह दिया मालिक का खाना है, कोई टच नहीं करेगा. दे आर नेवर सबस्ट्रेट फॉर gluconeogenesis. Okay, we found that acetyl coenzyme is not substrate for gluconeogenesis. I told you carbohydrate can be converted to fat, but fat cannot be converted to carbohydrate. Fat cannot be converted to carbohydrate. Exceptions are there. Propionic acid and glycerol. Propionic acid and glycerol. ये एक्सेप्शन में क्यों आ गए? क्योंकि इनके पास क्या था? तीन कार्बन थे. ऐसे याद रखने के लिए. और मैंने बताया जहां तीन कार्बन होंगे, three carbon compound may be good substrate. Normally, fat cannot be converted to carbohydrate, but these two, three carbon compound, which are part of lipid, can be converted to glucose, part of substrate for gluconeogenesis. प्योर कीटोजेनिक अमाइनो एसिड, टू अमाइनो एसिड है जो प्योर कीटोजेनिक है. नाम है ल्यूसिन, लाइसिन. ओके, यू मस्ट हैव सीन मैनी मूवीज. पुरानी मूवीज देखी होंगी, उसमें रोबोट हुआ करता था, रोबोट. उसके पास एक लिली हुआ करती थी जो उसकी सेक्रेटरी हुआ करती थी. तो विलेन है, दे विल नेवर मेक ग्लूकोज. सो लिली ने पूछा, ल्यूसिन, लाइसिन, लिली, कि ग्लूकोज बनाना है या नहीं? सो रोबोट क्या कहेगा? लिली, डोंट बी सिली, हम विलेन है, हम ग्लूकोज नहीं बनाएंगे. लिली, डोंट बी सिली, नेवर मेक ग्लूकोज, वी आर प्योर कीटोजेनिक. ओके, तो प्योर कीटोजेनिक याद रहेगा. यस. ओके, तो थ्री कीटोन बॉडीज, फैट. यस, मस्त है ना? यस. इसके बाद मुझे स्टैंड अप कॉमेडी में जाना है ना? ऑफर आ चुके हैं ऐसे, जिसने एक दो क्लास देख ली. चलो खैर छोड़ो, वो बात की बात है. यहां से अच्छा पैसा आ रहा है, वहां जाने की जरूरत नहीं है. यस, देखते हैं. अदर देन दिस, वी फाउंड दैट we are not going to remaining 18 out of these, except these two remaining 18. I am not going to, 18 amino acid may be substrate for gluconeogenesis. 18 amino acid may be substrate for gluconeogenesis. Now, most important glucogenic amino acid is alanine. Most important glucogenic amino acid is alanine. Yes, इसमें हम, आई विल, इफ यू डोंट रिमेंबर द स्ट्रक्चर इट्स ओके, लेकिन मेरा काम है बनाना, तो मैं बनाऊंगा. दिस इज एलेनिन, दिस इज Yes, alanine, amino acid, alanine. If I count one, two, three, three carbon, and I told you any three carbon compound may be good substrate for gluconeogenesis. So most important glucogenic amino acid is alanine. Yes, yes, glycerol propionic acid can be converted to glucose. Yes, alanine can be converted to glucose. Alanine, if look at the screen, alanine, if I remove this amino group, there would be formation of keto group. नहीं याद रहे स्ट्रक्चर कोई बात नहीं, मेरा काम है बताना. This is alanine, this is pyruvate. But don't worry, I'm not wasting your time. I'm not wasting your time. Yes, alanine and pyruvate, the only difference of amino group. So we say that alanine is most important glucogenic amino acid. Why? Because alanine, when we remove amino group, there would be formation of pyruvate, and pyruvate will take part in gluconeogenesis. This is gluconeogenesis. Look at this. Yes, yes. Pyruvate is converted to oxalate. First step, pyruvate, we started gluconeogenesis from pyruvate. Pyruvate is converted to oxalate by pyruvate carboxylase. This pyruvate carboxylase, carbox में A, B, C. A for ATP is used, B for biotin, C for CO2 is joined. Pyruvate is having 3 carbon, oxaloacetate is having 4 carbon. Yes. We found that acetyl coenzyme A is activator of pyruvate carboxylase. Yes, acetyl coenzyme A is activator of pyruvate carboxylase. First question. Now, we found ROAC contain avidin. Avidin bind to biotin and inhibit absorption of biotin. So if a patient, a person is doing exercise, he is doing exercise and he's taking ROAG. Question was asked, doing exercise, taking ROAG. Now he developed hypoglycemia. Which pathway is inhibited? Yes, in this patient, ROAG is being taken, means biotin is deficient. When biotin is deficient, gluconeo, yes, yes, gluconeogenesis will be inhibited. So the answer was gluconeogenesis. Clear? We found that oxaloacetate is going to malate, then oxaloacetate. Our next step is phosphoenol pyruvate carboxykinase. Next enzyme is phosphoenol pyruvate carboxykinase. Next enzyme is fructose 1,6 biphosphatase. Next enzyme is glucose 6 phosphatase. So this is gluconeogenesis. Now you can easily appreciate that alanine converted to pyruvate, and this pyruvate will enter gluconeogenesis. Clear? It occur both in mitochondria. This step is occurring in mitochondria. This is mitochondria, and these steps are occurring in cytosol. Clear? So occur both in mitochondria and cytosol. Now, question answer. A child present with thinning of hair and scaling of scalp. Taking further history, it was found that she consumes raw egg in her diet regularly. Yes, given manifestation due to deficiency of which enzyme? Biotin. Which enzyme? Yes. देखो, carboxylation, biotin, decarboxylation may be simple decarboxylation, that is basics. Oxidative decarboxylation, that is, yes, B1. Clear? Okay. So this is about gluconeogenesis. Now, very, very important. I told you glycolysis and gluconeogenesis are two opposite pathway. Glycolysis and gluconeogenesis are two opposite pathway. We found that this is glycolysis. This is glycolysis. Look at the screen. ये क्वेश्चन आया हुआ है, that's why I'm taking time. This is glycolysis in this direction. If there would have been all steps reversible in glycolysis. Although in glycolysis there are three irreversible steps: hexokinase, phosphatidylkinase, pyruvate kinase. If these three steps would have been reversible, life would have been very simple. If you want to do glycolysis, push downward glucose to pyruvate. If you want to do gluconeogenesis, push upward gluconeogenesis glucose. कितना आसान हो जाता भाई, जीवन बड़ा आसान हो जाता. Life would have been very simple if these three steps would have been reversible, but these three enzymes are irreversible. So gluconeogenesis is nothing but bypass of these three enzymes. If you bypass these three enzymes, if you bypass these three enzymes, देख लो, we want to make phosphoenol pyruvate from pyruvate. We want to make phosphoenol pyruvate from pyruvate. So we made phosphoenol pyruvate from pyruvate by these two enzymes. So this step, pyruvate kinase, was irreversible. To bypass this pyruvate kinase, we have these two enzymes, pyruvate carboxylase and phosphoenol pyruvate carboxykinase. So समझ में आ गया? Further step, this is reversible. Sorry, यहाँ पे reversible. So this step will occur in, yes, this step is reversible. This occur in glycolysis, also occur in gluconeogenesis. Reversible. But this step is irreversible. So to bypass this step, again I repeat, to bypass this is sorry, to bypass this step, fructose 1,6 biphosphate to fructose 6 phosphate, fructose 1,6 biphosphate to fructose 6 phosphate, we have enzyme fructose 1,6 biphosphatase. To bypass this enzyme, we have glucose 6 phosphatase, which is present at smooth endoplasmic reticulum. So all enzymes of glycolysis, यहाँ पे लिखा हुआ मैंने, all enzymes of glycolysis also used in gluconeogenesis except three irreversible step: hexokinase, phosphatidylkinase and pyruvate kinase. Now question solve करेंगे हम यहाँ पे. Enzymes: pyruvate kinase only glycolysis, phosphoenol pyruvate carboxykinase gluconeogenesis, pyruvate carboxylase gluconeogenesis only, glyceraldehyde 3 phosphate dehydrogenase both glycolysis and gluconeogenesis, both glycolysis and gluconeogenesis. So which enzymes are involved in gluconeogenesis? Yes, answer is 2, 3, 4 सी. ये समझ में आया बच्चों? प्लीज, ये समझ में आया ना? तो डिफिकल्ट है, लेकिन कुछ कॉमन एंजाइम ही याद रखने हैं तुमने, सारे एंजाइम याद नहीं रखने. एटलीस्ट विच हैज बीन आस्क्ड यू मस्ट नो, एंड यू मस्ट नो द कंसेप्ट. व्हेन यू विल नो द कंसेप्ट, यू विल फाइंड इन एग्जाम टू फाइंड द करेक्ट आंसर. ट्रस्ट मी. ओके, नाउ आई टोल्ड यू two opposite pathways should be regulated in such a way when one is activated, other should be kept in inhibited state. So we found that when glycolysis occur in fed state, gluconeogenesis occur in starvation. So in fed state, this gluconeogenesis should be kept in inhibited state. In fed state, you have sufficient amount of glucose. There is no need of gluconeogenesis. So how this gluconeogenesis is inhibited? When we are in fed state, glucose is converted to glucose 6 phosphate, then fructose 6 phosphate. Fructose 6 phosphate is converted to fructose 2,6 biphosphate. This fructose 2,6 biphosphate indicate, again I repeat, this fructose 2,6 biphosphate indicate we have sufficient amount of glucose. Again I repeat, in fed state we have sufficient amount of glucose. Some amount of glucose is diverted to our synthesis of fructose 2,6 biphosphate. It indicate we have sufficient amount of glucose. When we have sufficient amount of glucose, there is no need of gluconeogenesis. So fructose 2,6 biphosphate is inhibitor of gluconeogenesis. Fructose 2,6 biphosphate is activator of glycolysis. So this fructose 2,6 biphosphate activate glycolysis. At the same time, it inhibit gluconeogenesis. Two opposite pathway are regulated in such a way when one is activated, another is kept in inhibited state. So if question is asked that if fructose 2,6 biphosphate is degraded, lost, then gluconeogenesis will increase or decrease. Please do comment. Yes, gluconeogenesis will increase. When fructose 2,6 biphosphate is there, it indicate that we have sufficient amount of glucose. Yes, I usually remember fructose 2,6 diphosphate, FD, फिक्स डिपॉजिट. जब तुम्हारे पास बहुत सारा पैसा आएगा, यस आएगा, पीजी होते आएगा, नहीं पीजी होते नहीं आएगा, टाइम लगेगा आने में, यस थोड़ा सा टाइम लगेगा. तो यस, जैसा ही तुम्हारे पास पैसा आया, तुमने एफडी बनानी शुरू कर दी, फिक्स डिपॉजिट. व्हेन यू हैव सो मच ऑफ फिक्स डिपॉजिट, देन यू विल से अब तो एंजॉय कर लेते हैं. देन मींस यू हैव सो मच ऑफ एफडीज, फिक्स डिपॉजिट पैसा, एंजॉय ग्लूकोज, मजे करो. यस, मजे करो. यस, यस, गोट द पॉइंट. ठीक है. तो गोट द पॉइंट. अब देखो, अब हम आते हैं monosaccharide. All monosaccharides are reducing sugar. All monosaccharides are reducing sugar. No rest, non-reducing sugar. No, non-reducing. Re for reducing. S for sucrose, sucrose and trehalose. Sucrose and trehalose are non-reducing sugar. Okay, Benedict test. Benedict test, we found that if blue color is there, it remain blue, means no reducing sugar. If traceable amount, green precipitate, low concentration, yellow, moderate concentration, orange, high concentration, red. Mnemonic is Vibgyor. Mnemonic is Vibgyor. ये हटा दिया, blue, green, yellow, orange, red. So if I gave you a sample and you did Benedict test and color came red, you will say the concentration is more than 2 gram percent. I ask you what is the concentration? You will say, sir, I can't tell you the exact concentration. I can tell you quantity, but in range. I can't tell you the exact. So it is quantitative method, but semi quantitative means you will not be able to tell me the exact concentration, but you can tell me the range. That's why Benedict test is semi quantitative test. Okay, क्लियर. सो ग्लूकोज के लिए हमारे पास ग्लूकोज ऑक्सीडेज मेथड होता है, ग्लूकोमीटर में जो यूज करते हैं हम. ओके, इसमें प्रोक्सीडेज एंजाइम होता है. तो क्वेश्चन आएगा ग्लूकोज ऑक्सीडेज प्रोक्सीडेज मेथड ग्लूकोमीटर में यूज करते हैं. ये सिर्फ ग्लूकोज के लिए है, ये सिर्फ इसके लिए है, ग्लूकोज के लिए है. लेकिन यस, जो Benedict टेस्ट है वो all reducing sugar will give Benedict test positive. Glucose will give Benedict test positive. Fructose will give Benedict test positive. Galactose, mannose, yes, all will give Benedict test positive except sucrose and trehalose. Sucrose and trehalose Benedict test negative. Benedict test, Benedict test नेगेटिव. ठीक है, बस खत्म होने वाला है अब हमारा. यस, गैलेक्टोज मेटाबॉलिज्म. गैलेक्टोज मेटाबॉलिज्म. Galactose is converted to galactose 1 phosphate by galactokinase. If galactokinase is deficient, this is called minor type of galactosemia. If galactokinase is deficient, this is called minor type of galactosemia. Galactose will not be converted to galactose 1 phosphate. Galactose will accumulate in our body. Galactose will be converted to galactitol. It will accumulate in lens, that is oil drop cataract. Oil drop cataract. Question is asked, oil drop cataract is due to accumulation of galactitol. Another name of galactitol is dulcitol. गैलेक्टिटोल का दूसरा नाम क्या है? डलसीटोल। तुमने पता होगा, विंटर में देखा होगा लड़कियां आपस में बात करती हैं, लड़कियां मतलब गर्ल। यस, तेरी स्किन तो कितनी डल है, यू मस्ट हैव यूज द ऑयली क्रीम। तो ऑयल, डल, गर्ल। गर्ल की स्किन डल हो जाएगी यदि वो ऑयली क्रीम यूज करेगी, तो तुम्हें ऑयली क्रीम यूज नहीं करनी है। ओके, याद रहेगा। तो दैट इज गैलेक्टोसीमिया minor type. We found that classical galactosemia, galactose 1 phosphate, galactose 1 phosphate uridyl transferase is deficient. If this enzyme is deficient, this galactose 1 phosphate will accumulate, galactose will accumulate, galactose will be converted to galactitol, oil drop cataract. So in this classical galactosemia, oil drop cataract will be present. Yes, we found that in this classical galactosemia, this galactose 1 phosphate will accumulate. This galactose 1 phosphate will inhibit glycogen phosphorylase. Glycogen phosphorylase. Glycogen phosphorylase liver में है, which break down glycogen in liver. So in classical galactosemia, galactose 1 phosphate accumulate हुआ, तो this galactose 1 phosphate inhibit glycogen phosphorylase, तो glycogen will not be broken down in liver, fasting hypoglycemia, hepatomegaly, jaundice would be there, mental retardation would be there. Okay, mental retardation होता है इसमें, but questions are usually revolving about this fasting hypoglycemia, hepatomegaly. So in classical galactosemia, fasting hypoglycemia, hepatomegaly would be there. There would be oil drop cataract. ये हमारे questions होंगे, लेकिन symptoms होंगे, लेकिन there would be strong relation with milk. Milk is having lactose. Lactose is made up of glucose plus galactose. तो जैसे ही बच्चा पैदा होगा, whenever child is born, immediately breastfeeding. Breastfeeding means lactose. Lactose will be digested and it will be absorbed. Galactose will not be metabolized. It will accumulate and will produce all these symptoms. Means symptoms will be related with milk, and symptoms will start early in life. Early in life. Early in life. तो ब्रेस्ट फीडिंग शुरू की, बच्चे में सिम्टम्स आने शुरू हो जाएंगे। नाउ इन बोथ गैलेक्टोसीमिया माइनर टाइप एंड क्लासिकल गैलेक्टोसीमिया, in both galactose will increase. When galactose will increase, it will be filtered by glomeruli, but renal threshold of galactose is high, so galactose will be reabsorbed. Most of the galactose will be reabsorbed, but some amount of galactose will come in urine. So most is reabsorbed, some will in urine, and in urine it will give Benedict test. Benedict test positive. Benedict test positive. And this is the reason renal threshold of galactose is high, so galactose increase in blood. That's why the name of this disorder is galactosemia, means in blood. Galactosemia means in blood. In case of fructose, fructose is converted to fructose 1 phosphate by fructokinase. If this enzyme is deficient, this is called essential fructosuria. Why? Because if this enzyme is deficient, fructose will not be metabolized. Fructose will be freely filtered, and renal threshold of fructose is low. So most of the fructose will be excreted in urine, not increase in blood. So patient would not have fructose in blood because most of the fructose will be excreted in urine. Yes, and Benedict test would be positive. But when it will not increase in blood, there would be no symptoms. The patient would be asymptomatic. Patient would be asymptomatic. Patient would be asymptomatic. Okay, so this is the reason that it is called essential fructosuria. Yes, it is essential that fructose should be excreted in urine to keep the patient asymptomatic. Point it out. Why it is called essential fructosuria? It is essential that fructose, again I repeat, it is essential that fructose should come in urine to keep the patient asymptomatic. When all the fructose will be in urine, patient would be asymptomatic. Clear? Got the point? Name is justified. Now, hereditary fructose intolerance, aldolase B is deficient. When this enzyme is deficient, then fructose 1 phosphate will accumulate. Again, this fructose 1 phosphate inhibit glycogen phosphorylase. Again, symptom would be similar, more or less same. Again, more or less same, Benedict test would be positive. So, how you will differentiate? In hereditary fructose intolerance, patient will present during weaning, means 4 to 6 months. तुम्हें पता है 6 महीने तक एक्सक्लूसिव ब्रेस्ट फीडिंग रखनी है, तुमने बच्चे को ऊपर से कुछ नहीं देना, सिर्फ माँ का दूध देना है. तो मीन्स फ्रक्टोज विल नॉट कम इन डाइट. Typical history will be there in question that Dr. Saab child was doing very well till now, but when we start giving fruit juice, सोचा थोड़ा तगड़ा हो जाएगा बच्चा, then these symptoms started. तो symptoms started during 4 to 6 weeks. तो main feature. Other than that, cataract, here cataract would be there, here cataract would be absent. So you can easily find. Yes, minor type of galactosemia, only and only symptom cataract. Benny test positive. Benny test positive. Essential fructosuria asymptomatic. Benny test positive. Classical galactosemia, all symptoms will be there. Symptoms present early in life and related with milk. And milk, breast milk is contraindication. Weaning symptoms will start after weaning. Starting weaning. Okay. Okay. तो हेरिडिटरी फ्रक्टोज इंटॉलरेंस एल्डोलेज बी इज डिफिशिएंट. क्लियर? तो ग्लाइकोजन फास्फोराइलेज इज इनहिबिटेड बाय ग्लूकोज 1 phosphate, sorry, galactose 1 phosphate and fructose 1 phosphate, both inhibit indirectly. क्या मैकेनिज्म है हम वो डिस्कस नहीं करेंगे. इस क्वेश्चन का आंसर दे दो फटाफट. यस, a 3-week-old neonate began vomiting 2 days after birth. Yes, usually 30 minutes after breastfeeding, means relation with breastfeeding. Abdominal distension, hepatomegaly may be there. Yes, jaundice. 2 urine dipstick, 1 glucose was negative, glucose is not there. Second test, specific reducing sugar was positive. What is the diagnosis? First point, von Gierke's disease. Von Gierke's disease you can easily rule out. Yes, symptoms, रीनोमेगेली इज देयर, लैक्टिक एसिडोसिस, सिम्टम्स प्रोफाइल अलग है. इसेंशियल फ्रक्टोज्यूरिया, पेशेंट इज एसिम्प्टोमेटिक, इसमें सिम्टम है तो आंसर नहीं होगा. क्लासिकल गैलेक्टोसीमिया इज द आंसर. हेरिडिटरी फ्रक्टोज इंटॉलरेंस यूजुअली मैनिफेस्ट आफ्टर वीनिंग. तो आंसर इज बी. आंसर इज बी. यस. सोर्बिटोल, ये क्वेश्चन आ चुका है यार, तो इसको भी देखना पड़ेगा. बस फटाफट, सॉरी यार मैं थोड़ा सा टाइम एक्सटेंड ले रहा हूं, मैं 15 मिनट में लेट चल रहा हूं जो मेरा शेड्यूल टाइम है उससे, बट कोई बात नहीं, कवर कर लेंगे हम आगे. ग्लूकोज इज कन्वर्टेड टू सोर्बिटोल, सोर्बिटोल टू फ्रक्टोज बाय सोर्बिटोल पाथवे. इसके बाद ब्रेक ले लेंगे. सोर्बिटोल पाथवे के बाद ब्रेक लेंगे, क्योंकि हमने अल्टीमेटली समझना तो है ना. यस, पहले तो ये बताओ समझ में आ रहा है ना? स्पीड इज ओके, भाग तो नहीं रहे ना हम? यस, ठीक है. ओके, द मेन पर्पज हमारा रिवीजन हो जाना चाहिए, सारा का सारा कंटेंट, कोई क्वेश्चन ना बच जाए, है ना, और हमारा टाइम से पूरा हो जाए. यस. नॉर्मली glucose is converted to sorbitol, sorbitol is converted to fructose. This sorbitol pathway occur in seminal vesicle. Seminal vesicle, as you know, seminal fluid is rich in fructose, है ना, बहुत सारे चुटकुले भी हैं इस पे, जोक्स भी हैं. चलो, हमें उससे मतलब नहीं है. ग्लूकोज इज कन्वर्टेड टू, यस, sorbitol, sorbitol is converted to fructose. This is sorbitol pathway. Sorbitol in diabetes, in diabetes, in diabetes, blood glucose increases, so more and more glucose is converted to sorbitol. This sorbitol accumulate in lens to produce snowflake cataract. And this first enzyme is aldose reductase. So two questions are asked. Snowflake cataract is due to accumulation of which compound? Sorbitol. Snowflake cataract is due to accumulation of sorbitol. First question. Question is asked that which enzyme is responsible for snowflake cataract? The answer would be aldose reductase. Aldose reductase. Clear? एक ब्रेक ले लेते हैं, डिनर ब्रेक लेते हैं, कोई बात नहीं, इसमें कोई खास टाइम नहीं लगेगा, हमें फटाफट कर लेंगे। तो 30 मिनट्स का। यस, कोई नहीं, अभी बच्चे 30 मिनट्स का ब्रेक लेंगे। ओके। हम्म ये कोई बात नहीं, इसे थोड़ा सा फास्ट फास्ट हो जाएगा फिर ब्रेक के बाद। ठीक है। कंप्लीट करना है। तुम सारे कह रहे हो तो यार कर लेते हैं फिर, है ना, इतना प्यार, है ना। यस, ग्लूकोज ट्रांसपोर्टर, ग्लूकोज कर लेते हैं फिर, बच्चे छोड़ के नहीं गए ना, हाँ है सब टिके हुए हैं। यस, सोडियम डिपेंडेंट, सोडियम इंडिपेंडेंट। यस, एल्डोज रिडक्टेज, देखो एंजाइम क्या है ये डायबिटीज में। एल्डोज, ये एंजाइम कौन सा है? एल्डोज रिडक्टेज। ग्लूकोज को सोर्बिटोल में कन्वर्ट किया एल्डोज रिडक्टेज ने। तो एंजाइम रेस्पॉन्सिबल इज एल्डोज रिडक्टेज, कंपाउंड रेस्पॉन्सिबल इज सोर्बिटोल। दोनों क्वेश्चन है। नाउ सोडियम डिपेंडेंट, सोडियम इंडिपेंडेंट। एस फोर सोडियम, एस फोर सेकेंडरी एक्टिव ट्रांसपोर्ट। सोडियम डिपेंडेंट में भी एसजीएलटी 1, SGLT1 and 2, सोडियम ग्लूकोज ट्रांसपोर्टर, एस फोर सोडियम, GL फॉर ग्लूकोज, T4 ट्रांसपोर्टर। इंटेस्टाइन आई लुक्स लाइक वन, इंटेस्टाइन होती भी एक है, तो इंटेस्टाइन में SGLT1 ही है। किडनी में SGLT1 और 2 दोनों होते हैं, दो किडनी है तो SGLT1 और 2 दोनों है। ठीक है। कंसेप्ट क्या है? ORS। ओआरएस में तुमने देखा होगा, इन ओआरएस वी हैव सोडियम, वी हैव ग्लूकोज, बिकॉज सोडियम एंड ग्लूकोज गो टुगेदर, सोडियम एंड ग्लूकोज गो टुगेदर। ओके। यस, किडनी SGLT1 एंड SGLT2। यस, SGLT2 वी फाउंड दैट SGLT2 कई बार डिफेक्टिव होती है, दैट लीड टू रीनल ग्लाइकोसूरिया। रीनल glycosuria means if SGLT2 is not working, kidney will not be able to absorb glucose, it will come in urine, renal glycosuria। हमने यहीं से आइडिया आ गया कि डायबिटीज में ब्लड ग्लूकोज इज हाई, इफ वी इनहिबिट SGLT2 then glucose, extra glucose will be excreted in urine, so gliflogins inhibit SGLT2, gliflogins inhibit SGLT2, SGLT2। Yes, name itself tells you gliflogin, ग्लूकोज को फ्लो हो जाने दो, ग्लूकोज को फ्लो हो जाने दो, SGLT2 इनहिबिट हो गया। लेकिन when glucose will come in urine, that it can cause UTI, side effect UTI, but according to latest edition of Harrison, they have given कि क्लिनिकली साइड इफेक्ट यूटीआई नहीं मिलता, जो यहाँ पर ट्रायल्स मिले हैं उसमें यूटीआई नहीं होता, लेकिन थ्योरेटिकली होता है। ओके, ये हमारा एसजीएलटी हो गया। ग्लूकोज ट्रांसपोर्टर सोडियम इंडिपेंडेंट, ग्लूकोज ट्रांसपोर्टर 1 ब्रेन में और आरबीसी, ब्रेन और आरबीसी में ग्लूकोज ट्रांसपोर्टर 1 आर हाई कंसंट्रेशन। व्हाई? बिकॉज आरबीसी यूटिलाइज ओनली ग्लूकोज, ग्लूकोज एंड ग्लूकोज, एंटरटेनमेंट एंटरटेनमेंट एंड एंटरटेनमेंट। Yes, brain utilize glucose, glucose and glucose, prefer glucose. So nature said that we have a great concentration of glucose transporter 1 in brain and RBC. Question इसी पे आते हैं usually. Glucose transporter 2, yes, लिप किस, नया निमोनिक बनाया मैंने। ओके, लिप किस, लिप भी दो होते हैं, है ना। तो L फॉर लीवर, I फॉर इंटेस्टाइन, यस, P फॉर पैनक्रियास, किस फॉर किडनी। A question was asked that this glucose transporter 2 is present at contraluminal side or basolateral, basolateral और contraluminal। इसको निमोनिक बनाया था मैंने कॉन्ट्राल्यूमिनल, ल्यूमन की दूसरी तरफ, यानी दो, दूसरी तरफ कॉन्ट्राल्यूमिनल। ये क्वेश्चन आया हुआ है, तो याद रहेगा लिप किस। ओके, ग्लूकोज ट्रांसपोर्टर 3 न्यूरॉन्स में होता है। ग्लूकोज ट्रांसपोर्टर 4 ये इंपॉर्टेंट है, हार्ट में होता है। हार्ट में 4 चैम्बर है। यस, 4 चैम्बर है, 4। ओके, हार्ट 4, ग्लूकोज ट्रांसपोर्टर 4। नाउ इफ यू सी हार्ट, yes, this girl saw the muscle of Popeye the sailor and fell in love. After marriage, he became so motu. खाना पीना इतना अच्छा था, तो एडिपोज टिश्यू, तो स्केलेटल मसल, हार्ट, एडिपोज टिश्यू, ग्लूकोज ट्रांसपोर्टर। यस, यस। तो ऐसे किसी भी तरह से निमोनिक याद करना। यस, तो इंटेस्टाइन में कॉन्ट्रा ल्यूमिनल साइड पे ग्लूकोज ट्रांसपोर्टर 2 होता है, ये याद रखना। तो हार्ट, skeletal muscle and adipose tissue. Insulin, these glucose transporter 4 are insulin dependent. Insulin increase concentration of glucose transporter 4
बटर खत्म हो
at
गया क्या सर?
skeletal muscle, cardiac muscle and adipose tissue. भाई, एडि तीनों पे इंसुलिन इसमें ग्लूकोज ट्रांसपोर्टर 4 की कंसंट्रेशन बढ़ा देता है। आफ्टर ओवरनाइट फास्टिंग, ग्लूकोज ट्रांसपोर्टर कंसंट्रेशन डिक्रीजेस इन skeletal muscle, cardiac muscle and adipose tissue. Yes, yes, adipose tissue याद रहेगा। तो तुम कैसे भी याद रख सकते हो। यस, एक निमोनिक ये भी है, मेन फंक्शन ऑफ ग्लूकोज इंसुलिन इज टू डिक्रीज ब्लड ग्लूकोज, बट आई फील इसकी जरूरत नहीं है। तुम्हें ऐसे याद रखना, हार्ट के 4 चैम्बर हैं, ग्लूकोज ट्रांसपोर्टर 4, हार्ट धक धक करने लगा, स्केलेटल मसल, फिर शादी होगी, एडिपोज टिश्यू आ गया। ऐसे याद रख लेना, इंसुलिन इंक्रीज द कंसंट्रेशन ऑफ ग्लूकोज ट्रांसपोर्टर 4 in these three. Glucose transporter 5, F45, F4 fructose. It is 4 fructose. F45, F4 looks like S, seminal vesicle. S looks like small intestine. तो glucose transporter 5, yes, yes, ये सोडियम इंडिपेंडेंट है, इनका सोडियम से कोई मतलब नहीं, इनका सोडियम के साथ ही जाएंगे ये, जो ये सोडियम के साथ जाएंगे अंदर ग्लूकोज, यहां पे सोडियम के बिना जाएगा। ठीक है, यस। अब RBC utilize only and only glucose as it has no mitochondria. Yes, insulin increase concentration, not decrease. After overnight fasting, fasting में glucose insulin will decrease. So glucose transporter concentration decrease at skeletal muscle. तो ये दो क्वेश्चन है ये। Insulin increase the concentration of glucose transporter 4 at skeletal muscle, cardiac muscle and adipose tissue. After overnight fasting, fasting में क्या होगा? Yes, insulin will decrease, so glucose transporter 4 concentration will decrease at skeletal muscle, cardiac muscle and adipose tissue. Clear? Now, nature is very wise. Nature said, what is the function of RBC? To transport oxygen. Nature said, okay, I will remove your mitochondria. RBC like, sir, क्या कर रहे हो? How I will utilize different sub compounds? Then nature said, you are traveling in blood. Whenever you will feel hungry, you will utilize glucose. Glucose is always there in blood. इतना ग्लूकोज हमेशा रहेगा कि तेरा पेट भर जाए। यदि ग्लूकोज इतना भी नहीं रहा तो डेफिनेटली आदमी मर जाएगा, हाइपोग्लाइसीमिया तो आदमी मर जाता है। तो मींस ब्लड इज ऑलरेडी हैविंग ग्लूकोज, सो दे आरबीसी नीड नो नीड ऑफ माइटोकॉन्ड्रिया। नेचर रिमूव दैट माइटोकॉन्ड्रिया एंड फिल द स्पेस विद हीमोग्लोबिन। तेरा जो काम है वो कर, ट्रांसपोर्ट ऑफ ऑक्सीजन। दैट्स व्हाई yes, gradually during evolution, yes, mitochondria was removed, and that's why the RBC utilize only and only glucose. Most vital organ, brain, heart and skeletal muscle. Brain, heart and skeletal muscle utilize ketone body in starvation. Okay, question. Liver utilize glucose. First topic was carbohydrate. After the break we will discuss lipid. After that we will discuss amino acid. In the same sequence liver utilize. In the same sequence liver utilize. Okay, last point after that break. Heart utilize fatty acid even in fat state. Heart utilize fatty acid इवन इन फैट स्टेट। तुमने कहा क्यों? मैंने कहा दिल तो पागल है, दिल दीवाना है। अरे इसी तो कहते हैं पागल है, कि तेरे पास इतना सारा ग्लूकोज है पर तू क्या यूटिलाइज कर रहा है? फैटी एसिड। दिल तो पागल है, और इसी दिल पागल की दिल की आवाज सुनते हुए मुझे लगता है कि अब हमें एक छोटा सा प्यारा सा ब्रेक ले लेना चाहिए। यस। और मुझे कहते हुए खुशी हो रही है कि हम अपनी स्पीड पे कायम हैं। ओके। यस। हाइड्रीन। तो जो टारगेट था वो कंप्लीट है लगभग, चिंता वाली बात नहीं है। यस। एक बार, अब हम क्लास ब्रेक ले रहे हैं 30 मिनट्स का। 30 मिनट्स ब्रेक। हाइड्री फ्रक्टोज इंटॉलरेंस करेंगे, ठीक है? हाइड्री फ्रक्टोज इंटॉलरेंस, जो जिसको निकलना है निकलो, एक बार हाइड्री फ्रक्टोज इंटॉलरेंस हम देख लेते हैं। Hereditary fructose intolerance, aldolase B is deficient. When this step will not occur, fructose 1 phosphate will accumulate. This fructose 1 phosphate will inhibit glycogen phosphorylase. Glycogen phosphorylase will be inhibited, so liver will not be able to produce glucose in fasting state, fasting hypoglycemia, hepatomegaly, jaundice would be there. But in this patient, symptom will start after 4 to 6 months, because fructose is a fruit sugar. फ्रक्टोज इज फ्रूट शुगर, मीन्स व्हेन यू विल स्टार्ट वीनिंग, व्हेन बच्चे को तुम जूस देना शुरू करोगे तब सिम्टम आएंगे। तो टिपिकल हिस्ट्री है, यदि बच्चे को यही सिम्टम, सेम सिम्टम, मोर लेस सेम सिम्टम अर्ली इन लाइफ आ रहे हैं, तो दैट इज मे बी क्लासिकल गैलेक्टोसीमिया। इफ दे आर अकरिंग आफ्टर 4 to 6 months, yes, so that may be hereditary fructose intolerance. Actually, in clinical scenario, they don't want you to go in detail of symptoms. Means वो तुम्हें differentiating के लिए टेस्ट वगैरह नहीं देते, because this is a typical history. यदि पेशेंट फर्स्ट वीक, 2 वीक, 3 वीक, 4 वीक में आ रहा है, तो इट कांट बी हेरिडिटरी फ्रक्टोज इंटॉलरेंस एट ऑल, क्योंकि 4 महीने के बच्चे, सॉरी, 1 महीने के बच्चे, 4 वीक के बच्चे को कोई भी फ्रूट जूस नहीं देगा, कहीं भी नहीं देगा। ओके। यस। ठीक। तो ठीक है, ब्रेक ले लेते हैं दोस्त। जो भी डाउट होगा मैं अपना लिंक दे रहा हूं, फिर देखते हैं, अदरवाइज फिर डिले हो जाएगा हमारा। ठीक है, 30 मिनट्स का ब्रेक है। यस। टेलीग्राम में टेलीग्राम लिंक यहाँ पे मैंने दिया है। ठीक, मैं लिंक अभी सेंड भी कर दूंगा। ठीक। 9:20 कर लेते हैं, चलो। 9:20। ओके। इमीडिएटली थिंक अबाउट फैटी एसिड, फ्री फैटी एसिड और फैटी एसिड। सो फैटी एसिड में बी सैचुरेटेड और अनसैचुरेटेड। सैचुरेटेड फैटी एसिड, सैचुरेटेड मीन्स नो डबल बॉन्ड, नो डबल बॉन्ड। ओके। palmitic acid having 16 carbon, stearic acid having 18 carbon. Okay, or you can see, simply remember, when we start counting, we count like 1, 2, 3, 4, 5, 6, 15. 15 on finger, and the palm is 16. So palmitic acid, palm is 16. Okay. Stearic acid, S looks like 8. So definitely, if you remember one, you can easily remember the second one. 16 carbon, 18 carbon. So it is really important, because when we calculate the number of ATP produced by oxidation of fatty acid, then number of carbon is important. So you must know palmitic acid, 16 carbon atoms are there, and they are saturated fatty acid, means no double bond. No double bond. Okay. Unsaturated fatty acid, unsaturated. Yes, yes, स्टेरिंग 18 की एज में पकड़ते हैं ये, पहले भी रेडियो डॉक्टर ने हमें बताया था। यस, स्टीयरिंग जो तुम्हारा कार का होता है 18 की एज में पकड़ा देते हैं हमारे हाथ में। वेरी गुड। अनसेचुरेटेड फैटी एसिड। यस, थैंक यू फॉर नाइस निमोनिक। मे बी मोनो अनसेचुरेटेड, मूफा। MUFA, monounsaturated fatty acid. This may be omega 7 fatty acid, palmitoleic acid. Actually, they ask question directly, single liner. Yes, yes, palmitoleic acid. Yes, 16 carbon, one double bond. 16 carbon, one double bond. Omega 9, mnemonic is eno. Eno on acidity on elaidic acid, and for 9, omega 9, oleic acid, oleic acid. Yes. So in both, there are 18 carbon, one double bond. 18 carbon, one double bond. So if you remember the name, most of time those are sufficient. Palmitoleic acid, 16 carbon, one double bond, omega 7, example omega 9, eno. Yes, omega 3 fatty acid, mnemonic is CAT, CAT, CAT. C for cervonic acid, A for alpha linolenic acid, T for timnodonic acid. Cervonic acid, another name is DHA. Another name is DHA. Commonly asked question on DHA. Constant source of DHA is breast milk. Breast milk. We found that DHA is found in high concentration in retina and cerebral cortex. Cerebral cortex means for the brain development, DHA is required. And early development, development of brain occur in early life, means up to 2 years, some say 5 years, 90% up to 5 years. So we found the early period up to 2 years, DHA should be present in our diet. That's why nature is very wise. Nature said that breast milk will have sufficient amount of DHA. So constant source of DHA is breast milk. Constant source of DHA is breast milk. Okay. Okay. We found there is correlation. This is not the etiology, but correlation. A patient of retinitis pigmentosa, blood DHA level is low. Blood DHA level is low. So these are common question on cervonic acid or DHA. Alpha linolenic acid that is having 18 carbon, 3 double bond. 18 carbon, 3 double bond. Alpha linolenic acid. Yes, what are the advantages of omega 3? Yes, it prevent coronary artery disease. कोरोनरी आर्टरी डिजीज प्रिवेंट करती है, डिक्रीज इन्फ्लेमेशन, डिक्रीज रिस्क ऑफ डिजेनरेटिव डिजीज. ऐसा माना गया है, क्वेश्चन आया हुआ है कोरोनरी आर्टरी डिजीज पे. इट प्रिवेंट कोरोनरी आर्टरी डिजीज, डिक्रीज इन्फ्लेमेशन. नाउ ओमेगा 6 फैटी एसिड, गामा लाइनोलेनिक एसिड, निमोनिक इज गार्लिक, GARLIC. ओके. Gamma linolenic acid, arachidonic acid, and linoleic acid. Okay. We found that arachidonic acid is very, very important. Questions are asked on arachidonic acid. Another name of arachidonic acid is ecosa tetraenoic acid. Ecosa means 20. So arachidonic acid is having 20 carbon. Tetra means 4. En means double bond. So 20 carbon, 4 double bond. Arachidonic acid is having. Questions are asked on arachidonic acid. How many double bonds? R, 4. Sorry to be in Hindi, but you may remember R, 4. Okay. So 4 double bond. Frequently asked question. Why they are asking question on this ecosa tetraenoic acid? We found that arachidonic acid give rise to prostaglandin prostacyclin, thromboxane, leukotriene, lipoxane, and common name to all these is eicosanoids. Yes, eicosanoids means all these eicosanoids are derived from arachidonic acid. Yes, why they are called eicosanoids? Because the arachidonic acid, another name is eicosanoic acid. So they can ask simple question: prostacyclin precursor is arachidonic acid. Prostaglandin precursor is arachidonic acid. So these type of questions are asked. So this is about omega-6 fatty acid. I told you that whatever carbohydrate we eat, 50% approximately used for energy production and approximately 50% is stored. I told you carbohydrate in the initial state, 60-70% of our diet is carbohydrate, and I told that one function is that carbohydrate is converted to glycogen and stored in liver and muscle. This carbohydrate goes to HMP shunt, produce NADPH pentose sugar. Carbohydrate produce energy, and the extra carbohydrate is converted to fat. Means carbohydrate, when energy requirement is fulfilled, extra carbohydrate is stored approximately 10% in the form of glycogen and approximately 40% in the form of triacylglycerol or fat. So I can say extra carbohydrate in our body, extra carbohydrate is converted to fat. So if you want to decrease weight, decrease carbohydrate in your diet. Actually, previously we used to do that. हमने कोशिश भी की बहुत की है. Yes, we tried to decrease weight, and whenever we started decreasing weight, we started taking. In fact, we stopped taking oil, घी घी बंद कर दिया. बिना चुपड़ी की रोटी खा रहे हैं, है ना? But we found that there was no benefit because ultimately whatever in the break you are taking that chips, है ना, that is pure carbohydrate, aloo, है? So that is extra carbohydrate is converted to fat. So that's the reason that if you want to decrease weight, yes, decrease carbohydrate in your diet. That's Atkins diet is low calorie plus low carbohydrate diet. Yes, total calorie must be low, carbohydrate must be low. So low calorie plus low carbohydrate diet. This is Atkins diet. So I just told you that extra carbohydrate is converted to fat. We all know how it is converted. I have already told you that in our body, glucose is converted to pyruvate. Pyruvate enter mitochondria, converted to acetyl coenzyme, Krebs cycle, energy required fulfilled. Extra acetyl coenzyme A is thrown out of the mitochondria. So now you can say acetyl coenzyme A is in mitochondria, cytosol. Yes, cytosol. Yes, I have already discussed this part. If you remember, I took a little bit more time in that. Yes, at that time I told you that extracellular coenzyme is thrown out of the mitochondria. Now fatty acid synthesis take place in cytosol. Fatty synthesis take place in cytosol. I told you that the carbohydrate is stored as glycogen, HMP shunt, energy requirement. When energy requirement was fulfilled, extra carbohydrate is converted to fat. I told you extra carbohydrate is converted to fat, but fat cannot be converted to carbohydrate. Exception were glycerol and propionic acid. Leave that. Again, come to our main topic, which we are discussing, that we have so much of acetyl coenzyme in cytosol. We have sufficient amount of acetyl coenzyme in cytosol. Now I want to convert into fat. I ask you that, yes, I am skipping this citrate shuttle. Okay. So I just gave you simple idea that fatty acid synthesis, we are starting fatty acid synthesis, and I am avoiding this discussion. I am simply saying that we have sufficient amount of acetyl coenzyme A in cytosol or extra acetyl coenzyme A in cytosol. Acetyl coenzyme A is having two carbon. I ask you, I ask you, make butyric acid. Butyric acid. Butyric acid is having four carbon, that is CH3, CH2, CH2, COOH. Four carbon fatty acid. Acetic acid is CH3COOH. This is acetic acid. Okay. So you said, okay, two carbon acetic acid. If I join two molecules of two carbon acetic acid, I will find a four carbon butyric acid. No, life is not so simple. At least biochemistry is not so simple. Okay, but interesting and yes, interesting to है. देखते हैं, let's see. So we said, first of all, this 2 carbon acetyl coenzyme will be converted to 3 carbon malonyl coenzyme. 2 से 3 कार्बन बनाएंगे. When you will join 1 carbon, means CO2 will be joined. And that is called carboxylation. That is called carboxylation. That's why the name of enzyme is acetyl coenzyme carboxylase. Acetyl coenzyme carboxylase. Another name for the same enzyme is malonyl coenzyme synthetase. Synthetase. What is the difference between synthase and synthetase? Synthase, no ATP used. Synthetase, ATP used. So in this synthetase, ATP is used. So mnemonic I have already told you, ABC. Carboxylase, ABC. ABC. ATP is used. Carboxylation, biotin. C, CO2 is joined. Okay. So how you remember synthase and synthetase? In which ATP is used? If you pronounce synthetase, even in pronunciation, you will require more energy. Synthetase, synthase. Okay. So yes. So ATP is used. Okay. In synthetase. In this way, you converted acetyl coenzyme to malonyl coenzyme. Now you have both acetyl and malonyl in cytosol. तुम्हारे पास now you are having in cytosol, I write here, this is occurring in cytosol. Okay, you are having acetyl malonyl, means few acetyl are converted to malonyl, but at a point of time I can say in cytosol I have both acetyl, I have malonyl. Acetyl 2 carbon, malonyl 3 carbon. Now further synthesis will take place on fatty acid synthase complex. Fatty acid synthase complex. This is fatty acid synthase complex. This is multi-enzyme complex. Multi-enzyme complex. Each monomer, it is a dimer. It is a dimer. Multi-enzyme complex is a dimer. Each dimer has 6 enzymes. 6 enzymatic activity. Each dimer, each monomer, each monomer. Yes, each monomer has 6 enzymatic activity. Monomer में है. देखो दो नाम है इसके, एक ही एंजाइम, वन एंजाइम हैज टू नेम. एस्टाइल कोएंजाइम ए कार्बोक्सिलेज. Yes, in this acetyl coenzyme CO2 is joined, that's why acetyl coenzyme carboxylase. In this malonyl coenzyme is synthesized, that's why another name is malonyl coenzyme synthetase, and this is the rate limiting enzyme of fatty acid synthesis. This is rate limiting enzyme. Question is asked. Now this is main enzyme. If question is asked what is the main enzyme, then you will say the main enzyme is fatty acid synthase complex. In this dimer is there and this is X shape. This is X shaped. Okay. Each monomeric unit is having how many enzymatic activity? 6 enzymatic activity. Although it's difficult to remember each and every enzyme, a little bit idea you must have. निमोनिक के साथ देखेंगे, थोड़ा सा आइडिया ले लेते हैं. if you are going for INICET, definitely it is important because this was a favorite topic of PGI Chandigarh. So it used to be. Now it's a part of INI. So if you are thinking of that, definitely you should not skip this. And you never know, in NEET they can ask because previously they have asked question. In simplified form, this fatty acid synthase complex, we can write fatty acid synthase complex is having two monomeric unit, one monomeric unit, one monomeric unit. Yes, having one end having cysteine, second end is having pantothenic acid. So one end is having cysteine, one end is having pan. Another subunit, cysteine, pan. But if you look at me, two units, two subunits, or two monomeric unit, each monomeric unit is having cis and pan end. Cis end of one is against pan end of another. हाथ में मेरे pan है ये cis, ये pan. तो cis is against pan, pan is against cis. Okay, so at one side you can say cysteine and pan end. We found that acetyl cytosol is having acetyl group. Yes, you know cytosol is having acetyl group. Cytosol is having malonyl coenzyme. Cytosol is having this dimer. So we found that in cytosol, this dimer was already present. This dimer was already present. Acetyl was already present. We converted few molecule of acetyl to malonyl. Malonyl also there. Acetyl bind with cysteine. Malonyl bind with pannate. So question has been asked previously, acetyl bind with cysteine. So mnemonic is acetyl, C4 cysteine. Okay, pan bind with malonyl. Now, I know एंजाइम नहीं याद रहेंगे, कोई दिक्कत नहीं. Little bit idea. Sometimes in exam questions are asked, and if you have idea, you can exclude the option. That's why I'm showing you this animation. Yes, this is fatty acid synthase complex. In this first enzyme is MAT. That is malonyl acetyl transacylase, MAT of alanine. Now MAT of alanine will take acetyl group and join it to cysteine end. The MAT will join malonyl to pan end. So in this, if you don't remember the enzyme, most of time they have not asked, but this question has been asked: acetyl bind with cysteine, malonyl bind with pan. Now, now घर का मैट भी ले सकते हो, अलादीन का भी मैट ले सकते हो. नेक्स्ट एंजाइम इज कास, कीटो एसाइल, कीटो एसाइल सिंथेस, कीटो एसाइल सिंथेस. इसको मैं कसाब याद रखता हूं, कसाब ने बॉम्ब ब्लास्ट किया था. तो कास, कीटो एसाइल सिंथेस टेक दिस एसिटाइल ग्रुप, two carbon, acetyl group is having two carbon, and take to the malonyl coenzyme 2 plus 3 5, 2 plus 3 5. Condensation reaction occur, bomb blast, and whenever blast is there, carbon dioxide is released. How many carbon left? 4 carbon. Yes, we wanted to synthesize butyric acid. Butyric acid was having 4 carbon. So again I repeat, first of all, 2 carbon compound we attached cysteine, 3 carbon compound we attached pan. Now ketoacyl synthase will do condensation reaction and CO2 is removed and ketoacyl compound is produced. Ketoacyl. Ketoacyl is having how many carbon? 4 carbon. Ketoacyl is having how many carbon? 4 carbon. But this is not butyric acid. Point it out. I told you butyric acid CH3, CH2, CH2, COOH. But this is keto group. So you have to reduce this keto group, and that is done by three enzyme. First is ketoacyl reductase. CAR होता है, but ये है CAR. CAR reductase. Wherever reductase would be there, reductase means joining of hydrogen. And I told you in fatty acid synthesis, yes, in fatty acid synthesis, we require NADPH. And that NADPH come from which shunt? HMP shunt. NADPH come from HMP shunt. So ketoacyl reductase, I told you initially, wherever you want reduction, you require NADPH. So this car will require NADPH. H horn ये आवाज से याद हो गया. Yes. Now we found that next enzyme is dehydratase. Why? But on the card goes swish, swish, swish. Dehydratase. Now we found that engine oil is reduced. Enoyl reductase. Enoyl reductase. Again reductase. And again reductase. Reductase means joining of hydrogen, and hydrogen comes from NADPH. So even if you don't remember, but now you will never forget at least the three name, reductase, dehydratase, reductase. There's a sequence, and ultimately 4 carbon fatty acid, butyric acid is formed. Butyric acid is formed. Okay. Now, in this way, this cycle will continue. Butyric acid 4 carbon now will be transferred to cysteine. यदि नहीं याद रहे कोई दिक्कत नहीं. New malonyl. Now 4 plus 3. 4 plus 3 7. 4 plus 3 7. Again ketoacyl synthase. Bomb blast, CO2 removed. 6 carbon compound. 6 ketoacyl reductase. NADPH provide H, then dehydratase, then enoyl reductase, again 6, yes, enoyl reductase, and 6 carbon fatty acid will be produced. So in each cycle, yes, in each cycle, 2 carbon atom are joined. Ultimately, 16 carbon fatty acid palmitoyl coenzyme is produced. Yes, ultimately 16 carbon fatty acid palmitoyl coenzyme A is produced, and this palmitoyl coenzyme A is released by, yes, thioesterase. मैंने इसे उस्त्रा बना दिया. Yes, you must have seen the old movies that the old ustra. Yes, they used to do with the palm. They used to sharpen it with the palm. Palm. तो उस्त्रा किसे कट करेगा? पाम को कट करेगा. पामेटोइक एसिड और palmitoyl coenzyme को रिलीज करेगा. तो मोस्ट कॉमन फैटी एसिड सिंथेसाइजेस palmitoyl coenzyme A. Yes, thioesterase. So now I can say that this ketoacyl reductase, this require NADPH. Yes, NADPH. NADPH. This comes from ACP's acyl carrier protein. इतना डिटेल में नहीं जाते हम, है ना. This comes from HMP shunt. Other sources are also there, but HMP shunt for the time being, you will remember. Yes, this. Ultimately, most common fatty acid. Most common fatty acid. Yes, synthesizes palmitoyl coenzyme A. Clear? Palmitoyl coenzyme A. So इसमें तुम्हें याद क्या रखना है? Palmitoyl coenzyme most common fatty acid है. At least you must remember the sequence: reductase, dehydratase, reductase, and in this fatty acid synthesis HMP shunt is required. Why I am focusing so much on this integration, putting effort? A question was asked. Yes, we have already discussed, although in carbohydrate you all know everything is integrated. We all know that NADPH is used in fatty acid synthesis. This NADPH is produced by glucose 6-phosphate dehydrogenase. Glucose 6-phosphate dehydrogenase. If glucose 6-phosphate, glucose 6-phosphate dehydrogenase, if this is deficient, so which pathway would be affected? HMP shunt would be affected. So primary pathway which would be affected would be HMP shunt. They ask secondary pathway which would be affected. So means if G6P deficiency is there, primary pathway affected is, yes, HMP shunt, and secondary pathway which would be affected, it may be fatty acid synthesis, it may be cholesterol synthesis, but question is asked on fatty acid synthesis because we know NADPH is required for fatty acid synthesis. Okay, clear? Got the point? So again, we come to our main topic. Yes, in this, there was an enzyme ketoacyl synthase, जो कसाब था ketoacyl synthase, that do condensation reaction. Condensation reaction. Yes, yes, condensation reaction. And in this condensation reaction, ये मैंने जो मेन वीडियोस है उसमें बड़ा डिटेल में डिस्कस किया हुआ है, और जो अपने मिशन वाली क्लासेस है उसमें भी डिटेल में डिस्कस है। ओके, तो कोई कंफ्यूजन हो देख लेना दोस्त। हाँ, अभी हम आगे बढ़ेंगे, मजबूरी है हमारी, कोई कोर्स पूरा करना है। यस, तो कंडेंसेशन रिएक्शन CO2 इज रिमूव्ड। ओके, so this question has been asked in PGI Chandigarh, previously used to be. Okay, so for the time being, we know this. Yes. Now we come to ketone body, ketoacidosis or ketone body synthesis. Ketone body synthesis. You all know ketoacidosis occur in starvation and diabetes. We have heard so many times diabetic ketoacidosis, starvation ketoacidosis. When ketone bodies are so toxic, why our body is synthesizing ketone bodies? Yes, we have the answer. Most vital structure, brain, heart, and skeletal muscle utilize ketone body in starvation. That's why we synthesize ketone body. ये मजबूरी है, otherwise it is very toxic. So we know that ketoacidosis occurs in starvation and diabetes. I will discuss shortly that beta oxidation of fatty acid occur in starvation and diabetes. I have already discussed gluconeogenesis also occur in starvation and diabetes. So I can say these three, ketone body synthesis or ketoacidosis, beta oxidation of fatty acid, gluconeogenesis occur in starvation and diabetes. So three pathway occur in starvation and diabetes. All are question. Yes, all are question. That ketone body synthesis occur in starvation and diabetes, beta oxidation of fatty acid occur in starvation and diabetes, gluconeogenesis occur in starvation and diabetes. We found that ketone body synthesis occur in mitochondria. So this is mitochondria ketone body synthesis. Beta oxidation में discuss करूंगा. Beta oxidation also occur in mitochondria. Gluconeogenesis we started with gluconeogenesis inside the mitochondria. When we discussed gluconeogenesis at that time, if you remember, yes, just to make you recall, yes, or this is really really important, that's why I'm repeating it. I told you that gluconeogenesis start in mitochondria, and acetyl coenzyme is activator of gluconeogenesis. So gluconeogenesis start in mitochondria, occur in starvation and diabetes. ध्यान से सुनना. Yes, gluconeogenesis occur in starvation and diabetes and start in mitochondria. Beta oxidation occur in mitochondria, starvation and diabetes. Ketone body synthesis occur in starvation and diabetes, occur in mitochondria. Means these three pathway occur in same condition, सेम कंपार्टमेंट. कुछ ना कुछ तो है दया, कुछ ना कुछ तो है दया. CID बनना है तुमने. Okay, so you have to become CID with a relation of all these pathways. Three pathways are really really important. Questions are being asked. So for the time being, we discuss ketone body synthesis. We found that two acetyl coenzyme join to form acetyl, then it is converted to HMG coenzyme. HMG coenzyme is the rate limiting enzyme. So I will not put extra burden on you, but at least you must know we started with the acetyl coenzyme and the rate limiting enzyme is HMG coenzyme synthase. This HMG coenzyme is converted to ester state. Ester state is the first ketone body to be synthesized. Okay. Name is HMG coenzyme lies. Even if you don't remember, it's okay. But at least you must know ester state is the first ketone body. This ester state is converted to beta hydroxybutyrate. This is the most common ketone body present in blood. You can easily remember beta, बहुत सारे, B for बहुत सारे, B for big amount. So beta hydroxybutyrate is present in large amount. Most common ketone body present in blood. Acetate is converted to acetone. These are three compounds which are termed as ketone bodies. So now they will give you clinical scenario and they will give the patient is having diabetes and now the ketone bodies are increased and they will ask which ketone body is present in maximum amount in blood. Definitely answer would be beta hydroxy butyrate. Answer would be beta hydroxy butyrate. Okay. So this is about ketone bodies. Now acetoacetate is ketone body. A question was asked that first ketone body to be synthesized. Yes, acetoacetate. Most common ketone body present in blood, beta hydroxy butyrate. Yes. Now, yes. Ketone body utilization. Let me discuss ketone body utilization. We found that acetoacetate is converted to acetoacetyl coenzyme A. Although, if you want to write, I can write here succinyl coenzyme A is converted to succinate. Although it's not so important, but the name of enzyme is important. The first enzyme which is used here is thiophorase. So ketone body utilization enzyme is thiophorase. This thiophorase is absent in liver. Absent in liver. Okay. So liver is the organ which can synthesize ketone body but can't utilize ketone body due to deficiency of which enzyme? Yes, liver is the organ which can synthesize ketone body but can't utilize ketone body due to deficiency of thiophorase. Thiophorase. Okay, clear? Now to detect ketone bodies, we have Rothras test. We have Rothras test. Yes, Rothras done for ketone bodies. Yes, positive Rothras test when purple color ring is seen at junction of two liquid. देखो, how to remember? I will remember ketone as stone, Rothras as throw. Yes, and purple as propel. जिनके घर शीशे के होते हैं वो दूसरे घर पत्थर नहीं फेंकते, है ना? तो स्टोन, थ्रो, प्रोपेल. तो स्टोन एज कीटोन, ऑल्दो इफ यू रिमेंबर इट्स सो गुड, है ना? थ्रो रोथ्रास, प्रोपेल पर्पल कलर, पर्पल कलर. ओके, ठीक है. तो ये तुम्हें याद आ गया. अब एक क्वेश्चन आएगा. यस, फर्स्ट ईयर वाइवा में आता है बिल्कुल यार, है ना? वो भूलने नहीं देते. पर कई बार ऐसा होता है ना कि हम भूल जाते हैं. मतलब अभी इतने सारे 19 सब्जेक्ट हैं तो भूलना स्वाभाविक है. तो उसके लिए कभी कभी याद आ जाए. कीटोएसिडोसिस, एक्चुअली मैं तो भूलता ही बहुत हूँ. मैं तो कई बार अपनी वाइफ को भूल जाता हूँ. हाँ, फिर वो याद दिलाती है. हाँ, तो इसीलिए मैंने निमोनिक बनाने शुरू किए. लेकिन वाइफ फिर भी याद नहीं रहती. हाँ, ओके, चलो. रोथरास टेस्ट के बारे में हमने निमोनिक बनाया. रोथरा को थ्रो करा हमने, प्रोपेल को, प्रपल को प्रोपेल किया. ओके, और कीटोन को स्टोन किया. हम्म. हम्म. कैप ग्रास, हा 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 हा, बिल्कुल याद आ गया. साइकेट्रिक याद दिला रहे हो, हैं? चलो, कीटो एसिडोसिस, रोथरास टेस्ट. यस. एक बार मैम ने सुन लिया सर की चाय कैंसिल. चाय तो मैंने ही बनानी होती है, घर में सारा काम मैं ही करता हूँ. कैंसिल कैसे? बनानी तो मैंने ही है. हाँ, ऐसा हो सकता है कि बनानी पड़े और फिर मुझे मुझे ही ना मिले. ऐसा हो जाता है कई बार कि तुम आज चाय बनाओगे लेकिन मिलेगी नहीं. वो बनाओगे तो रोज की तरह, वो मिलेगी तुम्हें आज नहीं. ओके. यस. यस, कीटो एसिडोसिस रोथरास टेस्ट इज पॉजिटिव. बिल्कुल सही बात है. इन डायबिटीज In diabetes, blood glucose is high, so extra glucose will come in urine, so Benedict test is positive. In starvation, you are not taking food, so Benedict test would be negative. So clinical scenario they will give that a patient is there and you did Rothras test is positive and Benedict test is positive. Diagnosis is yes, diabetes. Is if Rothras test is positive, Benedict test is negative. Diagnosis is yes, starvation. Yes. सो यहाँ तक हमने थोड़ा बहुत देख लिया कीटोन बॉडीज के बारे में, बड़ा ही सिंपल था, मैंने लिखवा भी दिया यहाँ पे बीटा ऑक्सीडेशन, कीटोएसिडोसिस, ग्लूकोनेसिस, अकर स्टारवेशन, एंड डायबिटीज। बिल्कुल सही बात है। यस, नाउ वी हैव डिस्कस कीटोएसिडोसिस, वी हैव डिस्कस ग्लूकोनियोजेनेसिस, एंड वी हैव डिस्कस, नाउ वी आर गोइंग टू डिस्कस बीटा ऑक्सीडेशन ऑफ फैटी एसिड। Now you are in starvation. There is no glucose to produce energy. Leave aside, don't worry. I will produce energy from fat. इतना सारा फैट किस लिए रख रखा है ये? इसलिए तो रखा है कि मजबूरी आएगी तो मैं इसको यूटिलाइज कर लूंगा. So now I mobilize my fatty acid and now I am producing energy from fat. Yes, beta oxidation of fatty acid can be divided into three steps. First is activation of fatty acid. देखो फैट को एक्टिवेट करना आसान नहीं है, काम तो करना चाहता ही नहीं फैट. यस, फर्स्ट ऑफ ऑल यू हैव टू मोटिवेट दिस फैट. यस, फर्स्ट ऑफ ऑल ग्रुप नेम ऑफ फैटी एसिड इज एसाइल. अगेन सॉरी, ये मुझे पहले ही बता देना चाहिए था तुम्हें, लेकिन कोई बात नहीं. ग्रुप नेम ऑफ फैटी एसिड इज एसाइल. इफ आई से पामिटिक एसिड इज एसाइल, स्टेरिक एसिड इज एसाइल, और पामिटोइल कोएंजाइम इज एसाइल कोएंजाइम, स्टेरिल कोएंजाइम इज एसाइल कोएंजाइम, एसिटाइल कोएंजाइम इज एसाइल कोएंजाइम, प्रोपियोनिल कोएंजाइम इज एसाइल कोएंजाइम. कॉमन नेम टू ऑल फैटी एसिड इज एसाइल. So first of all, I will activate fatty acid, and in this fatty acid is converted to acyl coenzyme A. Acyl coenzyme A. And in this ATP is converted to AMP. When ATP is converted to ADP, one high energy phosphate is used. When ATP is converted to AMP, two high energy phosphates are used equivalent to 2 ATP. भाई हमने इसको थोड़ा एक्टिवेट किया, चढ़ा दिया कि तू कर सकता है. यस यू कैन डू, यू कैन प्रोड्यूस एनर्जी. यस, डर के आगे जीत है. गो टू माइटोकॉन्ड्रिया एंड प्रोड्यूस एनर्जी. माउंटेन ड्यू. बट माउंटेन ड्यू में पैसे तो लगेंगे ना. तो हाउ मच एनर्जी यू इन्वेस्टेड, हाउ मच मनी यू इन्वेस्टेड? 2 एटीपी. तो माउंटेन ड्यू पिला के इसको एक्टिवेट कर दिया कि जा भाई. यदि माउंटेन ड्यू ना हो तो एक पौवा लगा दो, है ना. फिर भाई कहेगा बता भाई क्या काम है, क्या करना है ना. सो आफ्टर दैट लिटिल लवली ही स्टार्टेड सेइंग, बता भाई का क्या काम है. भाई को बता, डोंट वरी. यस, आज गाड़ी तेरा भाई चलाएगा. Yes, definitely. आज गाड़ी तेरा भाई चलाएगा. Now this fatty acid want to enter the mitochondria, but this fatty acid realized that I can't cross inner mitochondrial membrane. Then we said, don't worry, we have car for you. We have carnitine. We have carnitine. Car of James Bond. Car of James Bond. कहीं भी जा सकती है. Now your friend will take the car, yes, and enter the mitochondria. Also required petrol. Yes, car also required petrol. So now second step is transport of fatty acid. Now, other than carnitine compound, we also require an enzyme. The name of enzyme is CPT1. Carnitine palmitoyl transferase 1. CPT1. So one thing I want to add it, that this is present at outer mitochondrial membrane. तो याद रखना, ये कभी गलती से आंसर गलत ना लगा देना. CPT1 is present at outer mitochondrial membrane. So with the help of this car, with the help of this petrol CPT1, yes, rate limiting enzyme. This is rate limiting enzyme of fatty acids oxidation enter the mitochondria. Suppose this was palmitic acid. This was palmitic acid. Yes. तो यदि तुम इसका दूसरा नाम लिखना चाहते हो तो यस CAT कैट. यस जेम्स बॉन्ड की कार. जेम्स बॉन्ड अपनी बिल्ली साथ लेके घूमता है, तुम्हें पता ही है. कार्निटीन एसाइल CAT CPT CPT1 एक ही बात है, दो नाम है. CAT और CPT एक ही बात है बिकॉज द कॉमन नेम, यस, द ग्रुप नेम ऑफ fatty acid is acyl. The group name of fatty acid is acyl. So carnitine acyl transferase or carnitine palmitoyl transferase. Now this fatty acid entered the mitochondria. Now in mitochondria there would be beta oxidation of fatty acid. Beta oxidation means a cut between C2 and C3. This cut is done by four enzymes. One is dehydrogenase, hydratase, dehydrogenase, thiolase. Four enzymes. You know, beta oxidation. Beta oxidation means removal of hydrogen. Removal of hydrogen is called oxidation. So dehydrogenase, hydrogen is removed, taken up by FAD to form FADH. Dehydrogenase, hydrogen is removed, taken up by NAD to form NADH. FADH produce 1.5 ATP, NADH produce 2.5 ATP. So you can say to cut this bond between C2 and C3, yes, we require these four enzymes, and when we will cut, we will produce energy, and that will be equivalent to 1.5 and 2.5, that is 4 ATP. 4 ATP. ओके. यस. तो मैंने इसमें CPT2 के बारे में और ट्रांसलोकेज के बारे में डिस्कस नहीं किया. आई एम डेलिबरेटली लिविंग दिस. यस, वेरी गुड. यू डू रिमेंबर द एनिमेशन. तो मुझे दिखाना तो पड़ेगा क्योंकि फ्यू स्टूडेंट्स आर न्यू. यस, कुछ स्टूडेंट्स ने ज्वाइन किया है बाद में. बीटा ऑक्सीडेशन. यस, फर्स्ट डिहाइड्रोजिनेस फाड़ दिया. यस, hydrogen is removed, taken up by FAD to form FADH. Now this woodcutter thought that it is really hard, so he took water to make it soft. Yes, hydratase. Then again dehydration. Yes, dehydrogenase. Hydrogen is removed, taken up by NAD to form NADH. Now a small portion is left. Now thiolase, thiolase, a dog, है ना. यस, थाई पे यस पुष्प आ जाए भाई अपना ये. ठीक है. सो now you will never forget the sequence. Dehydrogenase, removal of hydrogen, पानी डाला, soften, then water, yes, soften, then dehydrogenase, NADH, and thiolase. In this way, every time it will cut, 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 cut. Yes, yes, yes. मैंने पहले एनिमेशन बनाना सीखा. यस, बट इट वाज टेकिंग लॉन्ग टाइम. तो मेरा एक दोस्त है चाहत, लड़का है लड़की नहीं है, पहली बात बता दूं मैं तुम्हें, है ना. तो चाहत ने हेल्प की इन सभी एनिमेशन को बनाने में. उसने ही बनाया, फिर मैं आइडिया देता रहा. जब तक तुम्हें नहीं पता कि कैसे बनते हैं तो यू कांट टेल देम. ओके. तो तो चाहत भाई है अपना, वो रोक करता है हमेशा. यस, यस, ठीक है. So now every time it cut, two carbon are removed. So if total carbon 16, number of acetyl coenzyme would be 8. Number of cut would be 7. ATP used, 2 ATP used. One acetyl coenzyme may enter Krebs cycle to produce 10 ATP. To produce, yes, 10 ATP. 10 ATP. तो 8 एसिटाइल कोएंजाइम में 8 इंटू 10 80 ATP. One cut produce 4 ATP, so 7 cut will produce 7 into 4, 28 ATP. 2 ATP were used, so 108 minus 2, 106 ATP net gain. Net gain of ATP 106. Okay, 106. But in palmitic acid, I need not to remember this complicated calculation. I can simply do palmitic acid is having 16 carbon. If I do oxidation, put O here. So 106 ATP net gain. Yes, 10. Very good. 2 ATP were used in the पौवा जो तुमने पिलाया था उसे. Mountain Dew. Yes. So for Mountain Dew activation of fatty acid, you use 2 ATP. Okay. Yes, very good. So in this way, you produced 106 ATP from one palmitic acid. Yes, yes. So 16 carbon fatty acid net gain 106 ATP. So one function of this acetyl. Now ध्यान से सुनो भाई. Yes. पाम को तो हम ऐसे याद करते हैं ना 1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 एंड पाम इज 16. ओके चलो फास्ट रिवाइज कर देते हैं इसको एक बार. I will revise it 2-3 times because I'm going to. Yes, recently asked question है topic recently asked and this was really difficult question when this was asked. So let me revise. A patient is in starvation, there is no glucose to produce energy. Then we decided, or the body decided, that we will produce energy from fatty acid. We took example palmitic acid. Most common fatty acid which is used for energy production is palmitic acid, having 16 carbon atom. First of all, we activated palmitic acid. In this activation, 2 ATP used. This fatty acid is converted to acyl coenzyme A. Now this fatty acid will enter the mitochondria, but inner mitochondrial membrane don't allow fatty acid to enter the mitochondria. So fatty acid enter the mitochondria with the help of carnitine, the compound carnitine. Other than carnitine, we require enzymes. 3 enzymes are also required. Out of 3 enzymes, I am mentioning only one, that is CPT1, carnitine palmitoyl transferase, palmitoyl or acyl. Yes, or carnitine acyl transferase, CAT1 or CPT1. With the help of this enzyme, this is rate limiting enzyme, this fatty acid will enter the mitochondria. Now beta oxidation occur. Beta oxidation means a cut between C2 and C3. Cut between C2 and C3. When this cut will be done, it will require 4 enzymes: dehydrogenase, hydratase, dehydrogenase, thyrase. First dehydrogenase produce FADH, second dehydrogenase produce NADH. Ultimately FADH produce 1.5 ATP, NADH produce 2.5 ATP. So one cut will produce 4 ATP. And this 2 carbon compound will be released as acetyl coenzyme A. This acetyl coenzyme A will enter Krebs cycle to produce 10 ATP. Palmitic acid having 16 carbon will produce 8 acetyl coenzyme A. Yes, 16 carbon, total carbon 16. So acetyl coenzyme is having 2 carbon. So definitely palmitic acid will produce 8 acetyl coenzyme A. These 8 acetyl coenzyme A will enter Krebs cycle to produce 80 ATP. One cut produce 4 ATP, and one cut, second cut, third, fourth, fifth, sixth, seventh cut will produce 8 acetyl coenzyme A. So 7 cut will produce 8 acetyl coenzyme A. One cut produce 4 ATP, 7 will produce 28. ATP used in activation 2 ATP. Net gain is 106 ATP. Okay, 106 ATP. And we can easily remember palmitic acid is having 16 carbon. If you do oxidation, if you put O of oxidation here, you will find 106 ATP. Okay, so in this way I produce energy. Now my energy requirement is fulfilled, or I was means liver is thinking about something else. Liver thought, muscle thought. In fact, I take simple concept of liver. Liver is the main organ of metabolism. It do gluconeogenesis also. So now liver thought that I should synthesize glucose. So now what will happen? This beta oxidation will occur. This beta oxidation occur, and this acetyl coenzyme will activate gluconeogenesis, will activate will activate gluconeogenesis. If you remember, I told you that gluconeogenesis occur in starvation. Yes, gluconeogenesis occur in starvation. Gluconeogenesis start in mitochondria. Yes, and acetyl coenzyme is very important activator of pyruvate carboxylase. Acetyl coenzyme is very important activator of carboxylase. So gluconeogenesis start in mitochondria, occur in starvation. Beta oxidation occur in starvation. So when beta oxidation is occurring, yes, when beta oxidation is occurring, at the same time, this, yes, acetyl coenzyme is produced. This acetyl coenzyme will activate pyruvate, yes, carboxylase, and will start gluconeogenesis. We also know that ketone body synthesis also occur in mitochondria. Ketone body synthesis also occur in mitochondria. Ketone body synthesis also occur in starvation. We have recently discussed that ketone body synthesis, two acetyl coenzyme join to form acetyl coenzyme. Ultimately, ketone body is formed. So, third function of this acetyl coenzyme is to take part in ketone body synthesis. So you can say acetyl coenzyme enter Krebs cycle to produce energy. Acetyl coenzyme enter Krebs cycle to produce energy. Acetyl coenzyme activate gluconeogenesis. Coenzyme take part in ketone body synthesis because all these three pathways occur in starvation. Clear? Acetyl coenzyme is not entering gluconeogenesis. It is activating. Acetyl coenzyme is not a substrate for gluconeogenesis. Acetyl coenzyme is activator of gluconeogenesis. This is a really, really important question. Okay? Yes. Yes. So in this way, if now I simplify, I'm not going in depth, but I am simplifying. If beta oxidation is defective, if beta oxidation is defective, if beta oxidation is not occurring, then gluconeogenesis would not occur. If beta oxidation is not occurring, acetyl coenzyme will not produce, gluconeogenesis would not be there, hypoglycemia. Hypoglycemia, many times patient present with seizures. When beta oxidation is not occurring, ketone body synthesis will not occur, decrease ketone bodies. So in defect in beta oxidation, defect in beta oxidation will lead to decreased ketone bodies and hypoglycemia. Yes or no? Okay. Now, this question was asked recently in our NEET. Before that, if I say this dehydrogenase may be of two type: long chain dehydrogenase, medium chain dehydrogenase. Medium chain acyl coenzyme dehydrogenase. Ultimately, this dehydrogenase for beta oxidation of fatty acid. We found that medium chain acyl coenzyme dehydrogenase enzyme used in beta oxidation of fatty acid. If there is deficiency, if deficient, then there would be decrease gluconeogenesis, hypoglycemia, seizures, maybe there, decrease ketone bodies. Yes or no? Yes. ये कोई डाउट यहां तक? प्लीज डू कमेंट. देखो, हम इतनी मेहनत कर रहे हैं. यस. तो कोई डाउट नहीं आना चाहिए. जमाइकन वोमिटिंग सिकनेस बाद में करेंगे. यस. इसमें हमने देखा carnitine deficiency. If carnitine is deficient, then this is deficient. Fatty acid will not enter the mitochondria. So beta oxidation will not occur. So beta oxidation will not occur. So there would be hypoglycemia. If carnitine is deficient, then I write here beta oxidation not occurring, hypoglycemia, decreased gluconeogenesis, decreased ketone bodies, hypoglycemia, hypoglycemia. देखो हमने मसल के बारे में इतना बताया नहीं था. We did not discuss so much about the muscle, although whatever we read, each and every point is important. Yes, skeletal muscle use fatty acid in starvation. Yes or no? I have not mentioned it previously, but yes, you know, fatty acid in muscle also utilize fatty acid in starvation. Yes, fasting state. So this is important point, means muscle is utilizing fatty acid, beta oxidation of fatty acid, beta oxidation of fatty acid for energy production. But due to carnitine deficiency, muscle will not be able to utilize fatty acid. When muscle will not be utilized fatty acid, this fatty acid will accumulate. It will bind with glycerol to make triacyl glycerol with long chain fatty acid. With long chain fatty acid, why they have mentioned, this question was asked in our NEET. This point was important. Triglyceride with long chain fatty acid. Why they have mentioned this? Because medium chain fatty acid, short chain fatty acid can directly enter mitochondria, don't require carnitine, don't require carnitine. That's why in carnitine deficiency, the triglyceride accumulated will be having long chain fatty acid. Okay, long chain fatty acid. So muscle would be there. Exercise intolerance, you will not be able to exercise. Muscle cramp would be there. Muscle biopsy, fat vacuoles may be there. So this question was given. They gave that exercise intolerance, muscle cramp, muscle biopsy was having fat vacuole, and the accumulated compound was triglyceride with long chain fatty acid, enzyme deficient. Okay. Medium chain fatty acid, short chain fatty acid don't require carnitine. They can enter mitochondria. So in muscle, if I say medium chain, short chain fatty acid will be utilized. If carnitine is deficient, long chain fatty acid, LCFABs, long chain fatty acid will not be utilized. So long chain fatty acid will accumulate in muscle and it will make triglyceride binding with glycerol, means long chain fatty acid binding with glycerol to form triglyceride. So muscle will not be able to produce energy because muscle utilize fatty acid in fasting and starvation to produce energy. So exercise intolerance, muscle cramps would be there. Okay, yes, clear now. यस डेफिनेटली यार, हम डाउट बाद में ही लेंगे, अदरवाइज हमारा आज का टारगेट पूरा नहीं हो पाएगा और हमारा पर्पस है कि हम फास्ट रिवाइज करें. ओके डियर. जमाइकन वोमिटिंग सिकनेस. थैंक यू. मैं भावनाओं में बह गया था, है ना. बह जाते हैं कभी कभी. यस. Jamaican vomiting sickness, we found that ackee fruits, unripe, unripe ackee fruits, if you eat, this ackee fruit has hypoglycin. Hypoglycin. This hypoglycin inhibit dehydrogenase. So beta oxidation of fatty acid will be inhibited. So there would be hypoglycemia, decreased ketone bodies. Decreased ketone bodies. Yes. Yes. So Jamaican vomiting sickness. If you eat unripe ackee fruit, this is having hypoglycemia, which will inhibit dehydrogenase. Beta oxidation would not occur. Hypoglycemia would be there. Decreased ketone body would be there. And in this name itself tells you vomiting would be there. Vomiting would be there. तो इसको खाना खिला दो. नहीं, खाना नहीं खाए. Whatever the patient would eat, that the patient will vomit. That's why patient goes into starvation, and that can lead to death. That can lead to death. Okay, clear? यस। अब हम आगे बात करते हैं। I told you two opposite pathways are regulated in such a way when one is activated, other is kept in inhibited state. Yes, two opposite pathways. We found that fatty acid synthesis in fatty acid synthesis occur. Acetyl coenzyme is converted to malonyl coenzyme A. We found this malonyl coenzyme A is inhibitor of enzyme CPT1. So when fed state, please tell me, yes, please tell me that if you are in fat state, is there, if you have sufficient amount of carbohydrate, you are converting extra carbohydrate to fat, is there any need to do beta oxidation? Is there any need to do beta oxidation? No. So when fatty acid is being synthesized, this malonyl coenzyme will inhibit CPT1, which is present at outer mitochondrial membrane, And when this will be inhibited, fatty acid will not enter the mitochondria. So beta oxidation will be inhibited and not required. So simple mechanism, nature ने क्या किया? Whenever fatty acid will be synthesized, malonyl coenzyme will be synthesized. This malonyl coenzyme will inhibit CPT1, so beta oxidation will be inhibited. Clear? So, which when liver is actively synthesizing fatty acid, means actively synthesizing malonyl coenzyme, a concomitant decrease in beta oxidation of fatty acid is due to which of the following? Due to inhibition of CPT1. Due to inhibition of CPT1. Clear? Now, beta oxidation of odd chain fatty acid. If I take 1, 2, 3, 4, 5, 6, 7. If I do beta oxidation means cut between C2 and C3, cut between C4 and C5. So ultimately, three carbon unity will be produced. So odd chain fatty acid, the end product is propionyl coenzyme. Propionyl coenzyme. Yes, propionyl coenzyme. Question. Beta oxidation of very long chain fatty acid occur in peroxisome. Very long chain fatty acid occur in peroxisome. In this, yes, very long chain fatty acid. Yes, beta oxidation occur in peroxisome. Alpha oxidation occur in endoplasmic reticulum and peroxisome. In this, yes, I don't want to discuss much about this alpha oxidation. Okay. Beta oxidation of fat odd chain fatty acid. Yes, beta oxidation means cut between C2 and C3. That's every time two carbon unit will be released. Yes. And ultimately three carbon will be released, that is propionyl coenzyme. Beta oxidation of very long chain fatty acid occur in peroxisome. Alpha oxidation occur in, yes, endoplasmic reticulum and peroxisome. Now, better to go with this disorder, which is frequently asked, Refsum disease. We found that phytin, phytanic acid, that is branch chain fatty acid. This is branch chain fatty acid. Normally, it is metabolized by, yes, alpha oxidation. Alpha oxidation by enzyme phytanoyl coenzyme oxidase or phytanoyl coenzyme hydroxylase. If phytanoyl coenzyme hydroxylase or oxidase, two name for the same enzyme, is deficient, if this enzyme is deficient, then it lead to Refsum disease. In Refsum disease, R for retinitis pigmentosa, ichthyosis. Yes, ichthyosis. So cardiac, cardiac प्रॉब्लम हो सकती है, एरिदमिया हो सकते हैं, एरिदमिया। यस, एरिदमिया में भी देयर। तो रेफसम डिजीज question are asked, they ask question retinitis pigmentosa. When clinical scenario would be there, they will give retinitis pigmentosa. Immediately you will think of refsum disease and they will tell you that alpha oxidation of phytanic acid is defective or this enzyme is deficient. Diagnosis is refsum disease. Okay. One more question, frequently asked question, that is Zellweger syndrome or cerebrohepatorenal syndrome. In this, there is mutation in PAX gene. What is the function of this gene? Suppose this is enzyme. This is enzyme. This is peroxisome. Normally, yes, normally this enzyme go to peroxisome with the help of peroxisomal targeting sequence. Due to this mutation, this sequence is defective, so enzyme will not enter the peroxisome. Again, I am saying normally enzyme enter the peroxisome with the help of peroxisomal targeting sequence. If yes, yes, if this is defective targeting sequence, then this enzyme will not enter peroxisome. So peroxisome will not be able to do function. So yes, there was a question that Zellweger syndrome, there is a functional deficiency of peroxisome. Okay. And when peroxisome is defective, means not functioning, very long chain fatty acid will accumulate. So in lab diagnosis, increase very long chain fatty acid. When question is asked, most of time 4 5 times question आ चुका है इस पे. Every time very long chain fatty acid. Clinical scenario, they give seizure, hypotonia, they give and they ask defect is peroxisome. Okay, which compound accumulate very long chain fatty acid. Okay, now okay, 10:30 हो गए हमारे ना. ठीक है, 11:45 तक मैं कोशिश करूंगा क्लास लेने की. उससे आगे एक्सटेंड नहीं करूंगा. आई विल नॉट एक्सटेंड बियॉन्ड दैट. यस, बट आज हम प्रोटीन के मिड तक जाना चाहते हैं. ओके, ओके, सो नाउ लिपिड्स. लिपिड्स, ये सिंपल सी बात है. That lipids are insoluble in water, soluble in organic solvent. Simple lipid, glycerol plus fatty acid, monoacyl glycerol. Glycerol plus 2 fatty acid, diacyl glycerol. Glycerol plus 3 fatty acid, triacyl glycerol. Triglyceride or neutral fat. Again, I am repeating lipids. I take simple lipid. In this, glycerol is there, CH2OH, CHOH, CH2OH. This is glycerol. We found that glycerol bind with one fatty acid. Group name of fatty acid is acyl, so monoacyl glycerol. If two fatty acid bind to it, two fatty acid diacyl glycerol. If three fatty acid bind to it, triacyl glycerol. So triacyl glycerol, another name is triglyceride, another name is neutral fat, another name is neutral fat. Okay, means it is not amphipathic. Lipids are amphipathic, means having both polar end and non-polar end, but neutral fat is neutral. Fat is stored in which form in tissue? That is triglyceride. That is triglyceride. Questions are asked on phospholipid. I discuss simple lipid. Yes, simple lipid. Now phospholipid. In phospholipid, phosphatidylcholine. Another name is lecithin. If it is deficient, that lead to respiratory distress syndrome. It is present in surfactant. Okay. Yes, surfactant. Cardiolipin. Cardiolipin. This is also phospholipid. First mnemonic, in, that is present at inner mitochondrial membrane. Mnemonic, yes, in inner mitochondrial membrane. Cardiolipin, one more question. Cardiolipin is a phospholipid. Usually phospholipids are not antigenic, but cardiolipin is antigenic. And defect in cardiolipin lead to Bath syndrome. Defect in cardiolipin, yes, lead to Bath syndrome. In Bath syndrome, कार्डियोमायोपैथी इज देयर. सो नाम अपने आप ही बता रहा है कार्डियोमायोपैथी. कार बार in inner mitochondrial membrane. One glycolipid question has been asked. GM1 ganglioside is receptor for cholera toxin in intestine. ये सिंगल लाइनर क्वेश्चंस हैं, ये हमने पढ़ लिए हैं. अब हम आ जाते हैं लाइपोप्रोटीन्स पे. लाइपोप्रोटीन्स, काइलोमाइक्रोन, VLDL, IDL, LDL, HDL. These are lipoproteins. Size decreases. Sometimes image-based question has been asked. Size decreases. आइसक्रीम के कोन जैसा लग रहा है ये. आइसक्रीम के कोन. We found that chylomicron, maximum lipid. Yes, maximum triglyceride. High density lipoprotein, density is more in protein. Maximum protein, maximum density, maximum triglyceride, maximum size. So you can easily interpret size is decreasing. Yes, size is decreasing. Lipid content is decreasing. Density is increased. Protein is increased. Yes. तो हमने कैसे याद रखना है? Name itself tells you that देखो lipids are light. Lipid floats over buttermilk. Butter floats over buttermilk. क्यों? Because the density of butter is very less. तुमने एक जोक भी सुना है, टाइम नहीं है हमारे पास फिर भी सुना देते हैं. यस, कि एक नई नई शादी होती है, बहू आती है तो उसकी सास कहती है, बहू मट्ठा भिगो ले. सो मट्ठा भिगो रही थी तो मक्खन ऊपर आया, तो बहू ने कहा, माता जी मक्खन ऊपर तैर रहा है, कहाँ उतारूं? कहने लगी, बहू मक्खन लाल तेरे ससुर का नाम है, थोड़ा प्यार से लिया कर, इज्जत से लिया कर. नेक्स्ट डे शी वाज डूइंग द सेम थिंग. अब उसने मक्खन ऊपर तैर रहा था. शी सेड, माता जी ससुर जी तैर रहे हैं, कहाँ उतारूं? वी आर नॉट कंसर्न विद दिस जोक एट दिस टाइम. आई एम कंसर्न विद द mnemonic that lipids are very light. Lipids are very light. They float over buttermilk. Yes, means they have less density. So size increases. Here chylomicron, maximum size, maximum lipid. Lipid is decreasing, size is decreasing, but proteins are dense, so density increases, protein increases. तो ये हमें याद हो जाएगा. Okay, sorry, the only joke was in Hindi, otherwise okay, joke हिंदी में था, but otherwise yes, you know that butter float over buttermilk. Yes, sorry to be, मेरे पे इंग्लिश यार अपना हाथ तंग है, जोक नहीं बना पाता. बायोकेमिस्ट्री पढ़ाना आसान है, साइकेट्री पढ़ा देता हूँ, ऐसी बात नहीं है. यस, चलो. यस, इंग्लिश में जोक होते हैं, बट आई एम नॉट कंफर्टेबल इन दैट. ओके, नहीं हो पाता. यस, चलो कोई बात नहीं. अब हम कंसेप्ट पे आते हैं. वी आर मोर कंसर्न विद कंसेप्ट एट दिस टाइम. यस, we found that on electrophoresis On lactophoresis, chylomicron. This is chylomicron. Yes, yes. Chylomicron. ल- ये सबसे कम मूवमेंट होता है, लीस्ट मूवमेंट। HDL, हाईएस्ट मूवमेंट, मैक्सिमम मूवमेंट। ओके, सो क्वेश्चन इज आस्क्ड, लीस्ट मूवमेंट काइलोमाइक्रोन, मैक्सिमम मूवमेंट HDL। ठीक, ओके, यस। नाउ I am going to describe this hyperlipoproteinemia. Before that, we will discuss a little bit about different lipoproteins. Chylomicron. What are chylomicrons? Suppose I took food. When I took food, my diet is having triglyceride. My diet is having triglyceride. So dietary triglyceride is called exogenous triglyceride. Exogenous triglyceride. Triglyceride can be synthesized in our body. The triglyceride which is synthesized in our body, triglyceride which is synthesized in our body, that is called endogenous triglyceride. This triglyceride which is synthesized in our body, that is called endogenous triglyceride. Yes, I discussed carbohydrate is converted to fat, that is called endogenous triglyceride. And triglyceride which come from diet, that is called exogenous triglyceride. Which come from diet, that is called exogenous triglyceride. So whenever we take food, exogenous triglyceride is absorbed in our intestine. Now intestine want to transport this triglyceride. So this dietary triglyceride or exogenous triglyceride is transported in the form of chylomicron. So chylomicron, these are assembled in intestinal mucosal cell. These chylomicron have ApoB48. They carry dietary triglyceride to peripheral tissue. Maximum content of triglyceride, that is exogenous in origin. So these are question on chylomicron. Chylomicron contain ApoB48 and the triglyceride is exogenous. And very small amount of cholesterol is also there. Very small amount of cholesterol is also there, but we found that in chylomicron mainly triglyceride is there. What is the purpose? To tell you, in any patient, if you find chylomicron are increased, you will say triglyceride is increased. So in any question, yes, in any question, if you find chylomicron increased, you will say triglycerides are increased. Cholesterol is little bit increased, that is near normal or near normal. थोड़ा बहुत increase हुआ, little amount is increased, that would not be considerable. Okay, so chylomicron triglyceride is increased. We found that when chylomicron is traveling via blood vessel, this lipoprotein lipase will cut triglyceride and will release fatty acid. So lipoprotein lipase metabolize chylomicron, and we found that ApoC2 is activator of lipoprotein lipase. So now I can say that this chylomicron is normally. So let me discuss the questions first. Yes, questions are first, chylomicron are synthesized in intestinal mucosal cell. Question. It contain ApoB48. Question. It contain dietary triglyceride. Question. It contain maximum amount of triglyceride. Question. It transport dietary triglyceride from intestine to peripheral tissue. Question. When this is traveling via blood vessel, this is degraded or metabolized by lipoprotein lipase, and the activator of lipoprotein lipase is ApoC2. And in if a patient is having defect in this is defective, then chylomicron will not be metabolized. If ApoC2 is defective or lipoprotein lipase is defective, chylomicron will not be metabolized. And this is called type 1 hyperlipoproteinemia. Type 1 hyperlipoproteinemia, there is defect in lipoprotein lipase or ApoC2. C2. When lipoprotein lipase or ApoC2 is defective, this chylomicron will not be metabolized. Chylomicron will increase. That's why the other name is familial hyperchylomicronemia. Other name is, yes, familial hyperchylomicronemia. So when chylomicron is increased, chylomicron contain, yes, triglyceride. Triglyceride is increased. Cholesterol would be normal, yes, near normal. Okay, near normal. So in this mainly triglyceride is increased. When triglyceride is increased, increased triglyceride put pressure on pancreas and can lead to pancreatitis. Surgery में तुमने पढ़ा है increased triglyceride predisposed to pancreatitis. So acute abdomen pancreatitis. Pancreatitis. When this triglyceride will increase, this triglyceride, I remember this triglyceride as white butter. I remember triglyceride as white butter. So if triglyceride is increased, you take the sample. Triglyceride is so high. That's why the plasma would be looking white, milky white plasma. Milky white plasma. Or blood is red and blood is red and triglyceride is blood is red and triglyceride is white. So red is of tomato soup appearance. Okay. And when triglycerides are increased, you can remember that this granular triglyceride is deposited to produce eruptive xanthoma. Eruptive xanthoma. Okay. Here, I will not discuss in detail, but at the same time, I will mention in type 1 hyperlipoproteinemia or familial hyperchylomicronemia, yes, there would be there would be increase chylomicron and increase VLDL also. Chylomicron increase more than VLDL, but there is increased chylomicron and also, yes, increase VLDL. Okay. So this is eruptive xanthoma, milky white plasma, cream of tomato soup appearance. Clear? Now we found that when this chylomicron is metabolized by lipoprotein lipase, it is converted to chylomicron remnant. जो बचा उसे कहा chylomicron remnant. Chylomicron remnant are metabolized with the help of ApoE. Question is asked, chylomicron remnant or remnants are metabolized by ApoE and remnant contain both triglyceride and cholesterol. You can make mnemonic. Chylomicron, one word, only triglyceride increased. Chylomicron remnant, two words, both triglyceride and cholesterol are increased. Okay, both triglyceride and cholesterol are increased. So if a patient is there in which ApoE is defective, ApoE is defective, we found that this is type 3 hyperlipoproteinemia. 3 looks like E. 3 looks like E. 3 looks like E. ApoE is defective. Type 3. Another name is dysbeta lipoproteinemia. Dysbeta lipoproteinemia. Okay. Dysbeta lipoproteinemia. We found that defect in ApoE, ये हमने डिस्कस कर दिया, defect in ApoE, lipoprotein remnant increased, remnant, it may be chylomicron remnant and VLDL remnant. Lipid remnant contain both triglyceride and cholesterol, so triglyceride increase, cholesterol increased, both triglyceride and cholesterol increased, and we found there is Palmar-xanthoma. In type 3, there is Palmar-xanthoma. I usually make mnemonic like this. If I draw these lines like this, these line looks like E. तो पामरजेंथोमा जो क्रीज को हमने E की तरह लिख लिया, तो याद रहेगा कि in type 3 apo is defective and in this palmar-xanthoma is there, and tubero-eruptive xanthoma. Tubero-eruptive xanthoma, ओके, और palmar-xanthoma. याद रहेगा, निमोनिक बन गया हमारा. We found, yes, I accept that I have deliberately left few points, but which are important questions are being asked, I am taking care. We found that LDL is having cholesterol. LDL is having cholesterol, bad cholesterol, and this LDL is taken up by LDL receptor with the help of ApoB100. Yes, ApoB100. So if you want to, yes, metabolize LDL, there should be two things. LDL receptor should be intact, ApoB100 should be normal. So normally we found that LDL receptor take LDL with the help of ApoB100. So if LDL receptor is defective or ApoB100 is defective, LDL will increase. That is type 2A hyperlipoproteinemia. In this defect in ApoB100, yes, ApoB100 और LDL receptor. थोड़ा सा मैं confusion clear कर दूंगा. Sorry for that. I actually it takes time. That's why I avoided. But don't worry. Let me complete this. Then I will revise, and it will help you. Okay. Lipoprotein increase LDL. LDL contain cholesterol. When cholesterol increase, that cause chest pain. Type 1 pain abdomen. Type 2A chest pain. Chest 2, तो टाइप चेस्ट पेन 2A, 1 एब्डोमेन 1, तो टाइप 1 में एब्डोमिनल पेन. ऐसे याद रख लेना. वी फाउंड दैट कोलेस्ट्रोल इज इंक्रीज्ड. Cholesterol is increased. When cholesterol is increased, that lead to, yes, tuberous xanthoma. Yes, tuberous xanthoma or tendon xanthoma. Tendon xanthoma, and most common site is tendoachilles. Tendoachilles, most common site. So let me summarize. फास्ट करेंगे. Normally, when we take food, in food, yes, triglyceride is there, exogenous triglyceride, chylomicron is synthesized. When chylomicron travel via blood vessel, lipoprotein lipase convert into chylomicron remnant. This chylomicron remnant is taken by liver with the help of ApoE. Now, liver synthesize endogenous triglyceride. Endogenous triglyceride is transported in the form of VLDL. Endogenous triglyceride is transported in the form of VLDL. When VLDL is traveling via blood vessel, this VLDL is containing ApoB100 and triacylglycerol, which is endogenous, not exogenous, endogenous. Again, it will be acted by lipoprotein lipase. And when lipoprotein lipase is defective in type 1, so VLDL is also increased. So type 1 mainly chylomicron increase, some amount of VLDL is also increased. So when this normally when VLDL travel by a blood vessel, lipoprotein lipase act on it and convert VLDL to VLDL remnant. Another name of VLDL remnant is IDL. Now this IDL or VLDL remnant is taken up by liver with the help of ApoE, and some amount of VLDL remnant, some amount of IDL is further converted to LDL, and then LDL is taken up by liver. ये समझ में आया? Clear? Now, hyperlipoproteinemia, how I remembered? Yes, type 1 hyperlipoproteinemia. If, yes, lipoprotein lipase or ApoC2 is defective, then chylomicron will increase, VLDL will increase, chylomicron increase more, chylomicron contain triglyceride increase, acute abdomen, and triglyceride, milky white plasma, eruptive xanthoma, lipemia retinitis. Okay. नॉट सो इम्पोर्टेंट हो। टाइप 2 में विल, यस एलडीएल रिसेप्टर डिफेक्टिव है या ApoB100 इज डिफेक्टिव, देन एलडीएल विल नॉट टेकन बाय लीवर, एलडीएल विल इंक्रीज, एलडीएल हैज बैड कोलेस्ट्रॉल, दिस कोलेस्ट्रॉल विल डिपॉजिट एट पेरिफेरल टिश्यू एंड दैट विल cause atherosclerosis, coronary artery disease, chest pain. This will deposit, cholesterol will deposit in tendon, tendon xanthoma, tuberous xanthoma, most common site of tendon xanthoma, tendon Achilles. If these remnants are taken up by ApoE. If ApoE is defective, then remnants are not metabolized, remnants are increased. So that is type 3. ApoE is defective, remnants increased. So both triglyceride and cholesterol increase. When cholesterol is increased, you all know tuberous xanthoma and triglyceride eruptive xanthoma. That's why I told you tubero eruptive xanthoma. Tubero eruptive xanthoma. Okay, clear? And Palmer xanthoma. Hope you have understood this. Yes. Now, HDL contain good cholesterol. HDL contain good cholesterol. Why it is called good cholesterol? Yes, LDL deposited cholesterol in peripheral tissue. Point it out. LDL was having cholesterol. It deposited in peripheral tissue. Now HDL is going via blood vessel. It take that extra cholesterol and esterify it, pack कर देता है इसे and keep in the center. Means HDL take cholesterol from periphery and convert into cholesterol ester. You can consider like MCD, car of MCD, or vehicle of MCD in which they are taking garbage. Normally what happens, they put garbage as such, and when this truck is moving, most of the garbage is dropped. That is LDL. But in foreign countries, you will find that everything is packed properly. If you pack properly, that is HDL. So LDL is putting that garbage here and there. HDL take that cholesterol from periphery and then esterify it and again transfer to liver. That's why it is called reverse cholesterol transport. Means it take cholesterol from peripheral tissue and give to liver. Okay. Now, a question was asked. The best predictor of coronary artery disease is HDL LDL ratio. Okay, or HDL or LDL. Which one is best? Single HDL, single LDL, or ratio? Which one is best? That is ratio. रेशियो इज बेटर, मींस यदि तुमने एलडीएल भी बढ़ा दिया, एचडीएल भी बढ़ा दिया, तो एलडीएल विल ड्रॉप, एचडीएल विल क्लियर दैट. ये समझ में आया? यस. नाउ we found that this HDL cholesterol is converted to cholesterol ester taken up by liver. Yes. And we found that this cholesterol is converted to cholesterol ester by ALCAT, lecithin cholesterol acyl transferase. Question is asked, ApoA1 is activator of ALCAT. ApoA1 is activator of ALCAT. So few questions contain ApoA. HDL contain ApoA, ApoC to ApoE. Take cholesterol from peripheral tissue to liver. This is called reverse cholesterol transport. Question. Reverse cholesterol transport. Now, this question has been asked 2-3 times. We found that in peripheral tissue, this is peripheral tissue, there is ABC A1. Yes, ABC1, ATP binding cassette A1. This is receptor which transfer cholesterol, take different color, with the help of ABCA1. Cholesterol is transferred from peripheral tissue to HDL. Means from peripheral tissue to HDL, cholesterol is transferred with the help of ABCA1. If this ABCA1 defect, then this cholesterol will not be transferred to HDL. So HDL will be decreased. HDL decreased. Decrease HDL. Question. This cholesterol will remain deposited in peripheral tissue that lead to orange color tonsil. Orange colored tonsil. मैंने यहाँ पे जो लिया था, I have taken this cholesterol as egg yolk. So what is the color of egg yolk? I do remember cholesterol as egg yolk. Okay, so color of egg yolk is orange. So I can remember that cholesterol is deposit here. So orange color tonsil. Orange color tonsil. This is Tangier disease. Tangier's disease. Mnemonic tang. Yes, if you remember a very good drink, tang. Orange flavor is most common flavor of tang. Yes, Tangier disease. Orange color tonsil. Okay. In Tangier disease, there is defect in ABCA1. And when ABCA1 is defective, we found that cholesterol will not be transferred from peripheral tissue to HDL. So HDL concentration will decrease and there would be deposition of this cholesterol in peripheral tissue. It will deposit in tonsil, orange color tonsil. Peripheral neuropathy may be there. Peripheral neuropathy. So different features would be there. Okay. तो निमोनिक बनाया था हमने इसका कि टैंग टैंग इज ए वन ड्रिंक है टैंग सो एबीसी ए वन एंड मोस्ट कॉमन फ्लेवर ऑफ टैंग इज यस ऑरेंज कलर यस नाउ in 10 minutes we will try to cover this. After that we will start protein. So our target was mid of protein. Most probably we will be able to do by 11:45, whatever we require. Okay, are you comfortable with that? Okay, लिपिड के बाद देख लेंगे. We found sometimes this flow chart is asked in question, MLE based question. So once this was repeated in PGI, so that's why I have taken this. Palmitic acid means fatty acid bind with sphingosine to form ceramide. We found that normally ceramide is degraded in our body by enzyme ceramidase. This is metabolized by enzyme ceramidase. If this enzyme is deficient, that lead to Farber disease. Farber disease. I remember Farber as barber. Farber as barber cut the hair of sir. Sir के hair cut करता है. Sir means head. Ceramidase. When he is cutting hair since morning to evening, he may have pain in joint, small joint. So in Farber disease, there is joint pain, just like rheumatoid arthritis. When he will use the scissors continuously, he may have some nodules over here. So mnemonic, this is mnemonic. Yes, subcutaneous nodule. So again, I make mnemonic, repeat mnemonic. I remember Farber disease as barber disease. Enzyme deficient is ceramidase. सिर के बाल काटता है. Head cut the hair of sir. Yes, if he is cutting since morning to evening, he would have pain. That's why we can remember in Farber disease there is joint pain, just like rheumatoid arthritis, just like juvenile arthritis, and he may have subcutaneous nodules. So we are discussing topic sphingolipidosis. Sphingolipidosis. These are lysosomal storage disorder. Lysosomal storage disorder. So sphingolipidosis means in these lysosomal storage disease, one component is sphingosine. One component is sphingosine. Palmitoyl coenzyme bind with sphingosine to form ceramide. That's why we named that disorder sphingolipidosis. These are lysosomal storage disease. First lysosomal storage disease, sphingolipidosis. We discussed Farber disease. We discussed, yes, Farber disease. Now we found that ceramide bind with glucose to form glucose cerebroside. So ceramide plus glucose, that is glucose cerebroside. This glucose cerebroside is normally found in extraneural tissue. Extraneural tissue. Yes, glucose cerebroside is degraded by beta glucosidase. This glucose cerebroside is degraded by beta glucosidase. If beta glucosidase is deficient, if this, again I am repeating, we are discussing sphingolipidosis. First sphingolipidosis was Farber disease. Yes, if you don't remember the sequence, it's okay. Just remember this portion. Yes, let me highlight. Yes, you must know this. Now you must know this, that glucose cerebroside or ceramide plus glucose is called glucose cerebroside. It is degraded by beta glucosidase. If it is deficient, that is Gaucher disease. Gaucher disease, Gaucher, U glucosidase, beta glucosidase. In this extraneural tissue, this is present in extraneural tissue, so this will not be degraded. So glucose cerebroside will deposit in extraneural tissue, means no neurological symptoms. So neurological symptom absent, cherry red spot absent, extraneural tissue, yes, liver, spleen, hepatosplenomegaly present, bone marrow deposit, bone pain, pancytopenia, pancytopenia, पेन, पेन मतलब आउच आउच, गाउचर, आउच आउच. सो जब पेन होगा तो पेशेंट करेगा आउच आउच. एंड यस, यदि लड़की करने लगी तो तुम यू इमीडिएटली विल गिव टिश्यू पेपर एंड दैट शी विल डू crumpled, crumpled tissue paper appearance. Yes, crumpled tissue paper appearance, crumpled tissue paper appearance. Okay. Ulnar flash deformity, most of time you will find this crumpled tissue paper appearance, enzyme beta glucosidase deficient, cytosplenomegaly would be there. These are the common symptoms that would be sufficient. Galactocerebroside, galacto, भाई लड़के को कौन चुप करा रहा है? लड़के को कोई चुप नहीं कराता, है ना? रोने दो. यस, ऐसा नहीं है, कुछ अच्छी लड़कियां होती हैं आज भी. यस, galactocerebroside means ceramide plus galactose. Okay, yes. So we found that this galactocerebroside is degraded by beta galactosidase. Beta galactosidase. Yes, beta galactosidase. If this is deficient, that is Krabbe's disease. Beta galactosidase, Krabbe's disease. In this, neurological symptoms would be there. Neurological symptoms would be there. Cherry red spot may be present, not so frequent but present. Hepatosplenomegaly, no hepatosplenomegaly. यहाँ पे एक पॉइंट मैं मिस कर गया. गाउचर डिजीज, न्यूरोलॉजिकल सिम्टम्स आर नॉट देयर, सो देयर वुड बी नो मेंटल रिटार्डेशन. no mental retardation. Yes, although I will make mnemonic. Yes, in this globoid cells are there. Globoid cells are there. ठीक, देख लेना पैथो में डिस्कस करेंगे वो सर, तो दैट वुड बी बेटर डिस्कशन. नाउ स्फिंगोमाइलिन, sphingomyelin, we remember that sphingomyelin is normally degraded by enzyme sphingomyelinase. Sphingomyelinase. If sphingomyelinase is deficient, that is Niemann-Pick disease. Niemann-Pick disease. I made mnemonic neem soap. Neem soap. Niemann soap for sphingomyelinase. If you wash or if you take bath with neem soap, yes, after so many days, you will find bubbles just like this. अच्छे bubbles नहीं आएंगे. Yes, foam cell bubbly appearance. तो वो सोने साबुन निरमा वाला नहीं होंगे. Yes, but for you, these are not so clear bubble. But foam cell bubbly appearance, neem soap. And Baba Ramdev, mnemonic. Baba Ramdev claimed that my neem soap is so strong. If you take a zebra and just take a bath with this neem soap, zebra will become donkey. कुछ भी बना दिया है वही. Any mnemonic, yes. So zebra bodies by neem soap you can convert zebra to yes donkey. So zebra bodies, foam cell. So little bit idea we know. Yes, sphingomyelinase, myelin itself tells you. Myelin, neurological symptom would be there. Neurological symptoms would be there. Niemann-Pick, big, means hepatosplenomegaly would be there. Hepatosplenomegaly would be there. Yes. Okay. Clear. So these are the symptoms of. अब फटाफट देख लेते हैं. Tay Sachs disease. Enzyme deficient is hexosaminidase A. Mnemonic is TSH. Yes, mnemonic is TSH. Tay-Sachs H, hexosaminidase. You can make mnemonic by initial letter because there is no T, no H anywhere else except these two. Yes, TSH, hexosaminidase A, SH, Sandhoff disease, hexosaminidase A and B. How you will differentiate? Name itself tells you and. So Sandhoff is having and, so hexosaminidase A and B both are different. Tay-Sachs disease, in Tay-Sachs disease, neurological symptoms are there. Neurological symptoms, yes, neurological symptoms are there. In this, cherry spots are there. In this tiny organ, T4 tiny organ means no hepatosplenomegaly. Hepatosplenomegaly. This is very catching point. Sometimes you will find question, yes, to differentiate between these two. Hepatosplenomegaly, Niemann-Pick. No hepatosplenomegaly, yes, Tay-Sachs disease. Yes, Niemann-Pick disease, hepatosplenomegaly present. Okay. Metachromatic leukodystrophy. Enzyme deficient is aryl sulfatase A. सर्फ एक्सेल का एक बार एडवर्टाइजमेंट आया था. Yes, that our surf is having multiple granules. So metachromatic, multiple, yes, granules here. Okay. Krabbe's disease, beta galactosidase, Gaucher, beta glucosidase, Fabry's disease, alpha galactosidase. All these are autosomal recessive except Fabry's disease. Fabry's. So Fabry's को Fabrics भी कह सकता हूँ. Fabrics. So X-linked recessive. X-linked recessive. All other are autosomal recessive. All others are autosomal recessive. Clear? Okay. This Farber ceramidase. In Fabry's disease there is angiokeratomas मिलते हैं इसमें. अभी एक बार समराइज कर देते हैं यहाँ पे. All sphingolipidosis have mental retardation except Fabry's and Gaucher. How you will remember? Fabulous performance, genius banda, although they are not genius, but you will remember no mental retardation. Fabry's, fabulous performance. Gaucher, genius banda. Okay. Yes. All sphingolipidosis have cherry-red spots except Fabry's and Gauchers. Same. All sphingolipidosis are autosomal recessive except Fabry's, which is X-linked recessive. All sphingolipidosis have hepatosplenomegaly except Tay-Sachs and Krabbe's. How you remember Tay-Sachs? Tiny organs. Krabbe's, क्रैब होता है, यस, केकड़ा होता है, बड़ा सूखा सा होता है. कहां हेपेटोस्प्लेनोमेगाली हो जाएगी? ओके. तो कई बार मैं कहता हूं ताश के पत्ते की तरह पतला. यस, ताश के पत्ते की तरह पतला. नो हेपेटोस्प्लेनोमेगाली. One question was asked. Yes, one question was asked that Wolman disease enzyme deficient is acid lipase. It is lysosomal storage disease, but not a sphingolipidosis. Okay. In this, there is bilateral calcification of adrenal gland. Bilateral calcification of adrenal gland. तो ये हमने याद रख लिया. लास्ट पॉइंट. यस, ये हमने डिटेल में डिस्कस किए हुए हैं मेन वीडियोस में. ठीक है, मैं सेंड भी कर दूंगा तुम्हारे पास यदि तुम चाहोगे तो. ठीक है, टेलीग्राम ग्रुप पे मैसेज कर देना. आई विल डू दैट. ओके. टू अपोजिट पाथवेज are regulated in such a way when one is activated, another is kept in inhibited state. Okay. Yes, two opposite pathways are regulated in such a way when one is activated, another is kept in inhibited state. We have already discussed that glucose is converted to glycogen synthesis, rate limiting enzyme or glycogen synthesis. Glycogen is broken down to glucose by glycogenolysis. Here glucose is converted to two molecules of pyruvate, glycolysis. Two pyruvate join to form glucose, gluconeogenesis. Acetyl coenzyme join to form fatty acid synthesis. Fatty acid is degraded to acetyl coenzyme, beta oxidation of fatty acid. So in fad state, insulin increases. Insulin activate glycogen synthesis, insulin activate glycolysis, insulin activate fatty acid synthesis. At the same time, insulin inhibit gluconeogenesis, glycogenolysis, gluconeogenesis, beta oxidation of fatty acid. Yes, मिलेगा सब्सटेंस भी मिलेगा, सिलेक्शन लो मिलेगा. So insulin activate these pathways, these enzymes, rate limiting enzyme of these pathway, while insulin inhibit these pathways. Glucagon opposite to it. Most of time when questions are asked, you will find that they are asking question of activation, inactivation, phosphorylation, dephosphorylation only on common pathway which are regulated in opposite way. One is activated, other is kept in inhibited state. Yes, अब हम आ जाते हैं अमाइनो एसिड। ठीक है, अभी हम ब्रेक देने का कोई मतलब बनता नहीं है। ओके, क्योंकि दोस्त जितना हम टाइम ब्रेक में लगाएंगे उतने टाइम में हमारा टॉपिक का वजह जल्दी खत्म हो जाएगा। 2 मिनट का ब्रेक ले लेते हैं, मैं यहीं बैठा हूं, मैं पानी पी लेता हूँ। ठीक। नो, 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 actually tomorrow we have molecular biology genetics, in which we don't know how much time we will take. Sometimes few doubts are really really difficult. Okay, yes, तो we start amino acid. Amino acid name itself tells you they are having amino group, they are having amino group, they are having acidic group, they are having amino group, they are having acidic group. This is H, this is R. In carbon, if all four valencies are occupied by different group, that is called asymmetric carbon. And whenever there is asymmetric carbon atom, that show optical and stereoisomerase. Optical and stereoisomerase. So we found that any compound, yes, any compound, yes, which have asymmetric carbon atom show optical and stereoisomerase. We found that all amino acid have asymmetric carbon atom except glycine. Discuss shortly. First of all, amino acids are classified on the basis of this R side chain. First group is aliphatic amino acid. Mnemonic is Ali Ga Live. Ali Ga Live. Ga Ga, glycine, alanine. Live, leucine, isoleucine, valine. So these are aliphatic. Out of these, glycine is the simplest amino acid. If you look at the glycine structure of glycine, you will find that it is having H. This is H. Means carbon, two valencies are occupied by H. If more than one valencies are occupied by same group, then it is symmetric carbon atom. So glycine is simplest amino acid. Yes, smallest R group is H. Nothing can be smaller than H. So R is H, that is glycine. Though this is simplest amino acid, smallest amino acid, no asymmetric carbon atom. Yes, so no optical isomerism, no stereoisomerism. Question is asked. Now, glycine recently asked question and frequently asked question. They have asked that glycine take part in synthesis of heme. In heme synthesis, glycine bind with succinyl coenzyme. Succinyl coenzyme. This is the first step of heme synthesis. Purine, purine synthesis. We found that purine ring, we will discuss purine ring, C4C5N7, C4C5N7 of purine ring is contributed by glycine. नहीं याद रहे कोई दिक्कत नहीं, simply remember that glycine take part in purine synthesis, it take part in heme synthesis. Glycine take part in glutathione. Gluta means glutamate, thio means containing sh, cysteine. वन फर्स्ट अमाइनो एसिड, मैंने कहा था वन फर्स्ट अमाइनो एसिड वी डिस्कस ग्लाइसिन. सो वन ग्लाइसिन. glycine. So glutathione is tripeptide made up of glutamate, cysteine, and glycine. Collagen. In collagen, glycine XY means every third amino acid is glycine. In collagen, every third amino acid is glycine. Creatinine, creatinine, mnemonic is game. Yes, गेम क्रिएट करना है, बजाना नहीं है. यस, ग्लाइसिन, आर्जिनिन एंड मीथियोनिन. मीथियोनिन, ये क्वेश्चन रिसेंटली आया हुआ है. ग्लाइसिन, आर्जिनिन, मीथियोनिन. So glycine take part in synthesis of heme, purine, glutathione, collagen, creatinine. Other than that, glycine take part in conjugation reaction. Bile acid, cholic acid bind with glycine, glycocholic acid. Bile acid conjugation, glycocholic acid. Phase 2 reaction, benzoic acid bind with glycine to form hippurate. This question has been recently asked. Benzoic acid bind with glycine to form hippurate. Yes, yes. So hippuric acid, hippurate or hippuric acid. Yes, so this is about glycine. Alanine, I have already told you, 3 carbon, most important glucogenic amino acid. Now, 3 branch chain amino acid. Even if you don't remember the structure, just to tell you this is branching, this is branching, this is branching. So these are, mnemonic is live. Branch chain amino acid. Live branch chain amino acid. Branch chain amino acid are essential to live. So these are essential amino acid. Branch chain amino acid are essential to live. Now, leucine, isoleucine, valine. These are branch chain amino acid. देखो लाइव क्लास चल रही है, बहुत सारी ब्रांचेस जा रही है अलग अलग सिटीज में, ऐसे मान लेते हैं. Normally leucine is metabolized. Normally leucine is metabolized, is converted to isovaleric acid. So this is a mnemonic. इसको हम for the time being हटा देते हैं. Leucine is converted to isovaleric acid. Isovaleric acid further metabolized by isovaleric dehydrogenase. Yes, isovaleric acid dehydrogenase. Okay. So if isovaleryl dehydrogenase, if this dehydrogenase is deficient, then this lead to isovaleric aciduria. So if this is deficient, normally isovaleric acid is metabolized by isovaleryl dehydrogenase. If this dehydrogenase is deficient, then what will happen? This will accumulate isovaleric aciduria, and there is, yes, sweaty fit. Sweaty fit odor. क्यों मैंने फिट बनाया 5? यदि ध्यान से देखो इसमें सब जगह V दिख रहा है तुम्हें, V दिख रहा है तो V लुक्स लाइक 5. V लुक्स लाइक 5. तो फिट में भी 5 टोज होते हैं, तो स्वेटी फिट मतलब कुछ लिंक बन जाएगा, स्वेटी फिट odor. Okay. So one thing is that why I made this mnemonic live, because when question is asked that isovaleric acid urea, there is a defect in the metabolism of leucine. We get confused. Isoleucine. No, it is not defect in the isoleucine. Valeric, valine, we get confused valeric word by valine, iso word by isoleucine, but actually isovaleric acid urea is defect in the metabolism of leucine. So you can easily remember by mnemonic live. Leucine is converted to isovaleric acid and isovaleric acid urea is defect in the metabolism of leucine. These branch chain amino acid are converted to branch chain alpha keto acid. Branch chain amino acid, or simply I simplify. Branch chain amino acid are metabolized by enzyme branch chain alpha keto acid dehydrogenase. If this enzyme is deficient, that lead to maple syrup urine disease. That lead to maple syrup urine disease. कैसे याद रखोगे? मैपल ट्री होता है, या यदि मैपल नहीं याद है तो एप्पल याद रख लो. एप्पल ट्री, tree is having branch. So branch chain alpha keto acid dehydrogenase deficiency lead to maple syrup urine disease. In maple syrup urine disease, smell of urine is burnt sugar or maple syrup. Okay, and in this dinitrophenyl hydrazine test, DNPH test will be positive. DNPH test would be positive. Yellow precipitate बनता है, yellow. देखो नाम अपने आप बता रहा है, पीएच पीला है, सॉरी टू बी इन हिंदी, पीला मतलब येलो. DNPH पीला है. एंड इफ यू हैव सीन मैपल और नॉट मैपल, एप्पल याद रख लेते हैं. इफ यू कट एप्पल आफ्टर सम टाइम, द एप्पल बिकम्स ब्राउन और येलो, ऐसे मान लेते हैं. ओके, सो आई मेड निमोनिक दैट लाइव. These are essential amino acid, branch chain amino acid. When they are metabolized by branch chain alpha keto acid dehydrogenase. If this enzyme is deficient, maple syrup urine disease. In maple syrup urine disease, characteristic urine smell would be burnt sugar or maple syrup smell. In this, these amino acid will not be metabolized, so these amino acid will increase in blood and urine. So question is asked, amino acid increase blood and urine, leucine, isoleucine and valine. And in this, DNPH test is positive. पीला है, yellow precipitate. DNPH test positive. आहा, देखो ना पीला है, देखो ना पीला है. वाह, क्या निमोनिक बनाया. यस, तो यस, ये तो अच्छे निमोनिक बना रहे हो. अब सीख गए तुम कला, यही तो बात है. So maple syrup urine disease questions are asked frequently and you can solve now very easily. OH containing amino acid O-tri-3-sari, tri for tyrosine, 3 for threonine, sari for serine. Yes, in these three OH is there. OH is there. It provide polarity. OH provide polarity. And OH has tendency to attach with phosphate. So question is asked, which of the following amino acid can be phosphorylated easily? Yes, so we found that all these three amino acid can be phosphorylated easily. Out of these three, most common site of phosphorylation. This is most common site of phosphorylation. Okay, clear? Now, tyrosine is polar according to this concept, but Harper says, thank you, Harper says tyrosine as non-polar. तो हमने हार्पर की बात माननी है. टायरोसिन इज, यस यस. नाउ इमिनो एसिड proline. Proline is not amino acid, that is amino acid. It is not amino acid, that is amino acid. Okay, it is non-polar. नहीं याद रहे कोई दिक्कत नहीं, थोड़ा सा आइडिया लग गया. अब हमने मोस्ट इंपोर्टेंट टॉपिक जिसपे से कई सारे क्वेश्चन आए हुए हैं, वो एक बार देख लेते हैं. उसके बाद आज का लास्ट टॉपिक है ये, ठीक है. ओके, सल्फर कंटेनिंग amino acid. Mnemonic is sister is slow in math. Sister for cysteine, math methionine. Even if you don't remember the structure, but at least have an idea, this is cysteine having SH group. Methionine CH2, CH2, SCH3. One more amino acid, that is homocysteine. This homocysteine not present in protein, not present in protein synthesis, but predispose to atherosclerosis. Predisposed to atherosclerosis. Okay. So question has been asked, homocysteine predisposed to atherosclerosis. It is not taking part in protein synthesis, but it predisposed to atherosclerosis. You must know the structure. At least you must have an idea. Yes, look at the screen. If I highlight, this portion is same, methionine homocysteine. This portion is same. This portion is same. This sulfur is same. So methionine and homocysteine, the only difference is methyl group. So if methionine, I remove methyl group, it will be converted to, please do comment. देखो खत्म होने वाला है अब सेशन हमारा, ये लास्ट टॉपिक है आज के लिए। ट्रस्ट मी, इसमें क्वेश्चंस आते हैं, अभी रिसेंटली आए हुए हैं कई सारे। ठीक है, तो नींद भाग जाएगी और हमारे क्वेश्चन भी सोल्व हो जाएंगे। If I remove methyl group, it will be converted to homocysteine. Or if I take homocysteine and I join methyl group, it will become methionine. It will become methionine. Okay. We found that this methionine can attach with adenosine, interact with adenosine. When it interact with adenosine, sulfur interact with adenosine. This is called SAM. S-adenosyl, S-adenosyl methionine. This is universal methyl group donor. So simply, this methionine was taking rest, adenosine came, adenosine interact with this sulfur. When it interact with sulfur, got some space, now after that started doing like this and push this methyl, so it can easily give methyl group. So SAM, S-adenosyl methionine is methyl group donor. And when you remove methyl group from methionine, it will become homocysteine. We know. We found that normal metabolism in our body, this methionine is converted to homocysteine. Methionine is converted to homocysteine. Yes. Homocysteine, I am deliberately removing, yes, this and this. Homocysteine is further converted, homocysteine is further converted to cystathionine. Cystathionine is converted to cysteine. So normally in our body, methionine is converted to cysteine. So methionine, if present in our body, it can be converted to cysteine easily. So cysteine is synthesized in our body, and anything which is synthesized in our body, that is non-essential. Non-essential. Which is synthesized in our body, that is non-essential. Now I take the complete diagram. Yes, methionine is converted to homocysteine. Methionine is converted to homocysteine. It binds with serine to form cystathionine by enzyme cystathionine beta synthase. And cofactor for this cystathionine beta synthase is vitamin B6. Cofactor for this cystathionine beta synthase, vitamin B6. We found that cystathionine is converted to cysteine and homoserine. So again, I am repeating that I am deliberately removing this and this. The only purpose is that you must know methionine is normally converted to cysteine in our body. If cystathionine beta synthase is deficient, then homocysteine will not be converted to cystathionine. Yes, this enzyme is deficient, homocysteine will increase, and that will lead to classical homocystinuria. classical homocystinuria. In this, homocysteine increase in blood, homocysteine will increase in blood, homocysteine will increase in urine, homocysteine will increase in urine, but cysteine will not be synthesized. When this will not occur, yes, this will not occur, this step will not occur, cysteine will not be synthesized. When cysteine will not be synthesized, cysteine become essential amino acid. So in classical homocystinuria, question is asked, decrease cysteine synthesis and cysteine becomes essential amino acid, means must be supplied in diet, must be supplied in diet. What are the features of clinical features of classical homocystinuria? Skeletal deformities would be there, patient would be tall, arachnodactyly, okay, लंबी लंबी fingers होगा, means skeletal deformities would be there, genuverum, genuvelgum, pes, cavus, splenus. In this, mental retardation would be there. This is important point. Why this is important point? Because you will find that Marfan syndrome, yes, Marfan syndrome also have these skeletal deformities, but in Marfan syndrome no mental retardation. Sometimes they will give you the clinical scenario, these skeletal deformities would be given, and they will ask you to differentiate between Marfan and homocystinuria. You will differentiate that no mental retardation in Marfan. How you remember? Marvelous performance. Marfan, marvelous performance, no mental retardation. Okay, we found that homocystinuria dislocation of lens would be downward and medially, while Marfan syndrome superotemporal or upward and outwards. How you remember? When you homocystinuria यूरिन करते हैं तो डाउनवर्ड जाता है, मीडियली करनी चाहिए, है ना? ध्यान रहे तुम्हें? यस, फैन, द फैन इज अपवर्ड and outward the outer unit of, yes, AC, एसी फैन ऑफ आउटर यूनिट अपवर्ड एंड आउटवर्ड, तो ऐसे याद रख लेंगे हम एसी की, ओके, मार्फन फैन ऑफ एसी यूनिट आउटर एंड अपवर्ड, ओके. नाउ ट्रीटमेंट, yes, cysteine must be supplied, methionine restriction, point it out, restriction, don't stop. Methionine, sometimes in question they try to confuse you, stop methionine. No, you will not stop methionine, restrict methionine, methionine restriction. High dose of vitamin B6, क्यों? Co-factor for this enzyme is vitamin B6, yes. Okay, vitamin B6 deficiency can also lead to homocystinuria, okay, but this is classical cystathionine beta synthase, okay. Now we found that homocysteine is converted to methionine. Homocysteine is converted to methionine by homocysteine methyl transferase. Okay, homocysteine methyl transferase. Yes, if I transfer methyl group to homocysteine, it will be converted to methionine. In this reaction, we require vitamin B12. We require vitamin B9, means folic acid. Folic acid. So if you want to convert homocysteine to methionine, you require two vitamins. You require two vitamins, B12 and B9. We found that in B12 deficiency, there is megaloblastic anemia, there is homocystinuria. Yes or no? Yes. If B12 is deficient, homocysteine will not be converted to methionine. This homocysteine will increase. This is called non-classical homocystinuria. Non-classical homocystinuria. And B12 deficiency, we all know megaloblastic anemia is there. In B9 deficiency, we all know megaloblastic anemia is there. And there would be, yes, megaloblastic anemia would be there. There would be homocystinuria. So means both You can't differentiate by these two symptoms. You can't differentiate by these two symptoms. Oh, sorry, two findings, better to say, two finding. We found that methyl malonyl coenzyme is converted to succinyl coenzyme A by an enzyme mutase, and B12 is a cofactor for this mutase. If B12 is deficient, then methyl malonyl coenzyme A is increased. So if B12 is deficient, then methyl malonyl coenzyme A is increased. In B9 deficiency, it is normal. So question is asked that how you will differentiate between folic acid deficiency, B12 deficiency. You can simply differentiate by methyl malonyl coenzyme A. Clear? Yes. Laboratory finding. Lab finding. Cystinuria. Cystinuria. Two cysteine join to form cystine. Point it out, although no need to draw this structure, just to make you understand. Yes, two cysteine, cysteine, cysteine. When two cysteine join, these two hydrogens are removed and they form disulfide bond. And now this dimer is called cysteine, although pronounced as cysteine, but to differentiate, now I pronounce it as cystine. So cystinuria or cystinuria, in this cystine is excreted in urine. So cystine is excreted in urine, not cysteine, because two cysteine join to form cystine. Other amino acid C4 cystine, O4 ornithine, L4 lysine, A4 arginine. And in cystinuria, the crystal are hexagonal. Cysteine, six. So hexagonal crystals would be there. Okay? याद रहेगा? Yes. This one or this one? Yes. So thank you for being there for such a long time. Okay. Mnemonic is cola. Okay. Tomorrow we will start at the same time. We will try to cover most of the topic. कल ही हम खत्म कर देंगे, परसों END होगा हमारा. तो yes, hope you have understood all these complex topics. कल हम फिर मिलेंगे और कल फिर धमाल करेंगे. ओके. B12 और B9. B12 B12 और B9 में यार ये अंतर है. B12 megaloblastic anemia would be there, homocystinuria would be there. In B9 also same, but B12 is also required for conversion of methyl malonyl coenzyme A to succinyl coenzyme A. Methyl means one carbon. Malonyl coenzyme, malonyl three carbon. So 3 plus 1, 4. So 4 carbon compound is converted to succinyl coenzyme A, 4 carbon compound. The name of enzyme is mutase. The name of enzyme is mutase. Yes. And this require vitamin B12 as cofactor. If B12 is deficient, then methyl malonyl coenzyme will not be converted to succinyl coenzyme. Methyl malonyl coenzyme will increase. Okay. तो ठीक है, फिर कल मिलते हैं. गुड नाइट.